συγκινεί, να εμπνέει, δύναμη να ενώνει. Τώρα ο πολιτισμός έχει τη δύναμη να παίξει έναν ευεργετικό ρόλο στην ψυχική υγεία με την καινοτόμο πρωτοβουλία του Υπουργείου Πολιτισμού που ανοίγει τον δρόμο για την καλύτερη φροντίδα, συμπερίληψη και αποκατάσταση των ψυχικά ευάλωτων συνανθρώπων μας. Πρόγραμμα Πολιτιστική Συνταγογράφηση υπό την επιστημονική εποπτεία του Ερευνητικού Πανεπιστημιακού Ινστιτούτου Ψυχικής Υγείας και με τη συνεργασία πολιτιστικών φορέων, καλλιτεχνών και επαγγελματιών ψυχικής υγείας. Μάθετε περισσότερα στο artonprescription.gr. Εθνικό Σχέδιο Ανάκαμψης και Ανθεκτικότητας Ελλάδα 2.0 με τη χρηματοδότηση της Ευρωπαϊκής Ένωσης Next Generation EU. Ο πολιτισμός έχει δύναμη. Δύναμη να αγκαλιάζει, να συγκινεί, να εμπνέει, δύναμη να ενώνει. Τώρα ο πολιτισμός έχει τη δύναμη να παίξει έναν ευεργετικό ρόλο στην ψυχική υγεία με την καινοτόμο πρωτοβουλία του Υπουργείου Πολιτισμού που ανοίγει τον δρόμο για την καλύτερη φροντίδα, συμπερίληψη και αποκατάσταση των ψυχικά ευάλωτων συνανθρώπων μας. Πρόγραμμα Πολιτιστική Συνταγογράφηση υπό την επιστημονική εποπτεία του Ερευνητικού Πανεπιστημιακού Ινστιτούτου Ψυχικής Υγείας και με τη συνεργασία πολιτιστικών φορέων, καλλιτεχνών και επαγγελματιών ψυχικής υγείας. Μάθετε περισσότερα στο artonprescription.gr. Εθνικό Σχέδιο Ανάκαμψης και Ανθεκτικότητας Ελλάδα 2.0 με τη χρηματοδότηση της Ευρωπαϊκής Ένωσης Next Generation EU. Ο πολιτισμός έχει δύναμη. Δύναμη να αγκαλιάζει, να συγκινεί, να εμπνέει, δύναμη να ενώνει. Τώρα ο πολιτισμός έχει τη δύναμη να παίξει έναν ευεργετικό ρόλο στην ψυχική υγεία με την καινοτόμο πρωτοβουλία του Υπουργείου Πολιτισμού που ανοίγει τον δρόμο για την καλύτερη φροντίδα, συμπερίληψη και αποκατάσταση των ψυχικά ευάλωτων συνανθρώπων μας. Πρόγραμμα Πολιτιστική Συνταγογράφηση υπό την επιστημονική εποπτεία του Ερευνητικού Πανεπιστημιακού Ινστιτούτου Ψυχικής Υγείας και με τη συνεργασία πολιτιστικών φορέων, καλλιτεχνών και επαγγελματιών ψυχικής υγείας. Μάθετε περισσότερα στο artonprescription.gr. Εθνικό Σχέδιο Ανάκαμψης και Ανθεκτικότητας Ελλάδα 2.0 με τη χρηματοδότηση της Ευρωπαϊκής Ένωσης Next Generation EU. Ο πολιτισμός έχει δύναμη. Δύναμη να αγκαλιάζει, να συγκινεί, να εμπνέει, δύναμη να ενώνει. Τώρα ο πολιτισμός έχει τη δύναμη να παίξει έναν ευεργετικό ρόλο στην ψυχική υγεία με την καινοτόμο πρωτοβουλία του Υπουργείου Πολιτισμού που ανοίγει τον δρόμο για την καλύτερη φροντίδα, συμπερίληψη και αποκατάσταση των ψυχικά ευάλωτων συνανθρώπων μας. Πρόγραμμα Πολιτιστική Συνταγογράφηση υπό την επιστημονική εποπτεία του Ερευνητικού Πανεπιστημιακού Ινστιτούτου Ψυχικής Υγείας και με τη συνεργασία πολιτιστικών φορέων, καλλιτεχνών και επαγγελματιών ψυχικής υγείας. Μάθετε περισσότερα στο artonprescription.gr. Εθνικό Σχέδιο Ανάκαμψης και Ανθεκτικότητας Ελλάδα 2.0 με τη χρηματοδότηση της Ευρωπαϊκής Ένωσης Next Generation EU. Ο πολιτισμός έχει δύναμη. Δύναμη να αγκαλιάζει, να συγκινεί, να εμπνέει, δύναμη να ενώνει. Τώρα ο πολιτισμός έχει τη δύναμη να παίξει έναν ευεργετικό ρόλο στην ψυχική υγεία με την καινοτόμο πρωτοβουλία του Υπουργείου Πολιτισμού που ανοίγει τον δρόμο για την καλύτερη φροντίδα, συμπερίληψη και αποκατάσταση των ψυχικά ευάλωτων συνανθρώπων μας. Πρόγραμμα Πολιτιστική Συνταγογράφηση, υπό την επιστημονική εποπτεία του Ερευνητικού Πανεπιστημιακού Ινστιτούτου Ψυχικής Υγείας και με τη συνεργασία πολιτιστικών φορέων, καλλιτεχνών και επαγγελματιών ψυχικής υγείας. Μάθετε περισσότερα στο artonprescription.gr. Εθνικό Σχέδιο Ανάκαμψης και Ανθεκτικότητας Ελλάδα 2.0, με τη χρηματοδότηση της Ευρωπαϊκής Ένωσης Next Generation EU. Ο πολιτισμός έχει δύναμη. Δύναμη να αγκαλιάζει, να συγκινεί, να εμπνέει. Δύναμη να ενώνει. Τώρα ο πολιτισμός έχει τη δύναμη να παίξει έναν ευεργετικό ρόλο στην ψυχική υγεία με την καινοτόμο πρωτοβουλία του Υπουργείου Πολιτισμού που ανοίγει τον δρόμο για την καλύτερη φροντίδα, συμπερίληψη και αποκατάσταση των ψυχικά ευάλωτων συνανθρώπων μας. Πρόγραμμα Πολιτιστική Συνταγογράφηση, υπό την επιστημονική εποπτεία του Ερευνητικού Πανεπιστημιακού Ινστιτούτου Ψυχικής Υγείας και με τη συνεργασία πολιτιστικών φορέων, καλλιτεχνών και επαγγελματιών ψυχικής υγείας. Μάθετε περισσότερα στο artonprescription.gr. Εθνικό Σχέδιο Ανάκαμψης και Ανθεκτικότητας Ελλάδα 2.0, με τη χρηματοδότηση της Ευρωπαϊκής Ένωσης Next Generation EU. Ο πολιτισμός έχει δύναμη. Δύναμη να αγκαλιάζει, να συγκινεί, να εμπνέει. Δύναμη να ενώνει. Τώρα ο πολιτισμός έχει τη δύναμη να παίξει έναν ευεργετικό ρόλο στην ψυχική υγεία με την καινοτόμο πρωτοβουλία του Υπουργείου Πολιτισμού που ανοίγει τον δρόμο για την καλύτερη φροντίδα, συμπερίληψη και αποκατάσταση των ψυχικά ευάλωτων συνανθρώπων μας. Πρόγραμμα Πολιτιστική Συνταγογράφηση, υπό την επιστημονική εποπτεία του Ερευνητικού Πανεπιστημιακού Ινστιτούτου Ψυχικής Υγείας και με τη συνεργασία πολιτιστικών φορέων, καλλιτεχνών και επαγγελματιών ψυχικής υγείας. Μάθετε περισσότερα στο artonprescription.gr. Εθνικό Σχέδιο Ανάκαμψης και Ανθεκτικότητας Ελλάδα 2.0, με τη χρηματοδότηση της Ευρωπαϊκής Ένωσης Next Generation EU. Ο πολιτισμός έχει δύναμη. Δύναμη να αγκαλιάζει, να συγκινεί, να εμπνέει. Δύναμη να ενώνει. Τώρα ο πολιτισμός έχει τη δύναμη να παίξει έναν ευεργετικό ρόλο στην ψυχική υγεία με την καινοτόμο πρωτοβουλία του Υπουργείου Πολιτισμού που ανοίγει τον δρόμο για την καλύτερη φροντίδα, συμπερίληψη και αποκατάσταση των ψυχικά ευάλωτων συνανθρώπων μας. Πρόγραμμα Πολιτιστική Συνταγογράφηση, υπό την επιστημονική εποπτεία του Ερευνητικού Πανεπιστημιακού Ινστιτούτου Ψυχικής Υγείας και με τη συνεργασία πολιτιστικών φορέων, καλλιτεχνών και επαγγελματιών ψυχικής υγείας. Μάθετε περισσότερα στο artonprescription.gr. Εθνικό Σχέδιο Ανάκαμψης και Ανθεκτικότητας Ελλάδα 2.0, με τη χρηματοδότηση της Ευρωπαϊκής Ένωσης Next Generation EU. Ο πολιτισμός έχει δύναμη. Δύναμη να αγκαλιάζει, να συγκινεί, να εμπνέει. Δύναμη να ενώνει. Τώρα ο πολιτισμός έχει τη δύναμη να παίξει έναν ευεργετικό ρόλο στην ψυχική υγεία με την καινοτόμο πρωτοβουλία του Υπουργείου Πολιτισμού που ανοίγει τον δρόμο για την καλύτερη φροντίδα, συμπερίληψη και αποκατάσταση των ψυχικά ευάλωτων συνανθρώπων μας. Πρόγραμμα Πολιτιστική Συνταγογράφηση, υπό την επιστημονική εποπτεία του Ερευνητικού Πανεπιστημιακού Ινστιτούτου Ψυχικής Υγείας και με τη συνεργασία πολιτιστικών φορέων, καλλιτεχνών και επαγγελματιών ψυχικής υγείας. Μάθετε περισσότερα στο artonprescription.gr. Εθνικό Σχέδιο Ανάκαμψης και Ανθεκτικότητας Ελλάδα 2.0, με τη χρηματοδότηση της Ευρωπαϊκής Ένωσης Next Generation EU. Ο πολιτισμός έχει δύναμη. Δύναμη να αγκαλιάζει, να συγκινεί, να εμπνέει. Δύναμη να ενώνει. Τώρα ο πολιτισμός έχει τη δύναμη να παίξει έναν ευεργετικό ρόλο στην ψυχική υγεία με την καινοτόμο πρωτοβουλία του Υπουργείου Πολιτισμού που ανοίγει τον δρόμο για την καλύτερη φροντίδα, συμπερίληψη και αποκατάσταση των ψυχικά ευάλωτων συνανθρώπων μας. Πρόγραμμα Πολιτιστική Συνταγογράφηση υπό την επιστημονική εποπτεία του Ερευνητικού Πανεπιστημιακού Ινστιτούτου Ψυχικής Υγείας και με τη συνεργασία πολιτιστικών φορέων, καλλιτεχνών και επαγγελματιών ψυχικής υγείας. Μάθετε περισσότερα στο artonprescription.gr. Εθνικό Σχέδιο Ανάκαμψης και Ανθεκτικότητας Ελλάδα 2.0 με τη χρηματοδότηση της Ευρωπαϊκής Ένωσης Next Generation EU. Ο πολιτισμός έχει δύναμη. Δύναμη να αγκαλιάζει, να συγκινεί, να εμπνέει. Δύναμη να ενώνει. Τώρα ο πολιτισμός έχει τη δύναμη να παίξει έναν ευεργετικό ρόλο στην ψυχική υγεία με την καινοτόμο πρωτοβουλία του Υπουργείου Πολιτισμού που ανοίγει τον δρόμο για την καλύτερη φροντίδα, συμπερίληψη και αποκατάσταση των ψυχικά ευάλωτων συνανθρώπων μας. Πρόγραμμα Πολιτιστική Συνταγογράφηση υπό την επιστημονική εποπτεία του Ερευνητικού Πανεπιστημιακού Ινστιτούτου Ψυχικής Υγείας και με τη συνεργασία πολιτιστικών φορέων, καλλιτεχνών και επαγγελματιών ψυχικής υγείας. Μάθετε περισσότερα στο artonprescription.gr. Εθνικό Σχέδιο Ανάκαμψης και Ανθεκτικότητας Ελλάδα 2.0 με τη χρηματοδότηση της Ευρωπαϊκής Ένωσης Next Generation EU. Ο πολιτισμός έχει δύναμη. Δύναμη να αγκαλιάζει, να συγκινεί, να εμπνέει. Δύναμη να ενώνει. Τώρα ο πολιτισμός έχει τη δύναμη να παίξει έναν ευεργετικό ρόλο στην ψυχική υγεία με την καινοτόμο πρωτοβουλία του Υπουργείου Πολιτισμού που ανοίγει τον δρόμο για την καλύτερη φροντίδα, συμπερίληψη και αποκατάσταση των ψυχικά ευάλωτων συνανθρώπων μας. Πρόγραμμα Πολιτιστική Συνταγογράφηση υπό την επιστημονική εποπτεία του Ερευνητικού Πανεπιστημιακού Ινστιτούτου Ψυχικής Υγείας και με τη συνεργασία πολιτιστικών φορέων, καλλιτεχνών και επαγγελματιών ψυχικής υγείας. Μάθετε περισσότερα στο artonprescription.gr. Εθνικό Σχέδιο Ανάκαμψης και Ανθεκτικότητας Ελλάδα 2.0 με τη χρηματοδότηση της Ευρωπαϊκής Ένωσης Next Generation EU. Ο πολιτισμός έχει δύναμη. Δύναμη να αγκαλιάζει, να συγκινεί, να εμπνέει. Δύναμη να ενώνει. Τώρα ο πολιτισμός έχει τη δύναμη να παίξει έναν ευεργετικό ρόλο στην ψυχική υγεία με την καινοτόμο πρωτοβουλία του Υπουργείου Πολιτισμού που ανοίγει τον δρόμο για την καλύτερη φροντίδα, συμπερίληψη και αποκατάσταση των ψυχικά ευάλωτων συνανθρώπων μας. Πρόγραμμα Πολιτιστική Συνταγογράφηση υπό την επιστημονική εποπτεία του Ερευνητικού Πανεπιστημιακού Ινστιτούτου Ψυχικής Υγείας και με τη συνεργασία πολιτιστικών φορέων, καλλιτεχνών και επαγγελματιών ψυχικής υγείας. Μάθετε περισσότερα στο artonprescription.gr. Εθνικό Σχέδιο Ανάκαμψης και Ανθεκτικότητας Ελλάδα 2.0 με τη χρηματοδότηση της Ευρωπαϊκής Ένωσης Next Generation EU. Ο πολιτισμός έχει δύναμη. Δύναμη να αγκαλιάζει, να συγκινεί, να εμπνέει. Δύναμη να ενώνει. Τώρα ο πολιτισμός έχει τη δύναμη να παίξει έναν ευεργετικό ρόλο στην ψυχική υγεία. Με την καινοτόμο πρωτοβουλία του Υπουργείου Πολιτισμού, που ανοίγει τον δρόμο για την καλύτερη φροντίδα, συμπερίληψη και αποκατάσταση των ψυχικά ευάλωτων συνανθρώπων μας. Πρόγραμμα Πολιτιστική Συνταγογράφηση, υπό την επιστημονική εποπτεία του Ερευνητικού Πανεπιστημιακού Ινστιτούτου Ψυχικής Υγείας και με τη συνεργασία πολιτιστικών φορέων, καλλιτεχνών και επαγγελματιών ψυχικής υγείας. Μάθετε περισσότερα στο artonprescription.gr. Εθνικό Σχέδιο Ανάκαμψης και Ανθεκτικότητας Ελλάδα 2.0, με τη χρηματοδότηση της Ευρωπαϊκής Ένωσης Next Generation EU. Ο πολιτισμός έχει δύναμη. Δύναμη να αγκαλιάζει, να συγκινεί, να εμπνέει, δύναμη να ενώνει. Τώρα ο πολιτισμός έχει τη δύναμη να παίξει έναν ευεργετικό ρόλο στην ψυχική υγεία. Με την καινοτόμο πρωτοβουλία του Υπουργείου Πολιτισμού, που ανοίγει τον δρόμο για την καλύτερη φροντίδα, συμπερίληψη και αποκατάσταση των ψυχικά ευάλωτων συνανθρώπων μας. Πρόγραμμα Πολιτιστική Συνταγογράφηση, υπό την επιστημονική εποπτεία του Ερευνητικού Πανεπιστημιακού Ινστιτούτου Ψυχικής Υγείας και με τη συνεργασία πολιτιστικών φορέων, καλλιτεχνών και επαγγελματιών ψυχικής υγείας. Μάθετε περισσότερα στο artonprescription.gr. Εθνικό Σχέδιο Ανάκαμψης και Ανθεκτικότητας Ελλάδα 2.0, με τη χρηματοδότηση της Ευρωπαϊκής Ένωσης Next Generation EU. Ο πολιτισμός έχει δύναμη. Δύναμη να αγκαλιάζει, να συγκινεί, να εμπνέει, δύναμη να ενώνει. Τώρα ο πολιτισμός έχει τη δύναμη να παίξει έναν ευεργετικό ρόλο στην ψυχική υγεία. Με την καινοτόμο πρωτοβουλία του Υπουργείου Πολιτισμού, που ανοίγει τον δρόμο για την καλύτερη φροντίδα, συμπερίληψη και αποκατάσταση των ψυχικά ευάλωτων συνανθρώπων μας. Πρόγραμμα Πολιτιστική Συνταγογράφηση, υπό την επιστημονική εποπτεία του Ερευνητικού Πανεπιστημιακού Ινστιτούτου Ψυχικής Υγείας και με τη συνεργασία πολιτιστικών φορέων, καλλιτεχνών και επαγγελματιών ψυχικής υγείας. Μάθετε περισσότερα στο artonprescription.gr. Εθνικό Σχέδιο Ανάκαμψης και Ανθεκτικότητας Ελλάδα 2.0, με τη χρηματοδότηση της Ευρωπαϊκής Ένωσης Next Generation EU. Ο πολιτισμός έχει δύναμη. Δύναμη να αγκαλιάζει, να συγκινεί, να εμπνέει, δύναμη να ενώνει. Τώρα ο πολιτισμός έχει τη δύναμη να παίξει έναν ευεργετικό ρόλο στην ψυχική υγεία. Με την καινοτόμο πρωτοβουλία του Υπουργείου Πολιτισμού, που ανοίγει τον δρόμο για την καλύτερη φροντίδα, συμπερίληψη και αποκατάσταση των ψυχικά ευάλωτων συνανθρώπων μας. Πρόγραμμα Πολιτιστική Συνταγογράφηση, υπό την επιστημονική εποπτεία του Ερευνητικού Πανεπιστημιακού Ινστιτούτου Ψυχικής Υγείας και με τη συνεργασία πολιτιστικών φορέων, καλλιτεχνών και επαγγελματιών ψυχικής υγείας. Μάθετε περισσότερα στο artonprescription.gr. Εθνικό Σχέδιο Ανάκαμψης και Ανθεκτικότητας Ελλάδα 2.0, με τη χρηματοδότηση της Ευρωπαϊκής Ένωσης Next Generation EU. Ο πολιτισμός έχει δύναμη. Δύναμη να αγκαλιάζει, να συγκινεί, να εμπνέει, δύναμη να ενώνει. Τώρα ο πολιτισμός έχει τη δύναμη να παίξει έναν ευεργετικό ρόλο στην ψυχική υγεία. Με την καινοτόμο πρωτοβουλία του Υπουργείου Πολιτισμού, που ανοίγει τον δρόμο για την καλύτερη φροντίδα, συμπερίληψη και αποκατάσταση των ψυχικά ευάλωτων συνανθρώπων μας. Πρόγραμμα Πολιτιστική Συνταγογράφηση, υπό την επιστημονική εποπτεία του Ερευνητικού Πανεπιστημιακού Ινστιτούτου Ψυχικής Υγείας και με τη συνεργασία πολιτιστικών φορέων, καλλιτεχνών και επαγγελματιών ψυχικής υγείας.
Καλημέρα σας.
Μάθετε περισσότερα
Καλημέρα κυρίες και κύριοι, παρακαλώ, αν θέλετε πάρτε τις θέσεις σας να ξεκινήσουμε. Καλημέρα. Κυριακή σήμερα, τελευταία μέρα. Νομίζω ότι ήταν ένα γόνιμο τριήμερο διαλόγου, συζητήσεων, αναφορών, κουβεντών. Ήρθαμε σε επαφή με τους φορείς, με τους ωφελούμενους, με τις εμπειρίες μας. Ήταν πολύ ωραία. Είπαμε να δώσουμε λίγο χρόνο, γιατί η Κυριακή είναι η μέρα ξεκούρασης, οπότε όλοι θα θέλανε λίγο παραπάνω να κοιμηθούν. Αλλά δεν θα προλάβουμε να ολοκληρώσουμε on time και οι προσκεκλημένοι μας από το εξωτερικό έχουν και πτήσεις. Οπότε ας καλωσορίσουμε την Μόνικα Όριαν από την Ευρωπαϊκή Επιτροπή, από τη Γενική Διεύθυνση Παιδείας και Πολιτισμού, την Edith Wolf Perez από την Αυστρία. Θα μας μιλήσει για το report της ανοιχτής μεθόδου συντονισμού της ομάδας πάνω στον πολιτισμό και υγεία. Τη Μαφάλντα Φόλκ από το Υπουργείο Πολιτισμού της Πορτογαλίας και την Άννα Ζάο, Υπουργείο Υγείας επίσης της Πορτογαλίας. Υποδεχτείτε τους. Καλημέρα.
Slides. Can we have the slides, please? Yes, thank you very much. Good morning. It is a privilege to be here, and thank you very much to Margarita and Professor Stefanis, who is not here yet, for the invitation to this wonderful event, and congratulations to you all for Art on Prescription in Greece. This really fits very neatly into our topic today, which is the report, Culture and Health, Time to Act. For the last 2 years, I had the honor to serve as a member of the OMC group, Culture and Health, which was established by the European Commission. And even more so, I had the honor to be co-chair together with Margarita of this group, and it was quite a journey that we went on to. So we were experts from across Europe, from all the member states, from the culture and from the health sector, and we were tasked with the single urgent question: how can we bridge the gap between these two essential sectors of our society? So before we dive into the result of the working group and the report, Culture and Health, Time to Act, I would like to give the word to Monika Jurian from the European Commission, who will lay out the European path leading to the expert group and provide an outlook to what is to come on the European level. Monika, please.
Thank you. Thank you, Edith. Kalimera. Kalimera, everyone. Good morning to those who are here and those who are following us online. First, let me say a big thank you, Evcharistos, I hope it's correct, to the wonderful Greek team who organized this conference and who has hosted us in a very, very warm way. It's for sure going to be an unforgettable moment. And to congratulate them for launching at the national level sustainable arts and prescription program. What I have seen in these last few days has been very impressive and very inspiring. And for us from the European Commission, it's so important to come from Brussels and learn with the member states, with cities, with regions, with cultural institutions who are really on the ground, and they talk to people who need cultural participation. So seeing the effect of this on human lives has been quite enriching for me. And congratulations especially to Margarita, who has proven that European funds can be used in a very meaningful and efficient and should I say, brave way. So Greece is showing the way to other EU member states how to find funding for arts and health and how to transform this funding sustainably. I'm going to try to give a brief overview of what we have done and why we are here. I think it's important to look a little bit at the past and also see what is going to happen in the next few years. Just remember that this is a process. So this momentum that you are seeing now here, this sort of almost consensus, I hope that we have, that the collaboration between culture and health sectors is important and that we have to now find ways and tools to implement it has started with COVID. So of course we heard, sorry, we heard also in the beginning of the conference that, I have a quote, that COVID has been the how to say, alarm bell maybe to see that we need culture to survive. We need a, thank you. And this was true for everybody, including for policymakers. But sometimes policymakers have a short memory, so you have to remind them that this is how we managed to survive the COVID era when we were isolated and we were at home with different cultural activities. So after COVID, or even during COVID, we started with European Parliament money to work on this preparatory action, Culture for Health. Preparatory action means we were preparing something. So what we were preparing, this was a moment when culture and health stakeholders came together and they started sharing the message that this collaboration is essential for society. And you can see that this has evolved in different stages. So then the Council of the EU, in different council formations, took this message into account, and there were council conclusions. DG Sante, my colleagues who are working on health, also took the results of this preparatory action into account, and in the comprehensive approach to mental health published in 2023, culture was there for the first time in an EU document on health. Then we started to work on the international dimension of culture and health. So we work with our colleagues from DG ENEST, which is dealing with enlargement in the Eastern neighborhood countries, and we have a regional program for these countries in the Eastern Partnership, also on arts and health, together with our partners from the WHO. And it has been building up, and the member states said, okay, we need we need to have an expert group from the member states to work in a very systematic way, and from every EU member state, from the culture ministries and the health ministries together, and put them around the same table and make sure that they learn with each other, sometimes even in the same country, but of course, especially across borders. And this has been a very transformative process. Edith is going to talk to you about the result of this 2-year process where we met, we saw what are the good practices in member states, we heard from European projects, and the result is this report that you can find online, and that we launched in Mondia Cult. So this was a very important moment because Mondia Cult, it's the worldwide conference organized by UNESCO on culture policies, and the fact that we had the launch of this report on the 29th of September in Barcelona with very high-level representation. So it was presented by our commissioner, Glenn Mikalev, together with the culture minister of Spain, Ernest Urtasun, with representatives from the World Health Organization, UNESCO and civil society. This was a major moment where everybody understood worldwide also that the European Union is a driving force in this conversation. So it was a very motivating force for us to keep going. So very briefly, right after Mondiacult, we published in November last year a Cultural Compass for Europe, which is bringing all how to say, it's a strategic framework that brings what culture means for Europe now and in the future in the same document. So we have in this document 20 what we call flagship actions, and one of them is linked to culture and health. And this is also the very first time when we have culture and health anchored in such a high level, at such a high level in a culture policy document at the EU level. So a lot of first times you hear from me. So basically with the Cultural Compass for Europe, we want to say that Europe is important for culture and culture is important for Europe. So there should be a win-win situation where, of course, the European institutions are doing everything they can to support cultural professionals, artists, writers, creatives in general. And also we try to harness whatever the cultural and creative sectors bring to us, and some of these impacts of cultural and creative sectors are not enough maybe taken into account. And I think the impact on health is one of these where we still need to argue more and bring the evidence that already exists to the knowledge of policymakers. So if you see on this path, we are right in number 2, a union that empowers artists and cultural professionals and supports people. Of course, culture and health is about people, as we heard these last 2 days. And in fact, you can also see it as a tapestry because it's interwoven in all the other key directions. So of course, if you talk about, for example, cultural rights, about cultural participation, artistic freedom, there is an aspect linked to culture and health. Because, for example, censorship affects mental health of artists. A union that champions international cultural relations and partnerships. As I said already, there is an international dimension to culture and health that we are trying to work on with our partners in other countries. So, to be short, because we are going to go to other panelists, I want you to remember that in this key direction 2, empowering artists and cultural professionals and support for people, we are going to work on the EU guidelines for culture that are supposed to be published before the end of 2028. And this is a powerful tool at the EU level to show, again, the member states, the regions, the local level, all policymakers and cultural organizations, what is the thinking at the EU level. And this is all going to be, of course, written together. So you probably know that the EU in culture has only the role to bring member states together. And we fully respect the principle of subsidiarity. So we are not talking here about imposing anything, but really learning from each other and fostering this cross-border learning and collaboration. And then, of course, we will keep supporting what we have done already, which is cross-border collaboration through our main program, Creative Europe, which is the program funding culture and creative sectors in the EU. And in terms of funding, we are now in a very crucial moment where the European institutions are discussing, of course, the next multi-annual financial framework from 2028 to 2034. And this is why this report and the Compass are these policy tools that everybody of us can use in our discussions, trying to influence the results of these negotiations. So, you know, the Council of the EU, the European Parliament, the European Commission, they are discussing how to fund all European Union programs for these next 7 years. So it's important to keep a culture and health element there. To give you an example of how it happens right now, because we don't have funding only from Creative Europe, but we also have funding for culture and health from other programs. The main, maybe the most important one is the Horizon Europe program, the research program of the EU, where we have secured funding for a project starting this year. The call was published last year, Impacts of Culture and the Arts on Health and Well-being. So with these 2 million euros, we will again have this collaboration across borders, and we are going to foster exchange of knowledge, policy recommendations, including in the international dimension, so humanitarian affairs, international cultural relations. And then in 2027, and this is also something interesting maybe for Greek colleagues, I encourage you to think about it, there will be another call for culture, heritage and creative industries for health and well-being, so 16 million euros, and you can apply for this call as you see, from the May to September 2027. So this is what is happening right now. Of course, I didn't talk about all the Creative Europe funded projects, platforms, networks, and so on. Maybe my other colleagues will talk about it, but the idea is that now we have the policy tools with the report and the compass to keep funding this collaboration between, cross-sectorial collaboration between culture and health. And you can count on our support to keep this effort going. Thank you very much.
Thank you, Monica. Let's go and have a look at the report, this beautiful document here. There is a QR code where you can download it directly. Now, we had a mandate from the Council of the European Union, and they asked us not to identify problems or just present the situation, but to move beyond that and to deliver a concrete, actionable plan that would promote a better cooperation between the sectors. And our work wasn't theoretical. It was a deep dive into the evidence and the case studies, and what we found was undeniable. And also, Daisy Fancourt also mentioned it 2 days ago, engagement in culture and participation in the arts is a health behavior, just like sports, a good diet, enough sleep, non-smoking, etc. Everything that's good for us. Well, we can say this with confidence because we have demonstrated that the connection between culture and health is evidence-based, that is substantiated by peer-reviewed studies, internationally supported and recognized by the WHO, and politically viable because it receives broad consensus. Thus, the foundations are laid. The role of culture and the arts on health and well-being is now extensively documented and proven by scientific studies. Here are some of the key documents. I will not go into depth. We have already seen 2019, one of the pillars of research was this WHO report by Daisy Fancourt. And of course, as Monica mentioned, 2023, the Culture for Health report on the European level. We looked at more than 100 case studies from all over the member states, and that there is activity in all the member states, we found out. And one of them was the Creative Europe project, Dance Well. Dance Well is is a practice that brings people with Parkinson's together, and they take them to artistic places like theaters or museums to dance together. And I brought you a little video of that. Have a look.
Dance Well is about connectivity, interactivity, stepping into the unknown, and it's a slow revolution. So Dance Well is about community. At the center is dancing with people living with Parkinson's. But around it, it's about artistry, beauty, building a community together, having encounters, and everyone bringing their skills together. So Dance Well started here in Bassano del Grappa in 2013, and this project, supported by Creative Europe, is going to spread the Dance Well practice into 4 other countries. There are 3 key stages of the project. The first stage is bringing all the dance artists together to develop a practice and go through a training to develop their own classes for Dance Well in each of the localities. The second phase is to create a production, a performance in each locality. And the final phase is to develop a digital publication with all the knowledge and experiences that we collect. At the beginning of the project, all of the dance artists and organizations that are involved in the project have come together to look at what skills they all have and then what can be built by bringing these skills together.
So, why are we saying in this report it is time to act? Because from our research in the OMC group, we found out that the status quo is not sustainable, both for culture and for the health sector. In the culture sector, we found precarious funding situations and the struggle for relevance, the challenge of digital disruption, threats to artistic and curatorial freedom. For the health sector, we'd identified a burned-out healthcare workforce, which is a crisis of human spirit as much as it is a crisis of finances, a detrimental state of mental health, a silent epidemic, especially among young people, the looming burden of non-communicable diseases in the face of an aging population. But the most significant findings that came up again and again was the obstacle in the space in between, the challenges for intersectoral collaboration. They are not just bureaucratic, they are cultural. There is a fragmented governance, ministries that literally speak different languages, an almost complete lack of supporting structures to make collaboration easier, and a systemic resistance to change, a belief that this is the way it was always done. We concluded that these parallel crises are not separate. They are symptoms of the same problem, a lack of holistic thinking. And so our solutions must be interconnected. Because when we intentionally bring culture and health together, we arrive at what we call a triple win situation. We identified in the report 21 opportunities that this collaboration would bring. For the cultural sector, this means new job opportunities and sustainable mission-driven business models for artists, the development of new artistic practices, improved access to culture for new audiences in new settings, a more diverse and resilient cultural ecosystem. For the health sector, this means we have seen direct health benefits, measured reductions in stress, pain, and social isolation, a move towards a more personalized and holistic care, a tangible reduction in drug dependence, crucially reducing the burden of an overworked system and workforce, and finally reducing the stigma by humanizing healthcare. And this is especially relevant to the mental health sector, where it still is the stigma of mental health care. But this synergy has also global ramification. It strengthens social cohesion. It supports our democratic society by fostering shared experiences. It offers meaningful alternatives to screen time. And for every finance and health minister, it is a smart investment in prevention. I have mentioned before that there is a huge consensus in the population. In a recent Eurobarometer survey in preparation for the Culture Compass that Monica mentioned, 87% of Europeans agree that cultural activities improve their well-being. And there is another number which is not so positive. The latest OECD statistics show that the total cost related to mental health issues in Europe exceeds 600 billion euro and accounts for 4% of the GDP. So it is time to act. According to the recent report that also Daisy Fancourt presented shortly on Friday, there is a huge return of investment. If you invest in culture, you have a return of investment. Daisy said it is €9 per invested euro. €1 invested in culture brings €9 of benefits. This is a huge, I really recommend, there is the QR code, I really recommend this publication because it is seminal to understanding the financial impact, and there are still few studies on that, and I would really recommend that every country does this sort of calculation, because we all know money talks.
Yeah.
And also, you know, with every euro that we cut in the cultural budget will have effects on our well-being and on our health, and we should be very clear about that. And we are not alone in this conviction. That is the good thing. Because just last year, the World Health Assembly passed a resolution that echoes our report's core message. It explicitly urges member states to strengthen the collaboration between the culture and the health sectors. And more recently, the WHO launched a guidance on policy and strategic actions to protect and promote mental health and well-being. And also there, culture speaks a role, and I hope you hear more of that in the next panel. Thus, the global community, thus the global community is aligning. The evidence is there. The question we faced, what do we do next? And within the report, and this is at the heart of the report, we came up with a treatment plan. We identified 7 key actions for delivery and implementation. One is to build and implement an EU strategy for culture and health, because we need a top-level framework to align our efforts on the member state level. Establish corresponding national culture and health strategies in each member state, enable intersectoral collaboration and the pooling of resources. This is about breaking down the budget silos as well, not only a communication problem, but also the budget should be broken down. As we see, design and implement concrete culture and health programs on the ground, from community centers to the hospitals, build capacity through joint trainings. We need to create a common language between the culture and the health sector, advocate relentlessly for the value of this collaboration. The story needs to be told. And finally, strengthen the evidence base to keep building our case with robust data. And we have heard now about this Horizon opportunity, so take it on. Now, this is now the paper. The real work begins here. And now we are, how are we doing since the launch at Mondia Cult in Barcelona in September? Let's go through the action plan. With regard to the EU strategy for culture and health, we got good news with the Culture Compass, as Monica already presented. With regard to the national culture and health strategies, we already have good practices in France, Finland, and Ireland. And of course, now Greece joins this round with this wonderful Art on Prescription program, which is a wonderful national strategy to build on. Since the report launch at Mondia Cult, also Spain signed a memorandum of understanding between the health and the culture minister. Arts in Health Netherlands got funding to establish a coherent culture and health field of policy, practice, education and research. And this is done by an NGO in the Netherlands. And there are new developments in Portugal, we will hear shortly. Now, with regards to items 4 and 6, where are we? Yeah. Designing programs, building capacities and advocacies. There are, of course, many initiatives across the member states, but our flagships are now 2 European projects, the Culture and Health Platform and CARE. And you will hear about those projects in the next panel, so I'm not going to go into details here. And finally, strengthen the evidence base. Again, Horizon Europe is one of the possibilities to do that. Now, and here comes the invitation to you, because now this is just paper. Don't let it be just paper. Fill it with life. We want to have it. We want to have these action plans fulfilled. So become part of this movement, this culture and health movement. Advocate for the role. And as Monica said, remind your policymakers that there is such an urgent need to promote this collaboration, because, as Monica said, they tend to forget if it's not on their agenda all the time. And without your initiatives, as I said, we will not get there, so be active. The response from the artist community is fantastic, and from the cultural institution. And some artists really have found a sort of vocation developing their work in the field. At the beginning of this presentation, I showed you a video about bringing people with Parkinson's to cultural places, and now I would like to end this talk with an example of musicians going into hospitals, music care, music group from Vienna. They go into cancer patients to make a personalized music offering to the patients. And they are working in collaboration with music therapists, which is another great collaboration to look into. Enjoy.
Wenn wir am Gang musiziert haben, Genau, das Schöne, was da passiert, ist nämlich, dass Patienten und Personal und vielleicht auch Besucher, die gerade da sind, alle in dem Moment zum Publikum werden und sich da irgendwie auf einer Ebene begegnen.
Da hat man schon schnell gesehen, wer interessiert war und wer nicht. Und es gab auch eine Dame, die eigentlich nie wirklich wollte, dass wir ins Zimmer spielen. Aber sie hat auch immer ein bisschen rausgeguckt. Und dann am letzten Tag ist sie dann doch hergekommen, wo wir am Gang gespielt haben. Und hat sie sich dann am Gang was gewünscht. Und dann hat sie sich den Schwan von Camille Saint-Saëns gewünscht. Und wir Musiker waren so, das haben wir gar nicht vorbereitet. Und dann haben wir tatsächlich, also ich habe am Cello den Schwan gespielt und die anderen Musiker haben dann das dann begleitet.
Es war natürlich eine sehr schöne Rückmeldung vom Leiter der Station für Strahlentherapie, Professor Witter, wie er zusammen mit seinem Pflegepersonal wahrgenommen hat, wie die Musik allein das Pflegeteam entspannt und ihnen eine Abwechslung bietet. Und er praktisch wörtlich dort gefragt hat, ob die das öfter wollen. Und die Antwort war ein klares Ja.
Much. I pass on to Mafalda and Anna from Portugal. Thank you.
Not working. I'll wait a minute. Okay. So thank you very much. Good morning to you all. It's a big pleasure to be here in the Sunday morning. Only the Greek authorities and the Greek Ministry of Culture could bring us here in the Sunday morning to such a huge project. Thank you very much for inviting, and thank you very much for being so inspirational. We have a kind of different situation in Portugal. Everything started, let's say, in a more formal way. Everything started after we were working at this OMC group. We started mapping the country, looking at the country and understanding that there's a lot going on, but where is the funding, who is doing what? So it was quite chaotic. So despite we have this significant expansion of this work, the organizations were very fragmented, ad hoc partnerships. It was really difficult to understand, to have a full pictures. So we needed a more coherent approach, and we decided to start with a national working group on culture and health. So this working group is within the Ministry of Culture only. And because we were asking our colleagues from other entities, and nobody knew what the neighbor was doing. And so all of a sudden, the cinema was very keen and the dancing were very keen. So we are 14 institutions in the national group, and we're starting to design and to think what is going on. We also have an important help. Is not our government. They called me and they said, we want to talk to you because this is the momentum. We have some money, we have a political decision to make, so let's go and start and put it working and going on. So that being said, we are designing the national map and thinking about the national strategy, and we need those community impact benefits, but we wanted sustainability in the projects, because most of the projects are not sustainable. They took place for a year or 6 months, and then they disappear. We don't know where they are. So, and we wanted models that could be replicable and have data collection and evidence-based approaches. So, anyway, institutionally, the government took also recently adopted a law, and this law it was very interesting because it's a reading promotion program in our national service, all over the national service. So it was approved like 6 months ago, and is already going on in the unit, in the healthcare units, and we will start seeing the results at the end of the year. But it involves all our NHS professionals and so on. But going a little bit back here in the national strategy, I forgot to tell, and it's very important, when we had the mapping and when we have all the information, we are going to knock on the door of the Ministry of Health. So we did it already informally. We have very good contacts and friends in the Ministry of Health, but when we are finishing the exercise, we'll go and knock at your door. We need you. Just finishing, I just wanted to give you 2 concrete examples of what is going on there. We have a very important network of museums for inclusion in dementia. This is a huge project. It has already 10 or 15 years, and it was started by the Alzheimer Foundation of Portugal. But we have a lot of national museums working with this, and botanic gardens. It's a kind of social prescription, cultural prescription, melting approach. And then we have this therapeutic theatre group. It's a theatre group that started his activity in 1968. So I would say 57 years ago. And they work together, the health professionals with the health patients, and it's a big success in Portugal. I think they were really pioneer, and I would say they were pioneer in Europe, because it's really a huge project with very good results. So when finishing, looking ahead, what we want, we are really committed to have a national strategy. We learned a lot with all these European projects. This Greek project was something amazing. We were really surprised, like, what the hell is going on in Greece that we didn't know. But we had the information from Margarita and Vasilis. They were a very good element in our working group, and we had already a kind of information, but we didn't know that it was such impactant project. So we look forward to work with you all and with you. And thank you very much.
Hello, good morning to everyone. First of all, congratulations for this outstanding conference and for what you did. This Art on Prescription program is very inspiring for all of us. And thank you for inviting us, of course, also to share the Portuguese, some examples, even if we need, we also need to grow in this field, but it's very important for us to be here, to share, to connect with you. So it's my pleasure, of course, to represent the Portuguese Director General of Health and Ministry of Health, and of course, together with my colleagues, the OMC Expert Group on Culture and Health of the European Commission. So thank you so much and congratulations. Well, I will briefly share with you some of the projects I coordinate in Portugal, which I'm involved in my different roles as Medical Director of the International Center of Arts Medicine, as a researcher and professor of the University of Porto, and also as medical officer and strategy coordinator at the Director General of Health and Ministry of Health in Portugal. And as you will see, they are all these projects are closely aligned with Edith also mentioned about some of our OMC recommendations, but most of them are some local, regional projects. We still need to disseminate them and to build this national strategy. So regarding the International Center of Arts Medicine, this is a pioneer center in Portugal. I founded in 2020. and it is focused on art-based interventions, but also to promote a specialized artist healthcare. So we also care about the artist's health and to promote it. So regarding the art-based intervention, it is focused not only on the treatment and management of different disorders, from chronic pain, neurological disorders. I work a lot with Parkinson patients, with dystonia patients, with stroke patients, but also with musculoskeletal, cardiovascular, and also mental health patients and disorders. So this center it integrates a multi-professional and interdisciplinary team, and we provide multimodal programs, of course, individualized, holistic programs, which also integrate art-based interventions. But we are not only focused on the clinical practice and on monitoring our results, because of course it's very important to drive continuous improvement, but we are also focused on the research, of course, and to integrate the power of the arts to promote awareness raising and health literacy initiatives. So, on the other hand, this center actively brings cultural activities into the hospital settings, enriching the environment, extending culture into new contexts, and above all, humanizing the healthcare spaces through the transforming power of the arts. And we are also carrying out similar initiatives at the Porto University Hospital Center, that is the public hospital where I'm a medical consultant. It is in the city center and surrounded by cultural institutions, so very enriching environment, and we have different protocols with these cultural institutions nowadays. You can see, for example, here, paintings from the National Museum. Here, you can see the National Museum Soares dos Reis that are in the hospital corridors and waiting rooms. We also are launching some tailored programs at other cultural centers like the library. So there's a lot of work to do. Here, we also bring some moments, some musical moments and concerts. This is me with one of my chamber music ensemble, and we are trying to put together health professionals and professionals for cultural sector. So I also would like to share with you another project that is the Cultural Prescribing Consortium of the University of Porto. This is quite new, and it has, I think, 3 years more or less, and in fact it has three main purposes: to bring training for health and cultural professionals on cultural prescribing. And this academic year we are running the second edition of the cultural prescribing course. That is a course of the University of Porto, both for health professionals. We have some training programs for health professionals and other programs for cultural professionals to capacitate them for implementing these initiatives on cultural prescribing. We have already some initiatives, including nowadays is running a very interesting of cultural prescribing for our students from the University of Porto. And of course, we are measuring the effects, the impact. So the research is also another role of this consortium. We organized in the last year the first international meeting on cultural prescribing, and recently we organized another meeting involving all the universities across Portugal to share our model for replication. So I think in the future we'll have all the universities, or I hope, in Portugal working with this, giving training, implementing these programs and measuring them. So, and to finish, I also would like to present you the course I created and lead as professor at the University of Porto. This is called Medicine, Music and Mind, and is integrated in the Master in Medicine. So a course about music, not only music, about culture and health for medical students at the School of Medicine. And of course, one of the aims is to sensitize them to this field because they don't know about it. We don't talk in Portugal still enough about it. To build capacity, to train them, but also we want, of course, to emphasize this translation of the artistic skills that some of them also have, because I'm a pianist, I'm a musician, and some of them are also musicians or dancers. And they thought before that when they start the medical studies, they need to stop it. And now they realize that they can conciliate both passions and they can create synergies between them. And this is another purpose, and this translation to the artistic skills to medical competencies that they are training, that they can train through the arts. The communication, the emotional intelligence, the empathy that is so important in medical field. So, and in fact, we realized because this course has almost 5 years of existence, all year we have different studies that enroll this, and I'm creating a network integrating all these students and linking them to all these projects I'm involved, like with the humanization department at my hospital, giving concerts and other activities. But in fact, what we realized that the engagement with the arts during this medical training has been shown to benefit the students' mental health. The mental health, not only, but the resilience that is important during the academic course, their academic performance, even though, and the performance fulfillment integration with the academic and the hospital communities, enhancing this social inclusion within the academic environment, so, and improving their overall well-being. So the impacts go over this sensitization or this learning how the music works in health. So I think, and it's very powerful. I show you here an excerpt of one of the concerts we organized. All of them are performed by my medical students. The ones who not play or who not dance, they also contribute, talking about, commenting the pieces we play. And so all the students are involved in this. This is a piece from a Portuguese composer, also a medical doctor, and the piece is called Dream. And what I realized here, in this amazing conference, is that art on prescription is not a dream anymore. It's a reality. We have this here, and we should go faster on that. And in fact, I hope that we can expand this around the world and to make arts on prescription and cultural prescription available to all. So we know that culture is a public health resource. It's not a luxury anymore. And we know that it is powerful for us to promote, to improve the health communication, health literacy, clinical training for humanizing the health services. So we have no doubt that culture is a positive health behavior and the cornerstone of individual and societal well-being. Thank you so much.
Thank you very much for your contribution, Monica, Edith, Mafalda, and Anna. You brought a European breeze in our conference, and thank you very much for that. If I make a thought here, is that well-being, health behavior is not only what we found out from the Art on Prescription program that we present here for 3 days, is that it's in Europe, it's something we want, something we see it happen in other countries as well. It's time to act. It's time to plan the future. It's time to make it a national strategy. It's a European demand. Europe, it's a European demand to be in national strategies nowadays. And we all have an agony, if I may say, how to make it viable, how to continue it, how to make it a part of everyday life and not chase it after our, governments and health sectors and cultural sectors. But I think culture is more, willing to dive in to make it happen every day without any obstacles. So we thank you so much for your contribution. Is there any question? Yes, please. Padelis.
Hi, thanks a lot for the presentations. Everything is very inspiring and I think very useful for everybody. But following up from what Ms. Alexamanolaki just said, I would like to ask how we should, probably this goes to you, Ms. Ourian, because you are closer to the decision-making level of the EU. Should we expect to see some kind of reflection of the cultural compass and all this discussion into the new Agora EU? Is it going to be some part of the priorities? Because obviously this, at some point, needs to be connected to some, funding that is required to move on to something that's not happening, here and there, but become, we need a paradigm shift, actually, but we need to start from somewhere.
Yes, indeed. There is no policy without funding. I mean, they are very much connected. Otherwise, it's just a nice paper with great ideas. So this is why it's important to go in parallel. Now, in the area of culture and health, the situation was a bit upside down because there was a lot of practice on the ground, and then the policy framework came, and of course, our colleagues from the World Health Organization came with this groundbreaking report in 2019. So it advanced a bit in an unequal manner, let's say, but I think now that we have this culture and health clearly stated in the Culture Compass, this gives us strength for the negotiations. And if you have seen in the Creative Europe history, if I can call it, in the last few years, we have introduced culture and health among the priorities. So this means that we also gave the possibility to these new projects to be funded. So it's like building a house, you need all kinds of bricks, foundations first, and then bricks. And yeah, I think we can be confident that this will stay. I mean, anyway, the compass is for the next 4 or 5 years, and yes, the Agora EU, you rightly mentioned, is from 2028 to 2034. For the moment, it's very important if you have access to policymakers to bring this priority up. So, as I said, the European Parliament, you have members of the European Parliament that maybe you know, of course, your own governments, and yeah, the European Commission. I think the priorities are quite clear. So I suspect this will continue, but we have to look at all the other programs. This is the complexity of the European situation, because you have Erasmus+, we have lots of projects also funded on culture and health there. You have Horizon Europe, you have projects in the international sphere, international cultural relations. So we have to try to go at the same time, which is, of course, a very difficult task, but it's worth fighting for. Also, if you think about the context of security, preparedness, all the crisis, conflict prevention, etc., this will become more and more important, I hope, in the future, because it's so necessary. Also, if we talk about refugees, if we talk about the link with climate change and anxiety. So it's a vast area of policy work and funding that we have to explore more and more. So this is just the beginning.
me just say something to you, because I have the negotiations of the Agora EU.
And I was wondering, what kind of steps do you think we should take?
Well, I can start with something, and from the perspective of health, I think it's very important to maintain, and you already have it, the projects, the clinical part of it, but also the research, and to project and to public, to make it public, because the research, although it's difficult in this field, because we always need to have the quantitative and qualitative data to show it, but it's very important and give you strength, particularly in the health sector, for them to support and for the funding that is very important in this sustainability of the projects. But you already have a very huge project, I think. And of course, it's just my suggestion, but I think you have something so strong that now you can start looking to other settings and to other disorders, for example, to other fields, not only mental health, because as we know, there is a lot of evidence and robust evidence on cardiovascular experience, but and in fact, I think there are several other fields to explore, so to make this like an umbrella, a Greek umbrella, and with this strong starting point of art on prescription, mostly designed for mental health, but now to adapt it to other settings and other purpose, and also, of course, to think about, because art on prescription is one of culture and health, and there are other ways to look at it and to connect it.
I may say something about from the Austrian perspective. I come from Austria. I think this art on prescription in Greece is fantastic, and at the moment I see that it's only the culture sector that is funding, the health sector also financially involved. And I'm saying that because I have this argument all the time in Austria, and I also have it from the artists that say, oh, now we should finance also all the societal problems of that we have, shall go on top of the cultural funding that is cut. So there is a conversation to be held about also the responsibility of other sectors to recognize the role of culture and the arts.
Sorry. Okay.
Because I'm very interested in this, what you said. Another potential source could be insurance companies, because insurance companies will spend less money on patients. So
on health.
This is a very important. We must also go there.
It's a good idea.
It was a quick.
Yeah, sorry. It's Marlene. Just give me a minute.
Hello. Just a quick question regarding EU policies, and as society has so many crises and fronts to cope with. You mentioned that my question would be very simple. Is there a population sample segment that is more at the forefront of EU policy making, like vulnerable communities, third age, refugees, or there is no priority on any community? Everything could be possible within the funding process?
Well, at the moment, if we talk about the current Creative Europe program, the priorities are linked to the culture and creative sector. So, supporting cultural diversity, supporting the competitiveness of the culture and creative sectors. So, no, we don't have a specific target population because, every project, every cultural platform or cultural network is free to decide what they want to focus on. This is the advantage of our program. If you talk about other types of funding like Erasmus+, yes, their priority is, the youth. So it's very, very diverse. I mean, look, the recovery and resilience funds, they were used for this. It's the only country, to my knowledge, that has done this and very impressive work. And it's an amazing example. We wish, of course, more countries would have done it. But it comes, a lot of it comes bottom up. So in the Creative Europe program, it comes from the sector itself. And in a lot of European funds, it comes from the countries themselves, also regional policy, etc. So we don't really have target groups. We did have in the past, for example, specific calls in Creative Europe for collaborating with Ukraine and supporting the Ukrainian artists and sectors, or for refugees, but these are more, it's a more limited funding. So biggest chunk is really open. That's why you can come with a lot of ideas, and I encourage you to propose projects. And also in the Horizon Europe, it's quite open. If you see the work program for this call I mentioned, that will be opened in 2027. You can propose a lot of things, so you have time to create it according to your needs. This is what we are trying to do, support your needs, not decide for you. Yeah.
Thank you. Yes, please.
Hello, and thank you for this presentation. It was very inspiring for us. I would like actually to say two things. I'm a psychiatrist and musician as you. I'm a singer and composer and also music therapist, and I have worked in both France and Greece. So I would like to share my experience in France, because I have been in the position of organizing concerts for psychiatric hospital patients. And also as a musician, I have participated in concerts, not only for psychiatric patients, but also for patients in oncological departments, general hospital departments, etc. So I think what is very important, as you suggested, is the budget, and the budget coming also from the health ministry. In France, there is a budget in every hospital, psychiatric, oncological, every hospital, there is a budget for art, pure art. And there is also another budget for art therapy. There is one budget dedicated to concerts, expositions in the hospital, and another budget dedicated to music therapists, art therapists, etc. So I think this is really a political decision, and I'm very happy that at last in our country there is such an initiative. Actually, I'm very excited about this. So I would just like to share this experience from France.
Thank you.
Thank you.
Yeah,
Thank you very much.
You can also read, this is one of the good practices in the report, is this memorandum of understanding that the Health and Culture Minister in France have signed. Long ago, in the 1990s, that was already started. Yeah. I also would like to say that there is at the moment we live in a very funny world, not funny, in a very strange world. And there is a lot of Europe bashing going on in our countries. I don't know about Greece, but there is a tendency that, oh, the Europeans, we don't want, the Europeans have nothing to say. On the other hand, I feel that with this report, this has opened really doors in Austria to bring the topic into focus. And we launched this report, and with the first time that a health institution and the Ministry of Culture have worked together to present the report to the public. So the power of a European collaboration should not be underestimated. Even if you hear it's not important at the moment and we don't care about it, it is important, because we can only learn from each other. And this is the wonderful experience I made, and I'm coming from an NGO, I'm not in any ministry, that the OMC is open method of coordination, and it is a way of working together and learning from each other. And that's what I loved about this group, and they were really, apart from the friends that we made, of course.
Yes. Thank you, Edith. One more question, please.
Good morning. Thank you very much for your presentations. I'm Lambrosiotis from the Scientific Arts and Prescription Committee. I've been for a long time involved in therapeutic theatre in Greece, and there are many efforts towards this field. But I am amazed that you said that in Portugal there is therapeutic theatre for over 50 years. And I was wondering how it is supported financially. Is it supported from the Ministry of Health, or from the Ministry of Culture, or from both, or from private funds, or how? So could you tell us a bit more about this, this effort of therapeutic theatre in Portugal?
Yes, of course. It's very interesting because it started like everything started when you have a passion. So we have a curator and a scenographer that was very keen of mental health issues. And so we decided to start this work in a very informal way in 1968. And then as the project has grown, the Ministry of Culture started funding it, and the Ministry of Health started funding, and also the municipality. So they have several funds. It's not major funding because it's, let's say, they have in stage like 15, 20 people, but it's still a medium important project because they have 2 or 3 times a different place every year. So it's huge work. They have to have the 2 scenographers contracted. It's a huge team, medium-sized team, and but the municipality also pays, and they have a free space to work, and the ministry has a special line for that. It's not huge, you understand? It's not like 1 million, or, but it's enough for them to cope and to go on in the project. I'll give you more information. I'll send you if you want to. Okay, thank you. Thank you.
Thank you very much.
I also would like to emphasize what Edith said about this OMC group, because it was also very important for Portugal. Because as I told to you, most of these initiatives, they were already happening. Some were from 2020, other had more time than that. But in fact, now our ministry, and mainly, particularly the Director General of Health, it's looking for this national strategy and supporting us. So we hope in the future. So nowadays, not the future, but we want to start to collaborate from now, and this is the momentum, as Mafalda said, and the OMC group created the momentum for Portugal, and I believe that created momentum for all the other countries within Europe. So let's start looking for that and taking advantage of this momentum.
If I may add as a conclusion, future is now, then. Time to act.
Yeah.
Thank you very much to Edith, Monica, Mafalda, and Anna.
Ένα. Ναι, γεια σας. Λοιπόν, ξεκινάμε. Αν θέλετε να έρθετε για το επόμενο session. Ξεκινάμε σε 1 λεπτό. Head of Culture and Health. Also, we have changed the order. So first it will be us speaking. Yeah, the order we're sitting. Λοιπόν, ας ξεκινήσουμε το επόμενο session. Έχουμε τρεις εκλεκτούς εκπροσώπους μαζί μας από όλη την Ευρώπη. Τους έχετε γνωρίσει, αλλά θα τους συστήσω. Είναι η Cornelia Kiss, Head of Culture and Health. Ο Niels Fichte, Regional Advisor, WHO Europe Culture, Head of Public Policy in Europe. Welcome.
Thank you.
And Professor Vicky Karko, who you heard the first day of our conference, PhD, MD, MED, PGDIP, and so forth and so forth.
And many other letters.
And many others. Arts and Wellbeing, Edge Hill University Director, Research Center for Arts and Wellbeing, leading international expert in arts, health, wellbeing, and cultural prescribing. So welcome to you all. So we're going to have an interesting discussion, and we're going to be beginning by three presentations from you, beginning from Niels, followed by Cornelia, and finishing Professor Vicky Karko. And after this 15-minute presentation, there will be a discussion from all participants. So great. Would you like to start?
I'd love to. I have a presentation. I don't know if this works already, but we'll I'm sure, sort it out in a second. I just wanted to say, before I begin, I just wanted to say thank you so much for the invitation, for the opportunity to have witnessed and listened to all the amazing things that you've done over the last few years. It's just been wonderful. I've been aware of it, I've followed it, but I haven't known the detail, and it's all about the detail. It's all about the stories, the examples, and they have been wonderful. So thank you so much for the invitation. I think it's Sunday. It's you know, we're drawing to the end of the conference. The good. I feel pretty relaxed. I feel like I've gotten to know you all. I'm not as nervous as I might have been if I'd opened up the conference. On the other hand, the downside is I think you probably heard everything I'm going to say. You've already heard. So that's a little bit of a caveat. Maybe I'm going to put it in a new order, and at the very least, I'm going to re-emphasize some of the important points. So, for those of you who don't know me, I work at the WHO Regional Office for Europe in Copenhagen. I was part of the team that put together the report that's been quoted a few times here in 2019. And over the years, this field has grown and gained a huge amount of momentum, to the extent where arts and health or culture and health is a large part of what I do now. So I want to start off this presentation with a quote from our Director General, Dr. Tedros. And the quote is that he has said publicly that the arts can be a powerful ally in our quest to improve health for all. And I think what I've really found wonderful in this conference is that vocabulary, that language, I think, is language that we're all sharing. We're not we're not overclaiming the role of the arts. We're not saying that the arts or that culture is going to solve everything and all we need to do is sing and dance. But we are making the important point that it can be an ally to traditional medicine, to our kind of biomedical approach, and that it's not just a nice to have, but that it's a necessary ally, and particularly if we want to reach health for all. So I think one of the wonderful things about this conference and other conferences that I've been to is that I think we're beginning to speak the same language. We're all beginning to use the same phrases, the same ideas, and that is a powerful force if we want to move together forward together. So as I said, I'm unfortunately not going to be telling you, I don't think, much new stuff. But I do want to kind of reiterate some things. If we're speaking to policymakers, and there are still a lot of policymakers who need to be convinced about the role of arts and health, the importance of culture and health, the dynamic between the two, there are, I think, a handful of really important points that need to be stressed. Now, the first question is always about the evidence base. And I think the evidence base is a bit of a straw man. It's not really something that policymakers are necessarily that interested in. They want to know there's evidence, but often it's just a way to say, I'm looking for a reason not to do something, and I'm going to claim there's not enough evidence. But what we've heard over the last few days, what we've heard over the last few years, is that the evidence is strong. So if you encounter that, I asked Daisy this question once. I said, what would you say to a policymaker who says there's not enough evidence? And she said, well, then you don't know the evidence. You don't know what there is. And I think that's an important progress that we've made over the last few years. We're about to publish a Lancet series on arts and health together with the Jameel Arts and Health Lab. And for those of you who don't know, the Lancet is the kind of preeminent medical journal probably in the world. And the fact that the Lancet journal commissioned us to write a series on arts and health is, I think, a very solid and very important tick of approval. Now, we've also heard about the health economics. Again, this is a figure that's been quoted a few times. It's UK-based, so the idea that associated gains to the UK economy from improved health, well-being, and productivity can be estimated at around £8 billion a year. Those are powerful figures. They're contentious figures. They're not clear-cut figures, and it's not as simple as saying here's the amount and this is a definitive number. But these are the kind of conversations that happen in the public health field. What is the return on investment? What is the social return on investment? And we're now beginning to get numbers. We're now beginning to get figures, and they're looking good. And I think over the next few years, we want to multiply those kinds of reports. The complicated bit has already been done. The methodology has already been constructed. Now it's about taking that methodology and applying it in different national contexts and getting some kind of sense about how much arts and cultural investment saves in relation to health and well-being. We've also had this statistic quoted to us before. And again, I would argue that this is probably one of the most powerful arguments to policymakers. It is what people want. 87% of Europeans, 89% of young Europeans understand and value the connection between culture, arts, and health. And I think this isn't rocket science. I think we've all had that experience. We can all relate to how the arts, to how cultural engagement has had an effect on us, on our bodies, on our minds, on our moods. We understand this connection very well. And the same is true for policymakers. Policymakers are human beings. Policymakers go to the theater, watch a movie, listen to a song. They have the same instincts and experiences, and it's very relatable. It's much more relatable than some of the more complicated biomedical conversations that you might have where you really have to be a specialist or an expert. I think this is one of the key important factors of this space, is that it's understandable. It is really understandable and relatable. And it is what people want. It is also what public health needs. I think that's a really important part of the language puzzle. So let me explain what that means. Public health is in a space now where more and more we've moved away from the biomedical model, this idea that everything can be solved through a vaccine or a pill. More and more of our everyday health challenges are complex health challenges. They're non-communicable diseases. They're problems that are multimodal. They have a lot of factors involved, and there's not one single thing that's going to help solve them. So we need, with our complex health challenges, we need complex health interventions, interventions that work on multiple levels. And the public health field, the public health world has recognized that. About 20 years ago, Michael Marmot introduced the social determinants of health to the world, this idea that where we live, where we're born, where we live, and where we die have tremendous impacts on our health, much more so than our genetics, say, or the bacteria that we encounter. And that concept has led to something called the biosocial behavioral model, right? So the idea that our health is impacted biologically, it's impacted socially, and it's impacted behaviorally. And that has moved public health into domains that we have not talked about much before. One of them here is a quote from the WHO Commission on Social Connection. It's a report on loneliness. Loneliness was not something we thought of as a public health issue up until a few years ago. And now we realize that 871,000 people die of loneliness every year, and it's very much a social health issue. But what is biomedicine going to do with that? We don't have a pill against loneliness. We can't give you a vaccine against loneliness. This is the domain of culture and health. This is where we can help. And I think the table, the seat at the table is there. We just have to sit down. Now, just as a quick aside, we're trying to take all that information and provide some guidance. We published policy briefs in the past. We're looking to we published one on the need of intersectoral action. This is from a few years ago. We published a policy brief on forcibly displaced people and how the arts can contribute and support in those situations. We're preparing one on the intersection between climate, arts, and health. I'm hoping to launch it on the 29th of April. So that's put that in the back of your mind. We haven't publicized it yet, but we're looking to launch that on the 29th of April. And we're also producing a policy brief on youth mental health and the arts. These are big pieces of work. They involve lots of people, and they're ways for us to try and segment the public health space and to try and show how arts and health can feed into the big problems of our times. So forcible displacement, climate change, youth mental health, they're all really important public health concerns at the moment. And they're all places where, as I said, the arts have a seat at the table, and we need to sit down and talk about it. So this is my last slide. I'm probably breezing through this a little bit quickly, but there are a lot of very important documents, including the OMC report, that have a lot of really good, really detailed recommendations to give. And Edith talked a little bit about those in the presentation before. So I don't want to reduce the presentation to just 4 recommendations. But I think there are the four recommendations that I'm going to talk about are the things that I think are really crucial. One of those is to do with building a national strategy. I think you've done amazing work in Greece in getting recognition, coming into the systems, kind of being part of the health kind of ecosystem here in Greece. But I'm not sure that there's a wider strategy yet. And I think that's critical if you want to remain relevant between election cycles, right? That if you want to make sure that arts and health is embedded, that arts and health and culture and health is something that has a future. So one of the key recommendations from the OMC report, and something that I absolutely think is critical, is to begin those discussions between the cultural ministry and the health ministry to develop a joint strategy. And it's in that space that you build bridges between the people who will stay between election cycles, right? It's in that moment that you have conversations about how you can work together. And that's how policy is made. It's made by people who are working together, who know each other, who can call each other. And right now, that's the big problem, I think, with arts and health in many countries, that the people who work in the two sectors, they don't know each other. They work in different buildings. They just have very little interaction. So building a strategy together is a way of cementing your relationships. Institutions, I think, are super valuable. Finding a place that can be the locus for arts and health, for the engine room behind the arts and health momentum. Yeah. I imagine this already that is already crystallizing in Greece, but I think it needs to be formalized. I think it needs to be a place that has the kind of arts and health lobby power, right? An actual physical space that hopefully also is jointly supported by both ministries, that can take this topic and continue supporting it through the years. Somebody once told me a quote, which is, "What doesn't get measured doesn't get done." It's one of these famous public health quotes. I hate the quote. I think it's terrible. But there's a certain reality around that quote. There's especially in bureaucratic institutions and governments, you have to monitor and evaluate what you're putting money into. And I think we're getting to a place now, especially with some of the work that we were hearing earlier about how cultural engagement is a public health activity, is a public health good, that we need to integrate that into our monitoring frameworks at the national level. We need to put in questions into our household surveys that allow us to connect people's cultural activity with their health outcomes. We can already do this through other worldwide surveys, through other large data sets and cohorts, but we need to be able to do it in a more granular level, and it needs to be part of, ideally, every single country in Europe, so we can say very clearly what the effects are of going to cultural events, of engaging in culture, what the effects are in terms of health. So monitoring, I think, is something that we really need to move into. And then last, but certainly not least, I have a picture here of an intervention called, or of an activation called Healing Arts. It's a series of celebrations globally around how the arts contribute to health. And I think this is really the USP of culture and health. We are working with people who are artists, who are creative, who can generate passion, who can generate interest, and we need to mobilize that for our cause. We need to celebrate the arts and health as much as we need to research it. And I think public engagement is a critical part that we are incredibly well placed to tap into, because it's what people want. So that's my presentation. I'll leave you with a final quote, something that I try to build into all presentations that I give these days, because I think the evidence is there. And that is that an investment in culture, an investment in the arts, is also an investment in health. Thank you.
Yes, thank you very much. Also from my side, huge congratulations for what has been achieved so far with art and prescription in Greece. You kind of like, in the Autobahn, you are like, I don't know how do you call it when you go, the car goes from...
Overtake.
Overtake, yes. You're overtaking so many countries like this. It's incredible, really. And I know that it has been a lot of work, and it's also so important that also administratively you've been following it up. And I think also the value that how in this project the psychologists and the cultural sector was working together, how much you learned from each other and how much you also inspired. And if there are still some people from the mental health field, other than you, of course, here in the audience, please make sure that your voice is heard in the mental health field, so that also the health side is taking the fair share in scaling up this initiative and also financing it in the long term. It's really important. I just wanted to tell you a little bit about where I'm coming from and why I'm sitting here on the stage a bit. So we are Culture Action Europe. It's a European cultural NGO. And we are a major European network of cultural networks, organizations, artists, and researchers. And because we have so many networks also in our membership, we kind of a little bit a representation of the cultural sector towards the European institutions. And we kind of see our role as a translator. We decode what the European institution language is saying, and we encode what the cultural sector would like to have on a European cultural policy and try to kind of translate it to a policy language of the European institutions. And just to give you an example, this is something that came up in my mind just yesterday talking to Nicholas Yatramanolakis, who started and basically put in the application for the Recovery and Resilience Fund for this arts and prescription project. How actually our work is connecting. Because in COVID, of course, policymakers started to be sad about the transport sector losing their job, the tourism sector losing their job. So we really had to be there and say, hey, but the cultural sector has also lost their job, and they don't even know how to get funded during this period, because they were all self-employed or half-employed and in the gray zone working, and they can't show you any contracts why you should be kind of supporting in between them. So really there was a huge issue Europe-wide for the artists and the cultural sector. And so we were quite loud about it, and 110 pan-European networks, cultural networks, called the European Union to dedicate at least 2% of the recovery and resilience facilities, so the EU fund that was supposed to take out the countries after the COVID-19 from the situation. So we said at least 2% should go for culture. And this claim actually was inputted then into the resilience facilities regulation, kind of encouraging, not imposing, but encouraging member states to have earmark at least 2% of their budget to culture, which actually probably helped the Deputy Minister of Culture to make a case for culture within the huge budget that Greece would be applying for towards the European institutions. So it was very interesting realization, actually, yesterday, how all this is connected. And of course, another connection is Niels kind of from the WHO side commissioning this WHO 2019 report, which turned out to be found on the internet through a desk research by the Deputy Minister of Culture. So I think it's also very interesting to see how all these are connected. Another thing that we very heavily advocated for is when we got to know also towards the end of COVID, EU citizens were saying to the European institutions, we need an action on mental health. You have to do something about mental health of people. Actually, in half a year, DG Santos, so the health side of the Commission, were told, okay, now you have to make a comprehensive approach to mental health communication. So also chapeau to them that in half a year they made that happen, but in the first draft, it was all about businesses, physical activity was there, but nobody thought about culture regarding the comprehensive approach to mental health. So it was a heavy, heavy advocacy, actually, from our side, being thrown out the door and then coming through the window to make sure that culture, in the end, was mentioned 7 times in the EU communication, the European Commission communication. But what is more important, I think, is the EU Council conclusions. What is the difference, huh? The difference is that each and every EU member state agrees on its text. So it means your Minister of Health has agreed to this text, which says that participation in cultural activities can boost the overall mental health and well-being of people and reduce the risk of mental health conditions, and invites member states to implement mental health across all policies, such as access to culture, and strengthen the protective factors of good mental health, such as culture. This has already been shown by Monica, so I'm not going to say, but there were actually several other council conclusions that we tried to input this cultural element, actually. And one thing that I maybe still would highlight is the Council conclusion on promoting and protecting the mental health of children and adolescents in the digital era. So the fact that how digital is affecting the mental health of youth. And there we were actually quite lucky that through Sweden, also they kind of implemented and showed how alternatives to screen time, other things to do, is not only physical activity, which was again first the text, but also cultural activity. And of course, they don't even talk about the additional, what was all thrown in this research, how additionally, it's good for your mental health. It's not only just alternative, but we're already happy that it's mentioned. Why is it important to be mentioned? Because then you actually can get, if the policy document has it, then you get access to funding. If you don't get mentioned, then you might not actually get a possibility for funding your cause. Here again, many people have shown this already. Our journey started, well, it started earlier, but let's say I start from the Culture for Health project that was mentioned earlier, the EU Preparatory Action. And the Culture for Health report has been mentioned earlier, but I want to talk a little bit about that. We have a project database which has already more than 850 projects across Europe, but actually across the world, where we are collecting culture and health projects. And this is used by WHO, by researchers, but it's also very good to see what other countries have done. It actually has a good working search engine. So for example, if you're like, I want to make a project with theater and youth, you can actually put theater and youth in there, and then you get all the projects that we know of across Europe, and then you can learn from them. Talk to the person who has been doing it. Learn from the others, because we don't want to reinvent the wheel. It's much better if we start from a knowledge from much higher. We shouldn't commit the same mistakes, and this database is really helping it, and we continue to feed this database until 2028. So if you are here doing a project on culture and health, please do submit your project. Here is the findings of the Culture for Health report. First, I thought to delete it from my presentation because you know it anyways. But I think it's also quite nice to actually see what you have been receiving as results, how it is also kind of was confirmed through other studies in a little bit different way presented than in the WHO report, where I think the Culture for Health report a little bit helped to move the discussion towards culture and community well-being and culture and subjective well-being. The word self-expression and empowerment, as taking out from studies, was there as well. So this was more just, you know about all this, but I think it's interesting. Another thing that maybe the Culture for Health report had an effect on is this move of like, is it arts and health? Is it arts in health? Is it culture and health? And the reason we went for culture and health is because museums, cultural centers didn't feel they are arts. They were putting arts out in a museum, but they said, but I'm part of the cultural sector, I'm not on the arts sector. And then there is this, actually, this difference between words of what culture means in the UK versus what it means for international English-speaking people. In the UK, it's more about the way we do things, and it's still the way we do things as well. But if we want to, address the ministry, it's not the arts ministry, but it's the cultural ministry. So that's why I just wanted to share this anecdote a little bit of how it goes, how it went into this cultural engagement. I'm happy that you are also starting to use the word culture and engagement. While I understand for research it's not helpful because arts engagement
too wide and unshaped, right?
Yes, I totally understand. But it's not important, so we were kind of, I think it was part of your slides, kind of showing all the names that we have for this field, and that's fine. Another thing that the Culture for Health report had is policy recommendations. And we took our own policy recommendations on board. And the policy recommendations was actually a development of a bottom-up process through three major consultations, but a lot of online consultations as well, talking to experts, policymakers, practitioners, the cultural field, lots of consultations, and it kind of like laid the foundation a little bit of what needs to be done, mostly on EU level. And the recommendations that are kind of circled around, we said there needs to be financial support, training, there should be a dedicated platform. We are very grateful that we managed to put together a set of here I'm going to show you a set of organizations to form a platform called Culture and Health Platform, which is, I think, 15 organizations in 13 countries. Oh God, now oh good. In 13 countries. And we thought it's an excellent opportunity to basically make sure that we learn from each other. There are so many differences across countries, and we actually wanted to make sure that this knowledge is transferred, and therefore we basically created with the Creative Europe Platforms funding a 4-year-long project called Culture and Health Platform, and its aim is to support artists specifically in the interprofessional space of culture, health care, and social sectors. So the aim is to support minimum 200 artists in these 4 years. In year 1 only, through our online activities, we supported over 1,000 over 2,000 artists benefited from some way from the platform, and I think 56 artists were supported through calls. And some of you might have actually even applied to the recent European call. I think Greece was like the 4th or 5th country applying most to that call. And what it actually does, it actually provides this financial support. It's project by project, remains project by project, but we also wanted to see what type of projects are coming in, and we are specifically looking for projects that create a difference, not a one-off, but who have a potential for scaling up. So, for example, at the time of application, we require that there is also a letter of cooperation with the non-cultural side, let's say. Depending on the country, it can be a different level, because we really take into account the context of the country itself. But on the European call, it was very important that the partnership is strong enough so that it has a longer lasting effect or potential for being longer term funded. And we do capacity building activities, and here it's free of charge online. I'm going to share with you towards the end of my presentation some of the, usually they are 1 hour, 1.5 hour trainings online. And also we have these artist roundtables, which actually more experienced artists share what they do, and then also there is a discussion space as well to share what you're doing in this space. So we kind of acknowledge the knowledge in this country, in this space, by the culture and health professionals. And yeah, we have, our role is to increase the visibility of this field, so we organize, of course, conferences on this, and we also try to make awareness-raising webinars for the health sector specifically to increase the demand. And for example, that's when maybe some of the health people you should send to these webinars so that they get persuaded, let's say. And yeah, Niels Fitje is very often featured on these webinars. I just wanted to say why also Culture Action Europe felt that we really need to be part of this field. Because in the beginning it was all about, a little bit more about research of like, does it work? So it was a little bit research-led. And the artists were not necessarily always taken into account to the level that maybe they should have. And now we have enough evidence to start implementation, but we should make sure that what we implement is good for the cultural side and the health side. So there are numerous challenges in this field, and we are there, of course, to make sure that it is done in a way that is good for both sides. And we, of course, also contributed as external experts to the Culture and Health Time to Act report. Also, Niels Fietje was there as an external expert. And yeah, I'm not going to read out because also Edith was already talking about the 21 opportunities that we kind of identified. But what I want to highlight here a little bit is that the health sector is in a transformation, and if it's not, it should be in a transformation because there is aging of the population, rising number of people with dementia, a rising need of long-term care, mental health crisis, so there are a lot of issues coming towards us, and this, in the Culture for Health report, you have actually quite nice data there also to argue towards your policymakers, because we have 8 challenges listed there, which kind of gives data of like, we can't continue the way we do things. And because health is in this transformation, they are, of course, very much acknowledging that prevention and early action is the way to go. And therefore, that's, as you were also rightly saying, investment in prevention is actually, of course, saving money for them. But how we do that is an important factor. So, yeah, again, learning the language of the other sector is there. And I think early action and prevention of secondary diseases, because often we deal with people who already have a disease, let's say like Parkinson's, but if they are not given the opportunity to strive, then of course they can develop depression, for example. So it's also a little bit of like prevention of secondary diseases. So, or cancer patients, the same thing. So instead of getting to a level where the whole society is burnt out, we have to act now, as we said. Here again, the recommendations, and I want to reiterate what also Niels was saying, how important it is actually to have a national culture and health strategy, also because in many countries, they inputted the culture and health field in the culture strategy, and then you have the health strategy, which is maybe at a time at another time, or most probably is actually having a different cycle than the cultural strategy. So if you have a national culture and health strategy, then when the health strategy is expiring, that's when you can say, hey, but there is this document, you have to put this in. So it's also a bit of a long-term possibility to assure sustainable way of talking about this topic. Yeah. And then, of course, the Culture Compass is there, which was also mentioned by Monica already, which has a specific action to develop EU guidelines in 2028. Nobody knows how these guidelines should be looking like, but that's actually an opportunity for us to shape it. And this is how a continuation of, in some way, the OMC group would be wonderful. And I was also asked by Stefanis to tell a little bit what other member states do, and also Edith was kind of already covering this a little bit. So in Finland, there is actually a national knowledge center on arts and health called Taiki Sudan. And there are arts and prescription possibilities there. But to be honest, they are actually now going a little bit down, let's say. And for example, this knowledge center has to apply for a funding every year, which is not really helping them. Just when they finish it, then they can do it. But I think also development of such a space, and I think through these committees that you have established, there can be a natural way of continuing this. In the case of Denmark, arts and prescription is in a lot of places and also in Sweden, but mostly on regional level. And there are countries who are piloting arts and prescription. In Lithuania, for example, it was a piloting by the Ministry of Culture, a little bit similar way like you. They also did the calls to their institutions. And in Portugal, there were pilots, Austria, Netherlands, and so on. Now, we were talking about France. I don't know where is the lady who mentioned it. Indeed, it's very interesting how they approached it from the cultural rights point of view, that everyone had a right to culture, therefore also the people in hospitals, and therefore also the people who are in care homes. So it is an absolutely normal thing for artists to go into care homes and hospitals. But more from a cultural rights point of view, but actually having the same effect that we are talking here as well. In Slovenia, they already put culture and health in the national cultural strategy and health strategy to come. And yes, of course, we should definitely mention the huge inter-regional project called Arts and Prescription, which is in the Baltic, which just finished in the Baltic region. It has developed an arts and prescription guide, which might be good to look at, because it's actually a different arts and prescription than in the UK a little bit. Because in the UK, of course, there is, I think I have it, it's a little bit of an entrepreneurial artist model, and a lot of times it's on the voluntarily basis. Yeah. So they are assigned to activities which are done on a voluntary basis, which again gives no income to artists, and it's not really sustainable. So actually, probably the Central Denmark region, or the the Denmark region is the Denmark model is a little bit better because they really want to make sure that all actors are fairly paid, and yeah, on the long term, you still have to pay rent, so it's not an option really just to have all the time voluntary activities. Also in the UK, you might know that they have so-called link workers. So the health sector is paid by, the link worker is paid by the health sector, but then the cultural organization is paid by the cultural sector. I understand you're not having a link worker in this model. Which we should not underestimate, let's say, the work that is needed at the ministries. And ideally, we should have a person responsible, of course, not only in the Ministry of Culture, but the Ministry of Health. You really need staff to manage all this, and think of that in the future as well. So I put in, I don't know if I should have it part of the discussion or not, but let me just see it closer. So I was thinking a little bit about the Greek arts and prescription model. One of the things that I really, really like is that you work with institutions that were already there. So it was a call to already existing cultural organizations who were doing it. So it's not an entrepreneurial model, which is actually a nice one, and I must say it's excellent work that is happening in the UK, but it's also, from policy point of view, probably very costly. It is more costly than using, let's say, the existing infrastructure that is there. But maybe I'm happy to have a discussion on this. And also, we should not forget how cultural institutions want to make sure that they are inclusive. They are actually required to make sure that they are not only just serving the upper class, let's say in the case of an opera house or a concert hall, and that there is this, it was listed as what part of the win-wins, let's say, how actually bridging these two can lead to synergies, let's say. Another thing that is important, of course, if we really want to scale it up, we always talk about, okay, that also the culture budget should pay for it and the health budget should pay for it. And then, of course, the health budget is very, very, there are cuts there, incredible cuts there as well, and we totally understand. But we should also think about the scale of the culture and the health budget. It's like, like this, yeah? So sometimes when they say, oh, yeah, we want to touch my health budget, I also have all these issues. But then if you say the amount you actually need is like, it's peanuts from the health point of view, health budget point of view, just because of the size of the scale difference. And of course, again, reiterating how important to have early action and preventative measures, that you're actually investing in culture and not not kind of like it's a good to have. Oh, it's not a good to have, because you're on the long term kind of preventing possible future secondary diseases like depression. Then another thing that I was thinking about is the capacity building and the co-design phase. It's really great that psychologists and the cultural sector were really working together in designing these interventions. Yeah, there was also one intervention, how you can think about co-designing also with the beneficiaries, how they liked it. And now you actually have all these beneficiaries sitting here, or we should rather say participants, because beneficiaries are also the ones who were doing it, how they can also be part of the follow-up of this process. Then I had a thought about the fact that it's actually now, the idea is that the psychiatrist can prescribe these activities. And there is a bit of an interesting thing, like you have really dealt with people who have schizophrenia and so on, so really on the on the hard part, let's say, and how early action is not necessarily possible if you prescribe it through psychiatrist, because by the time a person gets to psychiatrist, then the problem is big, let's say. So also it would be very nice to complement this arts on prescription with at least an awareness-raising campaign for general population. Like make sure that you go to museum at least once a month, because then it could be good for your health type of campaign. We actually have a campaign that is possible to adapt. We can talk about it as well. And maybe it's already happening, but it would be wonderful if the organizations could get into, the cultural organizations where these things are happening could get into a peer learning network, so they also learn from each other. Maybe it's already happening, but just saying that it would be very beneficial probably of not redoing. So on EU level, what's coming up? We were mentioning the 2028 EU guidelines on culture and health, and we mentioned that the OMC report, there could be a new OMC group talking about this, but also it was mentioned also by Monica that there was a horizon which was helping to establish a stakeholder platform. This is run by Turku University. It's going to start in June. And also, actually, Daisy Fancourt's University College of London is also part of this, and Culture Action Europe and many other universities. It's going to be called European Culture and Health Hub. And it's actually bigger than the platform I'm explaining you. The previous Culture and Health platform was on artists, and in this platform you would have the cultural organizations, and then you would the health organizations, policymakers, practitioners, and researchers would all be part of this platform. And we also try to figure out what to do, because nobody has been there, so it's also a good way to see what are the best practices across countries and what to learn from each other. This, I think I will skip. I wanted to show you a campaign that we have done in the context of the CARE project. It's called More Arts, More Wellbeing. This is an awareness-raising campaign for general population. You could consider adapting it, or at least copying some of the text and so on, because we try to make sure that also general population knows that, okay, so now if we talk about health, then I should do physical activity, I should go and do sports, and we should really make sure that every person knows about the fact that, okay, I should really do sports, or I should go to the cinema, or I should do some cultural activity myself, and ideally in a group setting, because that also ticks the loneliness part that also Niels was saying. But think about, as a cultural organization, the power you have. For example, if you have a museum, maybe there are these screens which kind of shows your program. Why don't you add one more slide? You have to have 2 hours per week a cultural activity. And let people know that that is actually the dose that has been calculated in Australia. 2 hours of engaging in culture is linked to better mental health and well-being. So think about your tools that you can let people know, and maybe that's one of the ways. As I say, in museum, in a cultural center, just let it run part of your everyday show, and you can use this, or you can use whatever you develop. Yeah. So hopefully last slide, what you can do, awareness raising, and sharing your project in the Culture for Health support, and also this media campaign. And last things that are coming up in the Culture and Health platform, you can see here some of the training activities. So it's actually cultureandhealth.eu, and if you go on events, you see every event there. All of them are free of charge, and we have an upcoming conference in Vienna in September. And the next European call where Greece can apply to is going to be towards the end of 2026. We just closed the current call, but it's coming again. So we will have it 2 years in a row as well. Yeah, and that was, I think, all that I wanted to share with you.
Thank you.
Thank you very much.
So, Professor Karkum will continue, and we'll have Q&As later on.
I made the mistake to change my place with Cornelia, so I'm going to go after Cornelia, which is a bit of a problem here, because she covered huge policy drivers in Europe, and I'm going to go a step back now. I'm going to look at research again. I'm going to look at what's happening in the UK, which is I mean, we still belong to Europe, but just we're ready to take off somewhere in the middle of nowhere. But there has been a long tradition of arts and health and creative health there, so I'm hoping I'll be able to bring something. One of the things that I want to say, there is currently a mental health reform or review that is taking place in the UK. Some of my thinking for this presentation is coming from this submitting material and doing a separate report on arts and health and the contribution of arts and health to mental health for this review. And there is a special review for children as well. So there's a lot of things in flux at the moment. So that's just starting with the presentation. This is where I'm based. I'm a researcher. Again, this is the work that is done before policy rather than after, although there is an interesting connection between them. So if we look at, this is my research team. Some of you who were here on Friday, you might have seen some of these slides already, but I know not everybody was here on Friday at the masterclass. So we have over 30 staff in the team, psychologists, computer scientists, nurses, medics, a lot of arts and health people, artists, and arts therapists. So it's a whole bouquet of possibilities at all levels of employment. We're looking as a research center at things that take place in different contexts, across the art forms, anything that has direct benefit for different age groups. I believe it's very cutting edge what we're doing. It's local, national, and international. And the other major driver in the UK at the moment for us is, I think last year, the 10-year report NHS plan came out, which is shaping a lot of what we're doing. And some of the key pillars of this report that was the shift from acute to community, from analog to digital, and from something else to something else, which is the treatment to prevention, which is an important shift in many ways that speaks to the Greek situation as well, that shift from institutions to public health. So I'm going to make a case for change that is not needed now because there have been so many people who have done this case for change already. Let's see what are the things that we haven't highlighted enough or the things that are the same. So we know there is a problem with mental health. WHO here reports and its publications, the numbers that it affects. There is a gender issue which we haven't spoken enough about. There are more women than men affected by their mental health. And we have, in the UK specifically, we're talking about 1 in 5 adults in England have a common mental health condition. That's a very large proportion. So when it happens, that's a common theme now that we are talking about again and again, that there is an escalation to services, and this escalation to services happens to such an extent that the services are burdened and experience a lot of pressure. So early intervention, prevention and early intervention are key components to de-escalate or preserve some of the capacity and the possibility statutory services have. Psychological therapists, and probably that's also relevant for the Greek situation, come with stigma. This is not only when people do go for psychological interventions, there is a report that 1 in 5 adults drop out. So they never complete the course of engagement or find it difficult to engage. There's a lot of discussion around cognitive behavioral therapy now and unhelpful factors. And this, in the UK, is the main and only service offered in primary care with few exceptions. So this becomes one thing suits everyone, which is a problem in itself, right? Without undermining the value of talking therapies and CBT. As Niels was saying earlier, we're not saying the arts will be instead of, but they have an additional role to play diversifying services. And there is an economic impact of mental health disorders, which WHO in the mental health reports are talking about a staggering problem. That's really a serious problem that needs to be addressed. Again, talked about people's voice. From an evidence-based perspective, when we're thinking about evidence-based practice, we're talking about evidence a lot, but the evidence doesn't come on its own. It comes with practitioners' expertise. When we're putting together to create a guideline for service, for example, we often have evidence, we have practitioner expertise, and we have people's voices into the mix. So people's voices haven't been flagged up and named enough. We haven't gathered enough evidence in many ways from a research perspective to make a case that people want that. And that seems to be happening now more and more. So in the UK, one of the surveys, for example, with 1,500 participants, they talked about how they want to see creative interventions as an option when they contact services. So that's a very strong argument in itself. And the numbers could grow. The survey could go higher. I don't know whether we have anything like that. We have the 89% of people who like arts engagement at the European level, right? So that's an argument that can be built further, I think, and can be thought through in many ways. And then we have the economic argument. The 8 billion a year associated to gains to the UK economy has been quoted a few times so far. We've done 2 studies as part of our research center, and we're preparing a 3rd one now. were commissioned by Arts Council of Wales, who looked at return on investment, how much the Welsh population gains from generic arts engagement, which is the methodology you were talking about earlier. So we looked at normal arts engagement, what does it mean? And when you actually invest and pay £1, 1 unit of funding into the arts, we found that there is £11 return of that investment. And we have similar figures in the systematic review we've done with children and young people. Again, we have a clear return on investment, and we have also a very underestimated calculation on social return on investment. All of these calculations are based on very short-term estimates, which means in a year's time, from the time somebody have had an arts engagement and arts participation, we don't know what benefit this might have had societally. And that's another important thing. We know these figures are really not large in comparison to what they could have been calculated if we had better studies and long-term effects, capturing long-term effects. This is the governmental report, the review that is under, is happening at the moment. In 3 months' time, we'll know much more about how the whole thing will land and what will happen. So I'll need to look at the European scene because I'm disconnected a bit from Europe at these days because of the separation. So see whether we can feed some of that, because it's time when we are feeding into the UK government to see how much of the things that have been already established at the European level can happen at the UK level as well. So on the basis of these, there are a couple of recommendations. There are obvious recommendations. One is that we need to strengthen prevention and early intervention, and place-based arts offers have a lot to say and do to absorb and reduce demand, offering an economic as well as an acceptable, non-stigmatizing early input. So that's one recommendation that is going to go in. The other recommendation is relates very much about services in itself and the need to diversify provision. So we need to include a wider range of regulated mental health interventions, such as art therapies, within services that generate less stigma and improve engagement. So this diversifying the workforce. And taking into account patient preferences is part of that argument. So we talked about different terms. We've covered them on Friday, so I'm going to go quickly through that. Creative health, a larger term, social prescription, quite specific, related to link workers as well, and arts and prescription, even more specific and clear, and very much connected to how things have been used in the UK. We have a wide range of arts activities. Maybe we need to rename them as culture and arts activities. That's a good debate to have and discussion. I haven't been faced with that discussion as yet. And of course, we have the art therapist, which is a regulated profession. I would like us to just stay here for a minute, because this is the language that is used from the UK government and potentially could have value for other countries, not necessarily in how things are named, but in how things are structured and thought through. We're talking about different types of interventions. We're talking about universal interventions, where public health, public art, heritage museum visits, open exhibitions, and so on are on offer for everyone. And that's very much people who may or may not have a mental health need, but it is a public health provision. They can be facilitated by a wide range of people, or not facilitated at all. So this is the, so it might be curated, it might be supported in a different way. So that's a very open frame. Then you have the targeted provision, where we narrow down the therapeutic classes, therapeutic use of the arts. There are things that have specific communities or audiences, often addressing a specific issue. And there we require a bit of a skill, some kind of specific thinking through. We have artists with mental health training, we have mental health practitioners with artistic training, we have a combination of arts and health together. So this is the place in the middle where things narrow down, and you need some kind of skills, maybe not high level of skill, but you need some kind of enhanced facilitation. And you have the specialist provision, where we have the people with higher need, have specific self-harming, eating disorders, some specific needs that require extra skills and qualifications. And what we are proposing in the UK will be to have for this provision to be facilitated by arts therapists, next to other professionals, of course, who already exist in these services. This creates an important matching between services and needs that requires somebody to make judgment of who needs to receive what, and potentially a link worker, a psychiatrist, a mental health practitioner. Somebody might do this judging of how the need is, what the need is, how intense it is, what type it is, and where to refer people to. And then you have the services at the bottom, where we have prevention, step 1. Step 2, we have early intervention, we have treatment, or management. So that's another alignment which sort of roughly is associated with these different types of provision. So this is what we're going to put forward. It has been discussed extensively with public health lead for the NHS. We're discussing it with a lead from the review, who is a psychiatrist, and the clinical lead from the national lead for children's mental health. So this will go for the children's version, but I think it's very applicable for adults as well. So when we're thinking about recommendations, this means we need to think about appropriate arts-based provision that is matched with levels of mental health severity and overall needs. Through a personalized care and support planning, so we need to think about what suits whom as well, and people's choice becomes important. One-fits-all approach is we move away from, and social prescribing and arts and prescribing is certainly very much in the mix here as an important component of personalized care. And we have also the role of the arts interventions within that, where we are thinking about a flexible option as part of this stepped care approach that has universal targeted and specialist programs with a referral route. So that's the referral is another thing, who refers who and what services. That's a key thing to crack in order to make it slick and make it work. I think that's very well linked with implications for the Greek situation here as well, where we need to have clear registration, qualification, and requirements. Possibly some of that is already taking place, but we might need to think about micro-credentials, some additional training that is needed for X, Y, and Z type of provision. We need to think about the routine outcomes, and we were discussing that yesterday. This is going already in this report, that these routine outcomes need to be proportionate to the type of services. So universal services will have to have minimum outcome measures. and more intense and specialist provision, we need to think about depression, anxiety, and specific eating disorders-related questionnaires and what have you. So it's more heavier in terms of the data collection because it's more clinical, more risk-prone, and so on. So that's an important thing to think about for the platform as well in terms of grading the level of data collected, and then we're thinking about supervision ratio, who supports, who supervises, who monitors what's happening, risk management, and so on. I'm going to talk about the umbrella review quickly, and I'll start wrapping because I know we're going long. So the umbrella review, we have presented some results already on Friday. It is a piece that originally started from Chris Bailey, who asked us from the WHO, the Geneva office, asked us to do this review 10 years ago. So it's an act of love and perseverance. We brought a lot of different colleagues around. We brought a Melbourne University, Drexel University, Lanus in Germany, Haifa, New York University, and us were the first people we started that work. And of course, WHO is part of that. And Nils, I don't know whether you want to add any on the process, but that's a big piece of work that is happening right now, and it's under review, hopefully at the final stages of a review in Nature. Methodologically, we looked at non-communicable diseases, including mental health conditions. We looked at arts-based interventions. We looked at the outcomes in terms of psychological, physical, cognitive function, and quality of life. And we looked at all systematic reviews and meta-analysis, and we checked the quality through Amster and GRADE. So the generic results are very positive for 3 out of the 5 NCDs. So we have medium effects for mental health conditions, which is the area of interest here. We have medium effects for cancer, so the expansion, we're already discussing that. Dr. Dritsis was here yesterday. Cardiovascular diseases will also be relevant because we have evidence and it's quite strong. We also have small to medium overall effects for neurological conditions, which are degenerative or neurodevelopmental. So changes are not expected to be major, but we have quite confidence that the arts have a role to play there. And we know we don't have enough evidence yet on respiratory diseases or diabetes. When it comes to mental health conditions, this is the piece of work that I haven't presented yet. These are some great results, especially for the psychological outcomes, because we have confidence, we have a large number of systematic reviews. There is a, the landscape looks, sort of quite, it's not going to change no matter what is going to happen because we have enough studies to draw conclusions from. We know that there are psychological outcomes, medium to large for anxiety and stress, medium effects for depression and mood, which are really, really important and good results for all the populations studied and included with mental health conditions. And we also have a lot of confidence on large effects for depressive disorders. So all the anxiety, depression, and etc. results are overlaid, if you like, very well on the mental health conditions. So schizophrenia, we have a medium effects for schizophrenia and PTSD, and outcome measures that go along on what you would expect to see in terms of improvements. And then a number of different psychiatric conditions. This is under the final stages of revision. We also know that there are similar effects for those with and without formal diagnosis. What I hadn't presented, and I've done it this morning, so I might have gone pear-shaped. It was early in the morning after a taverna. is what this means in comparison to other umbrella reviews. So what we know in terms of the outcomes, and we're looking at the ones that are highlighted here, is that when it comes to arts-based interventions, the psychological outcomes is 0.51 for people with mental health conditions. When we're comparing an umbrella review on psychotherapists and pharmacotherapists, the SMD, the estimate, the benefit is lower. It's not much lower, it's lower, it's comparable, but we have a sort of very promising outcome there. Similar for exercise. We didn't have an umbrella for psychological outcomes, but for exercise, we know for exercise for all the people with cognitive outcomes, there is a very comparable result. The higher the result, the better. So we know for psychological outcomes, this is what when we're drilling in, these are the results. And we know for talking therapies for children and young people, the SMD is 0.24. So that's quite a good results, right? So it's not that we don't have the results, it's that we don't know about it yet. So that's the argument. And this is also fresh out of press, so people wouldn't know them because they're not available as yet. So there are implications for research, which I'm not going to bore you with, other than we need further large studies, not in Greece and not on arts and prescription and mental health. I think this is the largest. I double-checked on 2 databases, and it is the largest that I could find anywhere in any of the primary trials we had. So I think this, we need to celebrate that.
Thank you for that. Okay, so it's almost 1:30.
I have a couple of things more, but we can stop here because it's long.
It has been an hour and a half.
Yeah, that's okay. That's a good place to stop.
I think the audience demands that you actually finish the presentation rightly.
You have some... You want us to continue? You're good? You're excited? It is the largest study. Yes. So the next recommendation is we have current evidence is supportive and evolving, and appropriate arts-based provisions should be considered for populations with mental health conditions. We have good evidence. Cancer care, cardiovascular, neurodegenerative and neurodevelopmental conditions. And when it comes to mental health conditions, we need to think about depressive disorder, schizophrenia, PTSD, and depression and anxiety with or without diagnosis. So that's quite a compelling result. When we have populations where we don't have evidence, because at the moment we don't have negative evidence, we just have gaps in the evidence, we need to think about commissioning or providing things, short-term, small pilots, good evaluations, ways of generating more evidence, more, step by step. And we need to be thinking about arts-based interventions becoming available when interventions are not on offer. What we know at the moment from the studies is that when you compare arts-based interventions with waiting lists, the results are very positive. So there is nothing on offer. This is the time where arts-based interventions should be offered with confidence. So we are generating more studies because we don't have enough, where researcher says, but the policy says, yes, we have enough to go ahead with policy, right? So the ERA study has 1.8 million, 425 participants. That's the largest one I have found so far in terms of trial. And we're finishing that, we're writing it up. We're starting one in primary care with Arts for the Blues. We've done work in schools, Arts for the Blues and CAM services and children's services. So it's a lot of... And the other bit that is relevant for us here is implementation studies. The Arts for Us is a project that received $2.5 million investment. It's the largest study in the UK in arts and art therapies for children's mental health. And it's all about how to turn evidence into practice. So that's very relevant for the next step into the journey Greece is going through. We identified barriers to access, for example. This is the Levesque framework, where we need to start thinking appropriateness, approachability, things like the buses that the users were talking about in the groups, all the extra, the unaccounted barriers that need to be considered. There is a whole map of things that can be considered and should be considered for scalability and improving access. Barriers are multifaceted. We talked about complex interventions. You presented policies with really different levels of interaction and engagement. And we need to start thinking about implementation science in terms of the innovation, how the innovation looks like, what the participants, the inner setting in an organization, the outer setting, and policy, right? Which are things you're already done. And we need to think about the RE-AIM as another frame where we go step to step, which all of that has been integrated in the Scaling Up report that we've done that Niels has forwarded. Yeah? We need to revisit that study, that report, because it looks at different components that each of the projects have in order to become scalable. So we will look at it from a project perspective, the organizational perspective, and a policy perspective. Speaks to some of what you were talking about in terms of what is scalable and what is not. Digital, of course, we're developing a digital thing all in parallel and nothing speaks to each other, so that's a different thing. We need to revisit that. We need minimum quality standards, which I believe you have as a setup here. Interoperable platforms using international standards. I don't know whether this has been considered or not. Matching arts-based activities with needs and services. Offering descriptions. We're working with children. We do a lot of videos of how the activities look like. So there's something about sharing, and I think you're doing similar things with the platforms and how the activities look like. You have visual material in the platform, I'm not sure. So that's something we're trying to do as much so people know before they access the organization what will look like, how things will look like. So they bypass issues, barriers that will be obviously there because they have a mental health problem, they have anxiety, they won't go outside the house. Why would they go to a place they don't know anything about, right? Yeah, okay. So I'm going to close here. Thank you very much.
So it was great. I mean, it's such a beautiful combination of information that we received from all of you. I mean, I'm sure the audience appreciated that very much. At the same time, research, policy, and our question, and one of the major questions, and I'm sure the audience would like to address these questions to you especially, is, you know, how do you actually do that? How does actually the two pillars, which is research from the one and policy on the other, how do you combine the two, which is the best strategy to move forward and implement policies that never existed before, for example, in our country over here? In my opinion, as an academic, you know, I've published research. I've tried to have research put on the page of ministers. This is the way you should do things. It never had a major impact on its own. So there are other ingredients of the way you can actually take things forward just by protecting the research. In fact, I loved your comment that research is mostly used to protect yourself from negative kind of claims in terms of that there is none such thing. So every system has its own modalities and own particularities. We, over here in Greece, we kind of invented this strategy, this access to care through this research program. It's another thing of thinking what the policy is going to be like 5 years from now. The only tool I find extremely useful, and I will have to sort of talk with my colleagues about it, is the next huge European project coming over. I'm referring to the Horizon. Should we go for it? So there has to be a very secure base in order to start thinking of things like that, implementing policy. But let me just, I don't think we have a lot of time for questions. We have another session after lunch. No? I think everybody, after an hour and a half, we can have like a break or just go on with it.
I think we're already in the other session.
So that means no break. We just go through a discussion. I think it's a nice way to continue and the whole process. So, are there any specific questions from the audience that you feel you should like to address, everybody? So I'll ask my colleague, Dr. Vlachos.
Thank you so much, and thank you also for being here, because all of you mentioned the group feeling of art. So we have a group feeling of belonging to this great European family, and how lucky we are in these days with what we see outside of Europe happening. It's really a luxury to talk about art and mental health nowadays. So thank you first of all of that. Dr. Stefanis and Dr. Alexomarolaki, who brought it here as coordinators. I would like to stress what you said about this communication between the Ministry of Culture and of Health, because this is an important momentum, so that implementation really happens at this momentum, because perhaps otherwise it will get into routine and not flourish more, because now we are so happy that we are in this momentum, enjoying it, celebrating it. How can this be turned into practice? This is the first question. And the second one to Dr. Keys, what you said about the psychiatrist, it is important because of the limited finances, that the tertiary prevention becomes, secondary and tertiary prevention becomes associated. So what you said about the diagnosis, that there is already a diagnosis, I don't know if there is the money for the prevention through arts. Here in Greece, we have a practice that parents bring children to make piano lessons, ballet, go to the theater, etc. And they think that this is a broadening of culture. We could add in the awareness campaigns that this is also good as a prevention measure for mental health. So what parents do for their leisure activities of their children is also part of a prevention and a strengthening of their psychosomatic health in that sense, which will also support that in terms of prevention. But in terms of treatment, it's fantastic how much it coincides, perhaps supersedes psychotherapy, in the sense that the neurobiological effects are evident. So it's something that has to do with the psychotherapeutic effect, and at the same time addressing this, what you said about social isolation, which is so important, and it's destigmatizing, and not, I think Dr. Karkus said about the stigma of psychological therapies. So perhaps the role of psychiatry is not as bad, since it refers to people who really need it more than the people who can somehow afford it for prevention.
Yeah, so basically my point was more about that we are swimming a little bit more upstream, and you're absolutely right, actually engaging in general in cultural activities, and the fact that the parents are sending their kids to piano lessons, that's absolutely part of prevention, and it doesn't necessarily, the health system cannot finance it. We totally understand that. Maybe it can still stay with the psychiatrist, the prescribing, but the fact that a social worker can actually tell someone to go to the psychiatrist to prescribe, or maybe psychologists as well. So there is also, let's say, a system because in the UK you have also self-referrers, like I feel bad and I need to go. So that's basically my point a little bit, that you are again trying to catch up because these people are really feeling bad, because psychologists maybe treat less people with mental health conditions of lesser seriousness, let's say. So that was a little bit my point, and how important the early action is. Now more and more research comes out how actually volunteers, just if you have a smaller problem and if you talk to volunteers, it actually has a really beneficial effect. That's another story actually, but so we can definitely keep it that way, but make sure that social workers are aware, psychologists are aware, schools are aware that they can send to a psychiatrist somebody to prescribe this, because it's an issue.
I need to complete something on your suggestion and compare to what Elias said. I think we didn't mention enough that we had two other targets. The reason we stayed and we decided to stay on psychiatrist, mental health area, was because it was pilot program. We are planning this to go beyond this to all these kind of groups you said. And another issue we didn't underline enough is that we had 4 coordinators on the field, 2 psychologists, senior and junior, 2 artists, specialists, senior and junior. And the purpose of junior's position was the training. We wanted the younger to be trained, the younger colleagues of us, so as on a sustainable field, it's more preferable for us. But we didn't say we are in a hurry yesterday.
Would you like to make some comments on the presentation? Okay. So you'll be next. Okay.
And just for the training, going back to what Anna was saying, to make a couple of classes at the medical universities or psychiatrist universities would be also essential, following up this. There are so many people who worked in this. Do that. Let them know.
I have 2 things to ask. I will be very quick. If you are aware of any study, pilot, or any other targeted specifically on a region that has high mental health issues, and bring art as an intervention to work on this particular regional problem, because that would be very interesting. We know in Greece that there are regional pockets of problems in mental health, which were not covered in this project because they were very remote, or because there was not interest on the ground, because there is the stigma. And I wonder if beyond the intervention, the collaboration between the 2 ministries, Ministry of Health and Ministry of Culture, would be Ministry of Culture and the prefectures that are responsible for these regions. If you are aware of a specific project that was targeting a region, and what were the results? One thing is that. And the other, very quickly to say that in Athens University, which is part of a bigger alliance of universities in Europe, it's called CIVIS, we are piloting for some years now the so-called service learning approach, methodology, that students are learning their modules, no matter what, through service provided to the community. And it's very small scale because it's very labor intensive, but I wonder how much benefit that would be for all the students and of course the community if learning was done in a totally different way, by offering and learning by offering. It's too complicated to express now in more details, but that's also a possibility.
I think service learning is absolutely great. Yeah.
I can take one example from the arts for us for the mental health. The first question, the arts for us we received the funding with a major argument that we were going to operate it in the Northwest, which was one of the most deprived areas in the UK for mental health and socioeconomic regions. That's in many cases, the mental health rates and the problems, the socioeconomic problems are of the lowest in Europe. It's this type of, in pockets, of course, not throughout. So that was, so we haven't established that it's not an RCT, it's not, we did the intervention, because we did the intervention, these are the improvements. We're going in the different areas where the mental health problems exist, and we are trying to improve people's lives on a more pre-post evaluation level and changing services. This is the implementation side of things, not a numerical estimate of change. But yeah, that's one example. I'm sure you have many more, right?
I mean, I think embedded in your question was also a question about what levels of government to be working with, right? Because we've been talking mainly here at the national level, which is great because the national level is usually the last to be involved. So here you're fortunate enough to have the national level engagement from the start. But often a lot of this activity takes place at regional or at city levels, right? There's a lot of and often when you have conversations with policymakers, in fact, especially at the national level, they say, well, you know what, actually, we can't do much. You know, it has to happen at the regional level, or it has to happen at the city level. And at the city level, people are much more used to collaborating with each other as well across sectors. So we've found that the WHO has a Healthy Cities Network, for instance, which is a number of international cities internationally that have signed up to certain health standards or that are trying to emulate certain health goals, and they are part of a network. And within that network, there's a big amount of activity, a lot of interest in arts and health because they can do stuff on the ground.
Yeah, absolutely. Eurocities and United Cities of Local Governments also all have this. And I would say try to do it on a regional level then. And here I'd like to highlight the role of the European Union's Interreg program. So the arts and prescription huge project in the Baltic region was a cooperation between regions, no national level involved. And in there, for example, Latvia specifically were really targeting the most remote areas with old people socially isolated, and they got quite good results with arts and prescription there. So I think, actually, I was saying also that this arts and prescription Baltic Sea should be replicated all around Europe with this regional cooperation. It has to be, you know, your close-by neighbors, but I think it has a whole good potential to apply for.
To come back to the umbrella review, because I think there is also evidence in this umbrella review that there is not much difference between arts activities and art therapy interventions. Did I get that right?
Yeah.
So, and when you have this policy paper, you have three areas: the communal area, the universal area, the specialized, no, the targeted area and the specialized area. And in the specialized area, you only have art therapy as possible in activities. Now, that makes sense on the one hand. On the other hand, I would like to put in a word for the artist, because the artist is not a therapist. And one of the things the artist can do is provide therapy-free spaces for the patient. And I think especially if you have a chronic disease, if you have a mental health disease, it is so important to get out of this therapy, because everything is defined by your illness and your condition. What you want is to bring out the healthy part of the person. So in a policy paper, I really would like you to rethink this passage and not close the door to this really important humane aspect of the arts.
The problem, I agree, and there are some really good projects that are happening already in the UK, in hospitals, in quite difficult, a lot of medical contexts actually, where you have arts rather than mental health contexts. The problem we have with the mental health review is a lot of objection from the establishment in allowing anything creative. And the only argument we have at the moment is that those who will go in will be highly qualified.
Yes.
So it's a difficult one, because I agree.
Yeah.
They have different function, and we have some brilliant examples you presented earlier with the musicians and the music therapists working in synergy. Both of you have done it, and they have different roles to play. So we'll see. It's a good argument. I am not averse to it. I just, sort of, this is the practicalities. They might not allow art therapists in the specialist units at all.
I know that it is an issue, but I have been in hospitals, in psychiatric units in the 80s already, and worked with the patients there as a dancer. I mean, nobody asked me for any therapy knowledge. And actually, I worked with an occupational therapist there, and she said, no, you don't need to know that. Just dance with them. That's what we want.
I think there's one challenge about this, which I think we probably haven't talked that much about, which is the responsibility put upon the artists coming into difficult situations without necessarily having a substantial amount of support themselves.
Yeah, but that's okay. That's the background knowledge they should get, but not they don't need to be therapists.
I would argue, though, that it's more than just background knowledge. It's also kind of support. It's a support system. It's like thinking through that you're, especially at scale, if you're doing this at scale. I mean, obviously, there may be people who are very committed and who have thought this through very much, and they're the ones who are pioneering this space. But once you regularize it as a recommendation and you bring people into these situations who are perhaps not as motivated or not as aware, not as in tune to what the situation that they're putting themselves into, you have certain responsibilities, I think, to protect them as well, through support systems, through training, through all sorts of...
That I agree.
And it needs to go, whatever decision needs to go with a package of training and wrap up around any policy of this kind that supports people, enables communication, creates minimum requirements, both in terms of qualifications and support they receive, because most of the artists in hospitals and difficult situations receive no supervision, right? That's problematic for their own health. Yeah.
Well, I was just wondering, and maybe I take it from you, what I think is like the elephant in the room in this discussion. All this initiative comes from some sort of a cultural perspective. Very few times have I seen that initiatives like this would come from health perspective. At least our experience over here has been a mixed experience, and I'll be very honest about it. I mean, we sometimes felt that we did not have the support, for example, of the official mental health institutions over here. It seemed that it's driven by culture, and somehow is passively accepted by health. Maybe that's the way I can see. I was wondering if that is our kind of national sense of how things are developing over here compared with other European countries.
It's everywhere.
Well, I would nuance that a little bit. I mean, I would remind ourselves that the social prescribing space in the UK was very much a health systems space. It was put forward by doctors, for doctors. It's, I mean, not that it didn't meet resistance amongst the medical community, but it was a medical community-driven initiative. I think the reality also of the arts and health space is that it's a space that has more or less recently been named, but that has existed forever, right? I mean, the artists, socially engaged artists who are in the community, who are supporting people who have health challenges or needs, that's been around forever. It's only relatively recently that we've put a name on that type of cultural activity, and that kind of artist as well, right? The socially engaged artist, which is important, I think, because often that, I think you've mentioned this to me once, Cornelia, that type of professional or that kind of person was often in a very difficult situation. It was not considered an artist by the artists, and it was not considered a health worker by the health workers, and it was kind of somebody in no man's land. And I think that person is being elevated now and given a profession and a value. But that's why I think a lot of the grassroots arts and health movement has come from those kinds of people, the people with the passion. And that's maybe one thing to remind ourselves, that a lot of this energy is still driven by love, right? It's driven by people with passion who are not doing it for money, who are not doing it for anything. And to some extent, the systems take advantage of that, like they do in the UK, right? As you were kind of describing, where a lot of it is like a lot of what's happening is volunteer-based, and people love it, so they do it, and so they help, and so we take. And that's the challenge. That's, I think, where the system has to step in and kind of say, well, you're doing great work, and it's having a health economic impact, and we should be paying you for your services. But I think it's not as simple as saying it's just a culture thing or just a health thing.
Hello.
Can I just
I would like
say one thing? So think of this as a change. Just think of this as a change management process. It will, first of all, the evidence is not known. Now you started to sensitize the mental health field. And that's actually why a bottom-up discussion on these things is needed, so everybody feels involved. It's good to look at the change management systems of what they are recommending for each step, because that needs to happen here as well. So now I give it up.
Okay.
But
yes. Just to comment that, because I think we should look this as a continuum. And in the health sector, we do not think anymore about the biomedical approach. We are thinking more about the biopsychosocial approach. And it's very important because we are not looking to the patient. We are looking to an individual that is health states that can have during their life several disorders. Okay, it's important, this person may benefit from this continuum, from the art therapy to art on prescription, that is quite different, it's important, and from cultural participation through all their life. And I think it's this concept that we should have both on the cultural and the health sectors. This is a continuum, and we can benefit with different perspectives, with different outcomes, with different aims. But the art and the culture can be beneficial in these different moments of a person's life. So it's very important to know the differences between these different interventions. So when we are measuring, when we are prescribing, we know that it's different. Art therapy, I do it, I have training on that, but it's different from training on cultural prescription. And for example, what I have in my university, that training, that postgraduate training for health professionals and for cultural practitioners on cultural prescribing is not a training on art therapy. It's different. Okay, and it's very important to know that. And of course, the training is different for the cultural professionals. So, because for them, it's very important to know how to deal with the illness person. And the training should be different for the healthcare professionals. They should know all the benefits of prescribing some cultural activity or intervention and how to do it, because a prescription is something that is very structured, that should have some parameters that are very well defined for that aim that we want. And it is different from cultural participation that is also beneficial, as we know, of course. And another point that I would like to underline is the importance of being together from the beginning, culture and health. Thinking about the policy level, we should be together from the beginning when designing the national strategy, not one sector designing and presenting, and so now supporters and funders. we should be together from the beginning. And from the practitioners level is also very important to be together from the beginning when designing the initiatives and when designing the research studies, because there are different outcomes that we should put together. I was talking about the quantitative and qualitative data that are very important here. So this is a specific field, culture and health. It is not something from the culture side, and it is not something from the health side. Thank you.
Yeah,
Okay.
definitely remember the
I'm
word.
waiting. Sorry, I would like to speak. I would just, because I would like to add my experience as a psychiatrist, musician, and music therapist. So it is very different. Art on prescription, just as an artistic intervention, and is very, very different. Art therapy, music therapy, it's something completely different. Because when we talk about art as a prevention, it's like a prescription. We talk about socializing, we talk about social therapy, we talk about culture, etc. But when art therapy is there, there is a specific protocol, therapeutic protocol, and what changes is the indication, because the word therapy puts the word indication, which means that we can work on specific pathology, specific diagnosis with a specific method. So I was very happy to see the distinction in your PowerPoint. I think it's very important. It is like this internationally, here in Greece also, and in France, where I've worked for many years. And I think both are extremely useful. So we don't need to, they are very separate and we need both. That's my...
Very shortly, I would like to add to the conversation, because I agree with what you said about arts, that our program has the originality of focusing on art. We had long discussions between art and art therapy, and we differentiated it. And this is why we have this combined version of an artist being there, offering the destigmatizing aspect of art, with the presence of a mental health professional who has a background, as Dr. Fieti said, about knowing the psychopathology, but giving first role to the art. And this is the originality of this program, that we have the combined activity of art and mental health, not of art therapy or something combined, okay? Because it's very nice what you said, and it's also metacognitively very important that art has also this, for me it was an illumination, an insight, that's why I mentioned it, that art has in its definition the destigmatizing aspects compared to any therapy that belongs to the psychiatric hospital, to an external unit, which is, however, still therapy. Thank you so much for the contribution.
Can I come in on that a bit? I'm not sure I have a clear position on that, because I know the value artists can bring in hospitals. And some of the proposals we're putting forward potentially creating an issue here. I think what is important ultimately, and it's less clear to manage that at a policy level, but on a practical level, I think a key component, especially for the social prescribing theme that we're talking about, is the link worker or creative health associates, a new role that may come just for arts and prescription. So we'll see how this evolves, at least in the UK. Where an assessment is made for a community or health service, that's at least the definition. If there is an assessment of need that requires to go to a museum, socializing, being exposed to, this doesn't stop the possibility of having a mental health referral at the same time with any other support that is needed. So that assessment is important, and also that person who will take, and that's the key thing in social prescribing in the UK at least, the link worker has the role, take the hand of the patient and take them to the activity and stay with them until they're comfortable enough, or at least up to 6 sessions. That's a key role to make, both in terms of offering support, but also making a very personalized assessment of need. And this ultimately will create a much more complex situation, which would fit people's needs rather than the other way around. Now we're trying to design services at the same time, right? So it's a complex situation there, creating boxes which are not clearly aligned to personal needs.
Just to say that the art therapy field, at least from our point of view, we had tons of discussion this in the OMC. It started very hard. So we consider it part of the huge umbrella. It's under the huge umbrella because it's still in that space, but it's a different one. And there are lots of descriptions why it is different on the internet that you can find. And yeah, actually from the cultural sector's point of view, we also have a Culture Action Europe position paper on culture, health and well-being. You can find it on our website, which exactly tries to clarify these differences, what is socially engaged art, so that sometimes people feel left out and so on. And we try to kind of clear those questions so that we start talking about solutions and not like, am I here or am I there? And, you know, and so in case things come up, I invite you to look at that as well, where we try to, through a consultation, a little bit clear these questions out so that we can move forward.
I think I'm next for the questions. Over here. Thank you for the amazing and inspiring discussion. I was based on the importance of the co-designing and actually making a needs assessment and asking what the beneficiaries actually need and prefer. I'm also coming from the point of view of an arts and health non-profit in Greece, working with cancer patients since 2019. I'm working whether this needs assessment would include not only the beneficiaries, but the actual organizations that are working with these communities and working with these means of the arts. How would this become also part of the information that could be gathered and collaborate with this program, since it's something that it's in the field, it's in the community, and has like a broader view of the needs as well of the beneficiaries. Thank you.
I think in Greece we haven't opened up the field as wide to include these organizations. Have they been included in cancer care? I'm not.
Part of the project, we made a very important decision at the beginning. Are we going to talk about mental health patients, beneficiaries, or are we going to talk about people who are suffering from some sort of mental health issue? We opted for the second option on purpose to include people who will have mental health issues because of another primary disease, for example, cancer. So we did not exclude people who have other mental health issues because of other diseases. So Parkinson patients were included, oncology patients were included, as long as there's some evidence that they have a mental health difficulty and issue. And I think that's one of the ways to open actually the borders from a more strict psychiatric understanding to more broader mental and broader health related issue.
Which is not tied up to a silo provision that says this is an oncology or a diagnostic.
Think of it trans-diagnostically across that was our idea. And that was our idea from the beginning.
So the question then becomes on whether the organizations are part of the platform, right? Which I understand in theory they should be. Is this the case?
So there's so many organizations that are doing fantastic jobs out there, NGOs and things. But it's up to the Ministry of Culture to think with the Ministry of Health now, which of these participants are going to be continuing the project in Greece. There has to be a very central kind of decision on that.
Because the problem we have in the UK, just to bring also the voluntary sector in there, at the moment we have things like Elemental or Joy, we have some platforms that are trying to gather information around, you know, and make appropriate referrals to organizations. It's very ad hoc. It's so much based on chance for the GP and the link workers. And then you have link workers who have paper-based lists of organizations they know locally. Referrals are poor, capturing data is poor, so we're trying to develop the platform we're developing as a way of starting monitoring things.
I was going to ask you anyways. I mean, this concept of the key worker, which is, I know, a very UK kind of concept of intermediate. Is this applied anywhere else, or does it stay as a particular UK kind of interactive?
I think Denmark also has it actually almost.
I would say, but mainly because people have looked to the UK model to like replicate it, and I think there are questions around terminology. What do we call it? Do we call it a link worker? I mean, in some cases, the roles are very similar to social worker roles. And,
in the US, actually, they were using social workers as link workers.
Yeah, but I think the model generally, like when people have oriented themselves to social prescribing, they've typically taken on board that concept of a person who links the family physician and the patient and the cultural activity.
When evaluations, though, two problems we have in the UK with that is it's based on the local knowledge the link worker has and the background on where the referral can be, so they have limited knowledge of what's happening. We're trying to change that as much as we can. And the other thing is that still social prescribing evaluation projects are relying extensively on self-referrals. So people show up and then this counts as a social prescription even if they haven't gone through the system properly, because that's still the voluntary sector in the UK is powerful. It's quite well funded in comparison to many other countries, so it can operate on its own without struggling as much. So it's not voluntary work, they're paid, right? But it is very ad hoc, and that's problematic.
Can I ask something on the link workers specifically? If there has been, because this role exists for quite some time, if there is any report based on link workers, interviews and feedback about the impact of this position, specifically targeting link workers?
So in the UK, there's a National Academy of Social Prescribing, NASP. If you're not familiar with them, then I can't point you towards a specific report, but I'm quite certain that there is literature out there about the role, the cost, the effectiveness, etc. And NASP, the National Academy of Social Prescribing, would be a good place to find that kind of resource.
For the other evolving role, I mean, social NASP is the key thing, and I think we had it in some of the presentations as well, that this role, and the NASP as an organization, an affiliate one organization that again plays a much broader role for development. It's worth thinking about is the National Association for Creative Health. And that's linked with the government, and it looks at the creative health as a broader term, where creative health is any innovation and any creativity that benefits one's life. And it doesn't have this very specific link worker being involved, referring people for 6 sessions to so many local activities and what have you.
One thing it's important to note here that in the UK, it's social prescribing, within which you have arts on prescription. So that link worker ideally should also help with housing issues and whatnot that also affects mental health. So maybe there is a bigger need there, I don't know. And there could be a discussion if, let's say, I don't know, the cultural or a bigger cultural organization would take up some kind of accompanying role, let's say. But it's interesting how, in your case, the beneficiaries then just showed up and, had difficulties in the beginning, but then could stay. So it's an interesting question if this is absolutely needed or not. But you have arts on prescription, and they had social prescribing, so it's a much bigger.
In Austria, they have link workers, so it's a social worker or it's an occupational therapist, whoever is in in the surgery. The idea is that a link worker can reduce the workload of the doctors. That is the idea behind the link worker. And we had, I think, on average, a link worker would have 10 hours with the patient or the individual to find out what they really needed. And a doctor cannot afford 10 hours because they're just overworked. So that was the idea.
And I think, as has been said a few times, the key difference is that you've been working with institutions, right? Like you've been working with museums and big cultural organizations who are embedding these ideas in their own strategies and their own service offerings. In the UK and in other places, it's bringing on board much more. I mean, I'm sure there are also institutions like museums and so forth that are part of this offering, but it's much more about individual artists, socially engaged artists, who, as opposed to institutions, who are offering something, who are offering community singing, or who are offer maybe a shared reading group, or a knitting circle, or what? Yeah, and they are much more vulnerable to kind of come and go, because they are dependent on one person who may or may not continue, may or may not have funding, and so the offering is constantly shifting. You know, it's a much wider, much more fluid and dynamic offering, and so having somebody who is aware of that community of providers, as it were, being kind of knowledgeable, that's not something that a doctor would have time to do. To know, you know, does this service still exist? You know, can I prescribe you to here or there? That's why I think that the link worker is not just somebody who is working for or with the patient. He's also somebody who's working with the community of artists and prescribers who are offering their services.
Which maybe can be taken over by larger cultural institutions, kind of grouping artists that can offer these kind of interventions, and maybe in a cultural center offer a series
access
of...
to care in many ways. I mean,
Yeah.
this is like a different access to care model than the UK existing one. I'm sure your model has some merits, ours doesn't, but it's also cultural, diversified, I suppose, and we do. Do you think it could be exported model?
I think so. And actually, that's one of my ideas that came up, that maybe we could together organize a big event in the European Parliament. You would actually talk about your project and also, of course, other things, so that we can actually raise again and again. We have to do that all the time, the importance of culture and health. And this would be a wonderful example now that you have the results and outcomes. And push further the agenda.
I want to add something on all we heard about the last 5 minutes. It wasn't like about the beneficiaries, and it wasn't about the institutes. We had to do the work together. We are a small country, and this is, I think, good on that level, because all that small mental health centers, which there are all over Athens and Thessaloniki, send the patients and the beneficiaries. And so it wasn't so complicated. Another issue is that we have social prescribing policy since 1980. So some kind of link workers go to the theater, they gave free tickets for theaters and for vacations, for this, for that, but it had no use on the level of sense of self and on the level of interaction and social connection and be engaged on well-being. So that's why
there is a need for a model that is a Greek model, right? That's something that has worked very well, and this needs to be celebrated and scaled up in other countries that may have relevant cultural institutions that can support it. Just to add, the link worker in the UK is based in primary care. It's based in a pathologist, in a GP's surgery. That doesn't exist. I cannot imagine that happening in the UK, in Greece, right? But I can see a link worker in a museum. I can see them based, you know, if the link worker is something that you want to take forward, that would be based in different and connecting health with the cultural sector and the people in the community.
One thing, and I know we're reaching the end, but maybe just one final thought, also connecting some dots here, because I don't know to what extent you have had the opportunity to map things that are happening anyway in Greece that that fall under this umbrella of arts and health. And the platform that Creative Europe created and the call for applications, we've talked about this a few times, essentially ended up being a bit of a mapping in a lot of different countries. So I would definitely encourage you to have a conversation. You mentioned, Greece was one of the top 4 applicant countries. So you probably have dozens, if not 100, of applications from Greece of people who are doing arts and health, or who think that they are doing arts and health work, but who are probably not captured in your system at the moment.
Oh, we're sensitized because of the project.
Yeah, happy to.
So, Margarita, who's over here, and who should also be celebrated, because without the Ministry of Culture and Margarita's efforts, we would not be here today, right? Should like to mention that. Is telling us that we should actually have a lunch now and break. So thank you very much, everybody, for being here, especially Cornelia, Niels, Professor Karki. Thank you so much for being here.
Thank you, and congratulations again.
Τώρα. Παρακαλώ την προσοχή σας, η επόμενη ομιλία ξεκινά τώρα.
Καλησπέρα σας. Λοιπόν, στο πρόγραμμα μας ήρθε η ώρα να μιλήσουν οι συνάδελφοί μου οι ψυχίατροι. Και ήταν πολύ σημαντικό για μας να ενσωματώσουμε στο πρόγραμμά μας και να ακουστεί η φωνή των συναδέλφων μου. Για πολλούς και διαφορετικούς λόγους. Εγώ θα ξεκινήσω από τον πρόσφατο που, αν θέλετε, κάπως θεσμοθετεί πια την ενεργητική του συμμετοχή στην συνέχιση του προγράμματος της πολιτισμικής συνταγογράφησης στην Ελλάδα. Ακούσαμε από τα χείλη των Υπουργών Πολιτισμού και Υγείας προχθές το καταπληκτικό καινούριο νέο: θεσμοθετήθηκε η πολιτισμική συνταγογράφηση σε μια συμπληρωματική θεραπεία για την ψυχική υγεία στην Ελλάδα. Ανοίγει ένας καινούριος δρόμος. Στη διαδικασία αυτή, τη μελλοντική, έχουν ένα πολύ πρωταγωνιστικό ρόλο οι συνάδελφοί μου, οι ψυχίατροι. Και ο ρόλος τους είναι να ξεκινήσουν τη διαδικασία μέσα από τη συνταγογράφηση. Επομένως, στην αλυσίδα με τους πολλούς ακόμα γνωστοί οι περισσότεροι κρίκοι που θα αποτελέσουν τη μελλοντική εφαρμογή αυτού του πρωτοποριακού έργου, του πρωτοποριακού εθνικού έργου. Γεια σου, Μαργαρίτα, οπότε σε βλέπω. Ναι, έλα και εσύ, γιατί όσο τόσα εγώ, όσο τόσα και εσύ. Λοιπόν, οι συνάδελφοί μας είναι που θα ανοίξουν την καινούργια προοπτική της πολιτιστικής συνταγογράφησης μέσα από την συνταγογράφηση. Είναι πολύ σημαντικό να ενημερώσουμε τους συναδέλφους που πιστεύω ότι ακόμα δεν γνωρίζουν πολύ καλά το ρόλο που πρόκειται να παίξουν στο επόμενο πρόγραμμα και στη συνέχιση αυτού του προγράμματος. Και προφανώς είναι οι κύριοι αντιπροσωπευτές από τον κόσμο της ψυχικής υγείας. Λοιπόν, μαζί μας είναι εξαιρετικοί συνάδελφοι που δεν θα καταθέσουν απλώς τις θεωρητικές τους τοποθετήσεις γύρω από την εισαγωγή αυτού του καινούριου παραδείγματος, αλλά θα μιλήσουν βιωματικά, γιατί όλοι συμμετείχαν στις δράσεις, κάποιες από αυτές τις δράσεις της πολιτιστικής συνταγογράφησης. Και Ήταν εξαιρετικά σημαντική. Εδώ ήταν η συνεδρία, όσοι από εσάς την παρακολουθήσετε, υπέροχη, συγκινητική, για το όφελος, για τους ωφελούμενους μας που ήρθαν και μίλησαν, για το πώς ήταν οι αποδέκτες αυτού του προγράμματος. Και έδωσε, νομίζω, αυτό το συγκινησιακό βάθος στην ιστορία. Ότι όλη αυτή η προσπάθεια γίνεται να ενισχύσουμε την ποιότητα ζωής τους. Οι συνάδελφοι ψυχίατροι, λοιπόν, θα παίξουν αναμφίβολα πολύ σημαντικό ρόλο από εδώ και πέρα στη συνέχιση του προγράμματος. Ας τους ακούσουμε. Λοιπόν, έχετε βάλει μεταξύ σας κάποια σειρά? Θα ήθελα να ξεκινήσει κάποιος πρώτος. Ηλία, εσύ ή από την
Εγώ μία μικρή εισαγωγή, γιατί είμαι στην πλευρά των οικοδεσποτών, όπως και εσείς. Να σας καλωσορίσω και εγώ από την πλευρά μου. Να μοιραστώ μαζί σας ότι πέρα από το εξαιρετικό συνέδριο, το ρόλο του κυρίου Στεφανή, το ρόλο της κυρίας Αλεξομανολάκη σαν κορυφές στο θέμα ψυχική υγεία, παύλα πολιτισμός, τη σύμπραξη, την παρουσία τόσων καλλιτεχνών χθες και λειτουργών ψυχικής υγείας που ήταν σαν ανθισμένος κήπος, το λέω στο κύριο Τσιναρίδη, της κυρίας Σελάκοβιτς που ήταν χθες, ότι είναι ένα καταπληκτικό momentum όπου βλέπουμε πλέον ότι η τέχνη από μόνη της και μέσα από έρευνες που μας παρουσιάστηκαν από τους συγκεκριμένους εξωτερικούς προσκεκλημένους, ότι η τέχνη αποτελεί μια εισάξια μορφή θεραπείας, όχι μόνο στο διαδικαστικό με την έννοια της κοινωνικής συμμετοχής, παύλα νίκην, παύλα ενσωμάτωσης, παύλα αποστιγματοποίησης, αλλά και στο περιεχόμενο, με την έννοια ότι ανοίγει ακόμα νέα ενδιαφέροντα, τα οποία όμως αποτυπώνονται τελικά και σε συναπτογένειες, δηλαδή και σε νευροβιολογικό επίπεδο που μας ενδιαφέρει εμάς αυτό. Δηλαδή ότι δεν είναι νέους νευρώνες δεν αποκτούμε, νέες συνάψεις όμως και νέους δενδρίτες και νέα κλαδιά των δενδριτών αποκτούμε. Και με αυτή την έννοια παίζει και θεραπευτικό, αλλά και προληπτικό, μάλλον να το πω αντίθετα, και θεραπευτικό ρόλο. Καλωσορίζοντας σας λοιπόν εδώ να πω ότι είναι εξαιρετικό γιατί έχουμε εκπροσώπηση και από 2 συμμετέχοντες ως senior ψη, 3 συμμετέχοντες, συγγνώμη, γιατί με τη Μυριάννα μπερδεύω για το κλινικό μέρος, που είναι εξίσου λοιπόν. Έχουμε 3 συμμετέχοντες, όπου θα μοιραστούν την εμπειρία τους μαζί μας, ως senior ψη στις καλλιτεχνικές δράσεις που αναπτύχθηκαν στην πρώτη και δεύτερη πιλωτική φάση, καθώς και 2 παραπέμπουσες, οι οποίες... λοιπόν, να ξεκινήσω. Η κυρία Σελάκοβιτς, ψυχίατρος, επιμελήτρια στο Σισμανόγλιο. Η κυρία Βάλια Καραγιώργα, παιδοψυχίατρος και ψυχίατρος ενηλίκων και άμυστο επίκουρο προσωπικό στην Αμερική σε πανεπιστήμιο και επίσης ηθοποιός και κλασική τραγουδίστρια. Ο κύριος Τσιναρίδης, ψυχίατρος, ιδιώτης της Θεσσαλονίκης, που συμμετείχε στην καταπληκτική παράσταση «Τα παπούτσια του άλλου», μαζί με την κυρία Νασλίδου που είδαμε προχθές. Η κυρία Ευαγγελία Ψαρά, επιμελήτρια στο Κέντρο Ψυχικής Υγείας Παγκρατίου, που έκανε πάρα πολλές παραπομπές. Και η κυρία Γεωργοπούλου, η οποία έχει αναπτύξει στον Ευαγγελισμό ένα ιατρείο ψυχοδυναμικής ψυχοθεραπείας και η οποία και η ίδια συνετέλεσε πολύ στις παραπομπές. Ένα από τα ζητούμενα, λοιπόν, ξεκινώντας αυτή την κουβέντα, είναι σαν αν σε αυτό το momentum οι ψυχίατροι μπορούν να πάρουν επάνω τους τη διαδικασία και θα ήθελα να μοιραστείτε την εμπειρία σας μαζί μας. Να ξεκινήσουμε εξεβονίμων με την κυρία Σελάκοβιτς, που ήταν στο Ίδρυμα Μιχάλης Καγωγιάννης μαζί με την καταπληκτική κυρία Ευαγγελάκου, που είναι εδώ σήμερα, τη σκηνοθέτηδα. Να τη... Ωραία. Συνεργάστηκαν στο πρόγραμμα. Οπότε ο λόγος είναι σε εσάς. Επειδή έχουμε 1 ώρα, θα έλεγα να το μοιράσουμε. Είμαστε 5, δηλαδή 10 λεπτά ο καθένας. Ναι, ναι.
10 λεπτά. Ακούγομαι. Καλησπέρα σας από μένα. Είμαι πάρα πολύ ενθουσιασμένη που σήμερα είμαι εδώ. Γιατί περάσαμε μια φοβερή διαδικασία, 6 μήνες, κάναμε 2 δράσεις, 3 μήνες, με την κυρία Ευαγγελάκου, με την κυρία Ναχοπούλου και με την κυρία Στολάτη, οι οποίες ήταν πολύτιμες συνεργάτηδες. Κάναμε μια πολύ ωραία ομάδα, που αυτό φάνηκε στις ταινίες που δημιουργήθηκαν και μπορείτε να δείτε στο πρώτο όροφο. Είναι μια ταινία 10 λεπτών και 3 ταινίες 1 λεπτού που δημιούργησαν δικοί μας ωφελούμενοι, κάνοντας την θεραπεία μέσω κινηματογράφου. Εγώ θέλω πρώτα να ευχαριστήσω εσένα, Ηλία, τον κύριο Στεφανή, που μου δώσατε αυτή τη ευκαιρία, γιατί εγώ κάποτε στη ζωή μου ασχολήθηκα με τέχνη, με κλασικό μπαλέτο, αλλά με κινηματογράφο δεν έχω ασχοληθεί. Όμως η κυρία Ευαγγελάκου μας έβαλε όλους στο κλίμα πάρα πολύ γρήγορα και απογειώσαμε τη δράση. Πώς την απογειώσαμε? εκεί που είχαμε 12 εβδομάδες για κάθε ομάδα και αρχικά είχαμε σκεφτεί να υπάρχει το ψυχοεκπαιδευτικό κομμάτι, όπου τα μάθουν τα βασικά για το κινηματογράφο, πώς γίνεται κινηματογράφος, όπου τα βλέπουμε ταινίες μικρού και μεγάλου μήκους, όπου κάθε ένας τα τοποθετείται σχετικά με συγκεκριμένες σημαντικές σκηνές, τα συναισθήματα που έχουν αναπτύξει. Το πήγαμε πολύ παραπέρα. Δεν ήταν μόνο δράση κινηματογράφου, ήταν και δημιουργία κινηματογράφου. Φτιάξαμε ταινίες, έμαθαν πώς να κάνουν κάμερα, πώς να παίζουν ως ηθοποιοί, πώς να τραβάνε σημαντικές σκηνές, πώς κάθε σκηνή είναι αξιοποιήσιμη. Και από όλα αυτά προέκυψαν τις ταινίες που τους τρέχουμε όλες αυτές τις μέρες και μπορείτε να τους δείτε, όπου οι δικοί μας ωφελούμενοι δεν ήταν απλά συμμετέχοντες, ήταν και δημιουργοί. Και αυτό θέλω να τονίσω, γιατί στην τέχνη, εκτός να τη παρακολουθούμε και να έχουμε μία παθητική συμμετοχή, είναι σημαντικό να έχουμε και μία ενεργή συμμετοχή, να μπουν στο ρόλο του δημιουργού. Και όταν βλέπουν το δικό τους έργο, να το αξιολογούν. Τι έγινε με το κινηματογράφο? Ο κινηματογράφος μας έδωσε ένα μεταβατικό χώρο, όπου κάθε ένας μπόρεσε να αναπτύξει τη φαντασίωσή του, μπόρεσε να ελευθερώσει τα συναισθήματά του, μπόρεσε να εκφράσει την γνώμη του χωρίς να κάνει κριτική, και μπόρεσε να συνειδητοποιήσει και να αποκτήσει επίγνωση στην ανθρώπινη ευαλωτότητα και ομορφιά ταυτόχρονα. Και αυτή η ομορφιά φάνηκε στο αποτέλεσμα. Εγώ προσωπικά είμαι πολύ ευγνώμων, γιατί έζησα το μεγαλείο της ψυχοθεραπείας μέσω τέχνης. Είμαι συστημικού τύπου ψυχοθεραπεύτρια και έχω ζήσει διάφορες καταστάσεις σχετικά με τη ψυχοθεραπεία, και αυτή τη φορά ήταν κάτι άλλο, ένα άλλο επίπεδο, όπου βλέπεις μια ομάδα η οποία δένεται από τρίτη-τέταρτη συνεδρία και στις 12 συνεδρίες έχουν κάνει μια ταινία 10 λεπτών, που αυτό, αν πάρετε τους επαγγελματίες, δύσκολο βγαίνει. Μπορείτε να φανταστείτε με τους ανθρώπους που είναι ερασιτέχνες και έχουν έρθει για θεραπευτικό σκοπό σε αυτή τη δράση. Αυτό ήταν πάρα πολύ μεγάλο. Από την άλλη πλευρά, εγώ είμαι κλινική ψυχίατρος. Είμαι επιμελήτρια σε μια δημόσια ψυχιατρική κλινική, όπου εκεί αντιμετωπίσουμε το σκληρό κομμάτι της ψυχιατρικής. Οι δικοί μας θεραπευόμενοι ήταν ασθενείς με διάγνωση ψύχωσης, οι οποίοι όχι μόνο που βελτίωσαν τη λειτουργικότητά τους, έβγαλαν το καλύτερο εαυτό. Και η λειτουργικότητά τους, δεν ξέρω στον GAD πόσο τα πήγαινε, αν όχι 100%, σίγουρα 90%. Άρα αυτό είναι Ναι, GAD είναι μια κλίμακα που εκτιμά τη λειτουργικότητα των ανθρώπων. Άρα είναι κάτι πάρα πολύ σημαντικό να μπει στη κλινική πρακτική. Να μπορούμε τους δικούς μας ασθενείς, εκτός να δίνουμε φαρμακευτική αγωγή, να τους εντάξουμε σε μια θεραπεία όπως είναι Art Therapy, γιατί έχει το εκπαιδευτικό κομμάτι, έχει το βιωματικό κομμάτι και έχει πολύ καλό θεραπευτικό κομμάτι, που κάθε ένας θα το εκδηλώσει με τον τρόπο του. Άρα σεβόμαστε την ιδιότητα κάθε από τους θεραπευόμενους μας και σεβόμαστε το ανθρώπινο δυναμικό που έχει κάθε ένας. Δεν είναι όλοι ίδιοι, δεν είναι όλη διάγνωση. Ευχαριστώ.
Ευχαριστούμε πολύ, κυρία Σελάκοβιτς. Να κάνω μία διευκρίνηση που προήλθε από την προηγούμενη τράπεζα και είναι η κυρία Edith, η οποία Πέρες, που μας βοήθησε σε αυτή. Εμένα προσωπικά με βοήθησε πολύ, γιατί ήταν ένα ζητούμενο και ένα θέμα συζητήσεων, η διαφορά μεταξύ ψυχοθεραπείας μέσω τέχνης και τέχνης ως συμπληρωματική αγωγή στη ψυχική υγεία. Και μας είπε η κυρία Πέρες ότι το συνόψε δηλαδή πολύ ωραία και μου έγινε για μένα πολύ ευκρινές, ότι η τέχνη όταν γίνεται εκτός πλαισίου πάβει να είναι θεραπεία. Δηλαδή ακόμα και η θεραπεία μέσω τέχνης. Σε ένα πλαίσιο πάλι ο άνθρωπος πηγαίνει για τη θεραπεία του, εκεί πηγαίνει για την τέχνη. Το οποίο είναι διαφορετικό και καταλαβαίνουμε ειδικά στις βαριές περιπτώσεις ψύχωσης που αναφερθήκατε, πόσο αποστιγματιστικό είναι το να νιώθει άνθρωπος ότι πηγαίνει σε άλλο χώρο. Και κάνω αυτή τη διευκρίνηση επειδή πολλές φορές μπλέκουμε τους όρους, όπως αναφερθήκατε. Είναι τέχνη αυτόνομη. Ήθελα επίσης, πριν έκανα μια πρώτη εισαγωγή για την κυρία Καράγιοργα, να πω πόσο μας βοήθησε στις ζυμώσεις και διεργασίες, γιατί αυτό το πρόγραμμα ήταν πρωτότυπο, στήθηκε από το 0 σε θέματα ασφάλειας. Η κυρία Καράγιοργα, επειδή είχε μέσα στη συζήτηση θέσατε θέματα πολύ ουσιαστικά, μας έκανε και εμάς τελικά να νιώσουμε πιο ασφαλείς, ενσωματώνοντας δικλείδες ασφαλείας, που στην πορεία δεν είδαμε κάτι ακραίο, αλλά σε περίπτωση που υπήρχε, μας βοηθήσατε πολύ και θέλω να σας ευχαριστήσω.
Εγώ θέλω να σας ευχαριστήσω, κύριε Βλάκο, καταρχάς για την υπέροχη διοργάνωση και εσάς και τον κύριο Στεφάνη για την πρόσκληση και την τιμή που μας κάνετε να μπορούμε να ακουστούμε και να πούμε την εμπειρία μας, αλλά για αυτή την υπέροχη διοργάνωση και τις τόσο ενδιαφέρουσες συζητήσεις σε αυτό το πρωτοποριακό συνέδριο. Όσον αφορά αυτό που είπατε, κύριε Βλάχο, εσείς με βοηθήσατε, γιατί σε περιστατικά που είχαμε, που υπήρχε ένας κίνδυνος, ένας μικρός κίνδυνος, ένα μικρό ερωτηματικό, αμέσως δράσατε εκτός ωραρίων, δηλαδή ήταν η Κυριακή, θυμάμαι, που σας είχα πάρει τηλέφωνο. Αμέσως πήρα τη συνάδελφο, συνοηθήκαμε, τα πράγματα πήγανε πολύ ομαλά. Οπότε, εγώ σας ευχαριστώ. Καλησπέρα σε όλους. Εγώ λέγομαι Βάλια Καράγιοργα. Είμαι εδώ γιατί συμμετείχα στο πρόγραμμα Θέατρο και Θεραπεία του Εθνικού Θεάτρου, στο πρώτο και στο δεύτερο τρίμηνο. Είναι εδώ μαζί και η καλλιτέχνης της δράσης, την οποία ευγνωμονώ, γιατί χάρη σε αυτήν γίνανε πάρα πολλά πράγματα, αλλιώς δεν θα γινόντουσαν, αν δεν υπήρχε η έμπνευσή της. Θα ξεκινήσω λέγοντας ότι όσον αφορά τη δική μου εμπειρία σε αυτή τη δράση ως ψυχιάτρου, ήταν κάτι το πολύ ενδιαφέρον και το κάπως ενδιαφέρον και αμήχανο μαζί. Γιατί καθώς μπαίνεις μέσα στην αίθουσα του Εθνικού, δηλαδή ως ψυχίατρος συνήθως, όταν έχουμε έναν άνθρωπο απέναντί μας, ακούμε ιστορίες στην κλινική συνέντευξη και τα πράγματα που σκεφτόμαστε είναι να σκανάρουμε διαγνώσεις, να κάνουμε συμπεράσματα, να δούμε ποια κριτήρια του DSM έχουν, ποια είναι η θεραπεία τους, ποιο είναι το θεραπευτικό πρωτόκολλο. Δηλαδή, ακούγοντας έναν άνθρωπο, σκεφτόμαστε διαγνώσεις. Εκεί όμως, καθώς έμπαινα μέσα στο Rex και στο Chiller και συμμετείχα σε αυτή την καταπληκτική πρωτοβουλία και την ομάδα στο Θέατρο και Θεραπεία, δεν καλούμουν να λειτουργήσω ως κλινική ψυχίατρος. Εκεί δηλαδή η διάγνωση πήγαινε πίσω και έβγαινε μπροστά ο άνθρωπος. Ο άνθρωπος που ήθελε να εκφραστεί. Αυτό δηλαδή που είναι και το ζητούμενο της τέχνης. Δηλαδή η τέχνη δεν ζητάει από τον άνθρωπο να εξηγήσει τον εαυτό του. Αυτό που ζητάει είναι απλά να εκφραστεί. Επομένως, αυτός ο ρόλος, το ότι εγώ δεν έκανα διαγνώσεις, δεν έπρεπε να δώσω θεραπείες, ήταν κάτι πολύ διαφορετικό στον τρόπο με τον οποίο συμμετείχα σε αυτό το πρόγραμμα και να σας πω και την αλήθεια και πολύ ανακουφιστικό στο τέλος. Και πολύ δημιουργικό. Έχω και τις σημειώσεις μου, μην ξεχάσω να πω κάποια πράγματα. Αλλά ποιοι ήταν αυτοί, ποιοι ήταν οι συμμετέχοντες στο πρόγραμμα του Εθνικού Θεάτρου. Είχαμε ομάδες από 40 μέχρι 65 ετών, δηλαδή ο μέσος όρος ηλικίας ήταν 51 στο πρώτο τρίμηνο και 55 στο δεύτερο, που είχαν αρκετά σοβαρή λειτουργική έκπτωση και διαγνώσεις όπως οι περισσότεροι ήταν με σχιζοφρένεια, με σχιζοσυναισθηματικές διαταραχές, διπολική διαταραχή. Υπήρχαν άνθρωποι που είχαν ποινικά μητρώα προηγουμένως. Επομένως, καταλαβαίνω ότι εμένα ο ρόλος ως ψυχίατρος σε μια τέτοια ομάδα, που δεν ήμουν κλινική ψυχίατρος, ήταν απλά να εξασφαλίσω ότι πώς μια τόσο ετερογενής ομάδα, με τόσες διαφορές στη λειτουργικότητά του, στον τρόπο έκφρασης, στον τρόπο σύνδεσης, πώς θα μπορούσε να είναι μια ομάδα με συνοχή, που θα μπορούσε μαζί να δημιουργήσει και να υπάρξει με ασφάλεια. Δηλαδή, εμένα το πρώτο μου μέλημα ήταν να μπορεί να υπάρχει αυτή η ασφάλεια, αυτή η αίσθηση ότι εδώ μπορούμε να εκφραστούμε, δεν θα κριθούμε, θα μας αποδεχθούν για αυτό που είμαστε. Ταυτόχρονα όμως θα τηρηθούν και κάποια όρια ανάμεσα στα μέλη, για να μπορέσει να υπάρξει δημιουργία και να εξελιχθεί. Δηλαδή, εμένα αυτό που συνέχεια περνούσα από το μυαλό μου και το συζητούσαμε με την καλλιτέχνη της ομάδας και με τους junior καλλιτέχνη και δραματοθεραπευτή, ήταν τρία βασικά στοιχεία. Δηλαδή, πώς θα διευκολύνουμε την έκφραση των συναισθημάτων, με έναν τρόπο όμως που θα έχει και ένα πλαίσιο προστατευτικό. Γιατί η τέχνη μπορεί να είναι πάρα πολύ έντονη εμπειρία συναισθηματικά. Επομένως, έπρεπε να διασφαλίσω από την πλευρά μπροστά μου ότι θα γίνει με έναν τρόπο που δεν υπάρχει μια τεράστια συναισθηματική ένταση, μια τεράστια συναισθηματική διέγερση που μπορεί να ταράξει την ομάδα. Μιλήσαμε, όπως είπε και ο κύριος Βλάχος, και για τα guidelines, ας πούμε, της προστασίας και της διαχείρισης της διέγερσης. Δηλαδή, ασχοληθήκαμε με τα Vita guidelines που μιλάνε για την λεκτική αποκλιμάκωση, για το πώς μπορούμε να έχουμε όρια, να θέσουμε κανόνες. Όλα αυτά τα είπαμε στην αρχή. Βεβαίως, ναι. Και το κάναμε. Όμως, κύριε Βλάχο, το ενδιαφέρον ήταν ότι όλα αυτά δεν πολύ χρειάστηκαν. Δεν πολύ χρειάστηκαν, ναι. Γιατί η αλήθεια είναι ότι εμείς αυτά τα guidelines στα ψυχίατρη τα έχουμε για τις νοσοκομιακές νοσηλίες και χρειάζεται να τα έχουμε για να προστατεύσουμε τους υπόλοιπους συμμετέχοντες. Αλλά καταλάβαμε ότι μέσω της διαδικασίας της δημιουργικής στο θέατρο, πολύ λίγα πράγματα από αυτά χρειάστηκαν, ωστόσο σίγουρα χρειάζονται για να το έχουμε ως backup. Και ήταν ενημερωμένοι και οι καλλιτέχνες γι' αυτό και όλη η δράση, το λέω γιατί η κυρία Κοντογιώργη ήταν αυτή που σχεδίασε την καλλιτεχνική, έγινε μέσα από αυτό. Δηλαδή, χρησιμοποίησαμε σαν αφορμή το όνειρο θερινής νύχτας του Σέξπιρ. Δηλαδή, έφτιαξε ακόμα και τους διαλόγους με έναν τρόπο που να μην είναι ερεθιστικός, δηλαδή να μην είναι μπερδευτικός. Να προσπαθήσουμε όσο μπορούμε να υπάρχει ένα επίπεδο μη δυσλειτουργικής διέγερσης. Και το άλλο είναι, το τρίτο πράγμα που πάντα είχαμε στο μυαλό μας, και εγώ προσωπικά ως ψυχίατρος, να υπάρχει μια συνοχή στην ομάδα, δηλαδή να υπάρχει ένα αίσθημα του ανήκειν, να υπάρχει ένα σεβασμός, να μπορούν να αισθάνονται οι άνθρωποι ότι μπορούν να εκφραστούν και κανείς δεν θα τους κρίνει. Ότι είναι αποδεκτό αυτό που έχουν να φέρουν και όχι απλά είναι αποδεκτό, αλλά είναι ζητούμενο και αξιοθαύμαστο. Επομένως, εμένα ο ρόλος μου μέσα σε αυτή την ομάδα ήταν αυτός. Δηλαδή, ούτε συνταγογραφούσα, ούτε έβγαζα διαγνώσεις, ούτε σκεφτόμουν θεραπευτικά πρωτόκολλα. Προσπαθούσα να διασφαλίσω αυτή την ασφάλεια για την συναισθηματική έκφραση στο πλαίσιο και την συνοχή. Να μπορούν αυτοί οι άνθρωποι που ήταν τελείως από ετερόκλητες ηλικίες, μέρη, διαγνώσεις, να μπορούν να νιώσουν ότι είναι ένα όλο, μέλη μιας ομάδας. Και εδώ όπως είπε και ο κύριος Βλάχος, εγώ έχω μια διπλή ιδιότητα και έχω την τύχη να έχω εκπαιδευτεί και ως ηθοποιός πέρα από ψυχίατρος, οπότε γνωρίζω και τους δύο κόσμους. Μπορώ να δω δηλαδή την κατάσταση και μέσα από το θεραπευτικό δωμάτιο και από τη σκηνή. Και αυτό που πάντα μου κάνει εντύπωση είναι ότι ένας άνθρωπος μπορεί να εκφράσει πολύ αυθεντικά τον εαυτό του, δηλαδή πολύ πιο αυθεντικά μέσα από ένα ρόλο που παίζει, παρά μέσα από μια κλινική συνέντευξη. Και νομίζω ότι αυτή ήταν και η μεγάλη σημασία της δράσης που κάναμε στο Εθνικό Θέατρο. Αυτό μπορούμε να το εξηγήσουμε και ως ψυχίατροι, είναι αυτό που ορίζει, ας πούμε, ο Winnicott ως μεταβατικό χώρο. Αυτό το transitional space, το οποίο είσαι και δεν είσαι. Που μπορείς να πεις μια προσωπική σου αλήθεια και ταυτόχρονα να μην την πεις ξεκάθαρα ότι αυτή είναι δική σου προσωπική αλήθεια. Αυτό έβλεπα να γίνεται. Δηλαδή, έβλεπα τον τρίτο χώρο του Winnicott που βλέπουμε στη θεραπεία να γίνεται μπροστά μου και με τη συνδρομή των καλλιτεχνών και τη συναδέλφου Junior Ψ. Και ξέρουμε ως ψυχίατροι ότι ο μηχανισμός αυτός της δημιουργίας είναι ένας από τους βασικούς παράγοντες. Δηλαδή, όταν μπορεί κάποιος να δημιουργήσει, όταν χρησιμοποιεί αυτούς τους νευρώνες, αυτά τα pathways της δημιουργίας, ενώ τα κυκλώματα του εγκεφάλου, αυτός είναι ένας από τους μεγαλύτερους παράγοντες ψυχικής ανθεκτικότητας. Αυτό έβλεπα να γίνεται μπροστά μου. Ένα πράγμα που θέλω να σας πω είναι ότι σκεφτόμουν τη διαδικασία που βιώσαμε μέσα στα εργαστήρια του Εθνικού Θεάτρου, τα οποία δεν τα ονομάσαμε δραματοθεραπεία. Ήταν θέατρο, καθαρά θέατρο. Δηλαδή, η κυρία Κοντογιώργη και η κυρία Κυριακού, που ήταν οι καλλιτέχνες, εκπαίδευαν τους συμμετέχοντες σε πραγματικές υποκριτικές τεχνικές συνεργασίας και έκφρασης. Και σκεφτόμουν τον ορισμό του Αριστοτέλη για την αρχαία τραγωδία και το πόσο πολύ έμοιαζε αυτός ο ορισμός με αυτό που εμείς βιώναμε εκείνη την ώρα, αυτούς τους 6 μήνες που είχαμε μπροστά μας αυτούς τους συμμετέχοντες. Που λέει ότι είναι μίμηση πράξεως και ότι διελαίου και φόβου οδηγεί στην κάθαρση. Δηλαδή, μέσα από φέροντας τις ιστορίες. Δηλαδή, οι αρχαίοι Έλληνες τι έκαναν? Έβλεπαν αυτές τις συγκρούσεις με τον εαυτό τους, με τον Θεό, τα συναισθήματά τους, τις ματαιώσεις. Πάρα πολύ ακραία και δύσκολα συναισθήματα, αλλά μέσω αυτών των ιστοριών που φέρανε στη σκηνή και του κοινού που βίωνε αυτή την εμπειρία των συναισθημάτων, οδηγούμασταν στην κάθαρση. Εδώ νομίζω ότι έχει πολύ μεγάλη διαφορά αυτό που εμείς βιώσαμε στο Εθνικό Θέατρο με τον ορισμό της τραγωδίας. Οι άνθρωποι μέσα σε αυτόν τον ασφαλή χώρο που νιώθαν ότι δεν τους κρίναμε, που νιώθαν ότι είναι αποδεκτοί, που νιώθαν ότι μπορούν να εκφραστούν, ότι ανήκουν κάπου, πραγματικά φέρναν τις προσωπικές τους συγκρούσεις και ιστορίες και κάπως έτσι μπορούσαν να τις μεταμορφώσουν. Και όταν δηλαδή, αυτό θέλω να πω ότι θεωρητικά, όταν μπορείς την προσωπική σου ιστορία και την ψυχολογική σου σύγκρουση να τη φέρεις μπροστά και κάπως να τη μετασχηματίσεις σε δημιουργία, να τη μεταμορφώσεις, αυτή η μεταμόρφωση νομίζω ότι πλησιάζει πάρα πολύ σε αυτό που ως ψυχίατροι ονομάζουμε θεραπεία ή ευελιξία μέσω της ψυχοθεραπείας. Τώρα, όσον αφορά το τι είδαμε στην ομάδα, εμένα αυτό που μου έκανε φοβερή εντύπωση μέσα στις 12 εβδομάδες που είχαμε την κάθε ομάδα συμμετεχόντων ήταν ότι αρχικά οι άνθρωποι ήρθανε ως ασθενείς που συμμετείχαν σε αυτό το πρόγραμμα. Αργότερα, σιγά-σιγά άρχισαμε να βλέπουμε περισσότερη συναισθηματική έκφραση, περισσότερη πρωτοβουλία. Γιατί οι καλλιτέχνες τους έβαζαν και να σκηνοθετούν. Δεν ήταν μόνο σκηνοθετούμενοι, ήταν και οι ίδιοι σκηνοθέτες. Δηλαδή, σκηνοθετούσαν και οι ίδιοι ιστορίες. Δεν συμμετείχαν μόνο από την πλευρά του ηθοποιού. Είχαν περισσότερη πρωτοβουλία και περισσότερη συνεργασία. Δηλαδή, βλέπαμε να νιώθουν ότι είναι μια ομάδα, δεν υπήρχε ανταγωνισμός, υπήρχε μια τεράστια στήριξη και προστασία του ενός μέλους προς το άλλο. Επίσης, ήθελα να πω ότι δεν υπήρχαν αποχωρήσεις καθόλου στο δεύτερο τρίμηνο. Δεν είχαμε καμία αποχώρηση σε σχέση με το πρώτο. Και να το πω ότι αυτό ίσως είχε να κάνει και με τη δική μας εμπειρία και την ασφάλεια και την ηρεμία που νιώθαμε. Και δεν υπήρχαν και απουσίες. Είχαμε πάρα πολύ λίγες απουσίες στο δεύτερο τρίμηνο. Το οποίο για τέτοιες ομάδες δείχνει τεράστιο βαθμό εμπλοκής σε μια τέτοια δράση. Και θυμάμαι και έναν συμμετέχοντα που πραγματικά είχε πολύ μεγάλη έκπτωση λειτουργικός, δεν μπορούσε να εκφραστεί, δεν συμμετείχε σχεδόν καθόλου. Κάποια στιγμή άρχισε να αυτοσχεδιάζει σε μια υποκριτική άσκηση που του είχε βάλει η κυρία Κοντογεωργή και πραγματικά ξεσπάσαμε όλοι σε γέλια. Ήταν τόσο συνδεδεμένος μαζί μας που μας έκανε εντύπωση. Αυτές οι μικρές στιγμές, αυτές οι μαγικές στιγμές οδηγούσαν την ομάδα σιγά-σιγά να συνδέεται και να συνδέεται και να συνδέεται, χωρίς καμία κοροϊδία ή επίκριση. Αυτό, νομίζω ότι το σημαντικό πράγμα που έγινε είναι ότι σιγά-σιγά οι συμμετέχοντες οδηγούνταν σε μια αλλαγή ταυτότητας. Ήρθαν ως ασθενείς, αλλά εξελισσόταν η συμμετοχή τους σε ανθρώπους που ήταν μέλη μιας ομάδας, σε δημιουργούς και σε ρόλους, χαρακτήρες, σε υποκριτές ή σκηνοθέτες. Αυτό νομίζω ότι ήταν η πιο σημαντική διαδικασία σε αυτή την εμπειρία τους και σε αυτό που εμείς και που εγώ ως ψυχιάτρος έβλεπα. Τελειώνω τώρα. Ωραία, τελειώνω. Εντάξει. Μια ιστορία που μας είχε πει ένας συμμετέχον στο τέλος στην εικαστική απεικόνηση, γιατί οι άνθρωποι αυτοί εκπαιδεύονταν σε ρόλους, σε σκηνές, σε αυτοσχεδιασμούς και στο τέλος έπρεπε να καταγράψουν την εμπειρία τους σε μια απεικόνηση εικαστική. Και έγραψε ένας από τους συμμετέχοντες κάτι περίπου, θα σας το πω, δεν μπορώ να σας το πω ακριβώς. Έγραψε σε όλη μου τη ζωή, αισθανόμουν ότι έπρεπε να είμαι κάποιος άλλος. Με κατηγορούσαν ότι είμαι κάποιος άλλος και κάποιος άλλος και ότι έπαιζα θέατρο στη ζωή μου. Και κατέληξε σε αυτό που έγραψε, ότι στο τέλος συνειδητοποίησα ότι αυτός ο κάποιος άλλος ήμουν πάντα εγώ. Και αυτό με έκανε να σκεφτώ, δηλαδή με εντυπωσίασε, γιατί με έκανε να σκεφτώ ότι τελικά σε αυτές τις δράσεις αυτό που είχε σημασία για τον συμμετέχοντα δεν ήταν να μιλήσει για την ασθενειά του, αλλά ήταν να του δοθεί, να του επιτραπεί να υπάρξει για λίγο ως κάποιος άλλος. Και. Πού? Θα πάω να το δω. Το είδα, καταλάβατε για ποιον λέει. Δεν μπορώ να πω παραπάνω, αλλά και εμάς μας είχε συγκινήσει πολύ αυτό που είδαμε να γράφει. Όπως και άλλα πράγματα, όπως μας λέγανε η χαμογελαστή Τρίτη, γιατί συναντιόμασταν Τρίτες 5 με 7. Αλλά θα πάω τώρα να το δω αυτό. Αυτό μας είχε συγκινήσει, γιατί δείχνει ότι μέσω του να είναι κάποιος άλλος, και αυτή είναι και η μαγεία του θεάτρου, και αυτό νομίζω είναι και το πιο σημαντικό πράγμα που δώσαμε και βιώσαμε σε αυτά τα εργαστήρια, είναι ότι μέσω του να είσαι κάποιος άλλος, ανακαλύπτεις κάτι πιο αληθινό για τον εαυτό σου. Δηλαδή, έρχεσαι πιο κοντά σε σένα και στη σύνδεση με τους άλλους. Και για να καταλήξω, αν με ρωτούσατε τι πήρα ως ψυχίατρος από αυτό, είναι ότι σίγουρα, σαφέστατα, δεν μπορεί η τέχνη να αντικαταστήσει την ψυχιατρική θεραπεία. Δεν μπορεί να αντικαταστήσει την φαρμακοθεραπεία, ούτε τις ψυχοθεραπευτικές τεχνικές. Όμως μπορεί να κάνει κάτι εξίσου σημαντικό. Να ξαναθυμίσεις στους ανθρώπους αυτούς και σε εμάς ότι υπάρχουν και είναι κάτι πολύ παραπάνω από την ασθένειά τους. Αυτή δηλαδή η υπενθύμηση της ταυτότητας πέρα από τη διάγνωση. Αυτό νομίζω ότι ήταν το πιο ευεργετικό, το πιο μαγικό πράγμα που κρατάω και που το έβλεπα να συμβαίνει εβδομάδα τη βδομάδα μαζί με τους συναδέλφους που σχεδιάσαμε τη δράση. Αυτά.
Σας ευχαριστούμε πολύ, κυρία Καράγιοργα. Έχει ενδιαφέρον γιατί μέσα από τους διάφορους ομιλητές αυτές τις μέρες ακούμε και κάποιες φράσεις πραγματικά μας δίνουν σε όλους μας και νέα ερεθίσματα. Αυτό που είπατε, ότι το να είναι ο ρόλος ή το να μπαίνει σε ένα ρόλο, τον απελευθέρωνε από το πλαίσιο της κλινικής συνέντευξης, το οποίο είναι πιο στατικό και πιο δεσμευτικό που πας έχοντας τη ταυτότητα του ασθενή. Ακριβώς. Σας ευχαριστούμε πολύ. Μία παράκληση από τους διερμηνείς. Τα είπατε εξαιρετικά και τόσο συμπυκνωμένα. Αν μπορούμε να μιλάμε λίγο πιο αργά για τη διερμηνία. Ευχαριστούμε πάρα πολύ. Ο κύριος Τσιναρίδης, τον κύριο Τσιναρίδη τον γνωρίσαμε προχθές στην καταπληκτική παράσταση «Τα παπούτσια του άλλου». Είχαμε μια ολόκληρη συνεδρία, όπου είδαμε μια καταπληκτική όπερα του κύριου Ξανθούλη, όπου και οι επαγγελματίες ψη, πέρα από τους καλλιτέχνες, συμμετείχαν ως ηθοποιοί και χοροδοί σε αυτή την παράσταση. Μοιραστήκατε μερικά πράγματα προχθές, θα θέλαμε τώρα και μέσα από το βλέμμα του ψυχιάτρου, γιατί ένας σκοπός αυτού του τραπεζιού τελικά είναι να δούμε και τις δυσκολίες εφαρμογής και μετάβασης σε ένα τέτοιο πρόγραμμα.
Σε ευχαριστώ πολύ. Να πω αρχικά ότι ήταν πάρα πολύ βοηθητικό να είχα ακούσει την τοποθέτηση της κυρίας Καράγιοργα πριν ξεκινήσω, γιατί ξεκινώντας είχα αρκετά έντονα αυτό το ερώτημα, το ποιος ακριβώς είναι ο ρόλος μου εδώ ως ψυχίατρος. Δεν κάνουμε θεραπεία, δεν τρέχω κάποια ομάδα, δεν είμαι θεράπων ιατρός. Τι ακριβώς κάνω? Και προτού έρθει η πρώτη ομάδα με τους ωφελούμενους, με ρωτάει η σκηνογράφος μας ότι έχω ετοιμάσει εδώ πέρα τις δράσεις, θα φτιάξουμε το σκηνικό, θα φτιάξουμε τα κοστούμια κτλ. Μπορούν να χρησιμοποιήσουν αιχμηρά αντικείμενα? Και εκεί κάπως μου δόθηκε η απάντηση ότι εδώ είναι ο ρόλος, να απαντήσω τέτοια ερωτήματα και ότι, όπως το βίωσα εγώ τουλάχιστον, ο ρόλος του ψυχιάτρου είναι να δράσει σαν ενδιάμεσος, σαν γέφυρα και σαν αυτός ο οποίος πλαισιώνει, έτσι, και δημιουργεί την ασφάλεια και δημιουργεί το χώρο στον οποίο μπορούν να δράσουν. Γιατί όντως ο πυρήνας είναι η τέχνη, είναι η δράση, ο καλλιτέχνης, η επαφή του ωφελούμενου με την τέχνη, αλλά όλο αυτό χρειάζεται ένα πλαίσιο για να μπορεί να γίνει όντως με ασφάλεια και να ευοδοθεί όλο αυτό. Στην πορεία, ο ρόλος έγινε κάπως διτός, γιατί αποφασίσαμε εξ αρχής ότι όλοι οι ειδικοί ψη, εγώ και Ρενάς Λίδου, αλλά και οι καλλιτέχνες, θα είμαστε πάνω στη σκηνή που ήταν το τελικό αποτέλεσμα. Ότι κάναμε ένα χοροδιακό εργαστήρι, το δικό μου κομμάτι, με το σκοπό να γίνει στο τέλος η παράσταση. Και αποφασίσαμε ότι θα τραγουδάμε κανονικά, θα συμμετέχουμε στη χοροδία, θα είμαστε πάνω στην παράσταση, μαζί με τους ωφελούμενους. Που η αλήθεια είναι ότι αρχικά ήρθε από ένα χώρο ανησυχίας και άγχους. Μπορεί να προκύψει κάτι, να χρειαστεί γίνει μια διαχείριση κρίσης, μια αποκλιμάκωση. Κάτι μπορεί να συμβεί πάνω στη σκηνή, να είμαστε παρόντες. Δεν χρειάστηκε. Αλλά μέσα από αυτό ήρθε και μια διαφορετική σύνδεση και μια διαφορετική σχέση με τους ωφελούμενους. Ότι είχαμε ένα διτό ρόλο και πλαισιώνουμε, δημιουργούμε την ασφάλεια, δημιουργούμε αυτό το πλαίσιο, αλλά και είμαστε μαζί. Τραγουδάμε μαζί, εκτιθέμεθα μαζί στο βλέμμα του κοινού, που ήταν μια ανησυχία των ωφελούμενων αρχικά, ότι είναι παράσταση, δεν έχω τραγουδήσει ποτέ, δεν έχω μια φήμη το τραγούδι. Και σε αντίθεση με εσάς, και εγώ το μοιράζομαι αυτό, ήμουνα ο πιο παράφωνος και με μηδενική επαφή με το ρυθμό, το οποίο θεωρώ ότι μάλλον βοήθησε και τους ωφελούμενους. Ναι, οπότε μέσα σε όλο αυτό δομήθηκε και μια διαφορετική εγκύτητα, ένα διαφορετικό ανήκειν που, πέρα από το πρακτικό κομμάτι, έχει ίσως και ένα συμβολισμό, ότι ο ψυχίατρος, που το ψυχιατρικό βλέμμα μπορεί να έχει βιωθεί με πολλούς τρόπους από τους ωφελούμενους, από τα άτομα ψυχική νόσο, ότι ο ψυχίατρος είναι εδώ μαζί μου. Δρούμε μαζί και το βιώνουμε όλο αυτό μαζί, που θεωρώ ότι και συμβολικά έχει επίσης ένα νόημα. Από εκεί και πέρα, για την θεραπευτική δράση όλου αυτού, για το αποτέλεσμα στους ωφελούμενους, έχουμε ήδη μιλήσει, τοποθετήθηκαν οι συνάδελφοι πάρα πολύ και την πρώτη ημέρα. Θα μείνω ξανά στο πόσο έντονο συναισθηματικά ήταν όλο αυτό. Η επαφή, η σύνδεση και το πώς, αυτό που είπατε κι εσείς, το πώς όλο αυτό έδωσε ένα νόημα και μια κατεύθυνση ότι μαζί συμπορευόμαστε, μαζί συμπλέουμε και ότι μπορεί να βιώσει και τον εαυτό του ως άτομο το οποίο παράγει, το οποίο δημιουργεί, το οποίο μπορεί να εκτεθεί και αυτό είναι οκ. Και πάλι με ένα...
Και έχει δυνατότητα.
Ναι, και ότι έχει δυνατότητα. Ακριβώς. Αυτά από μένα. Ίσως έχει νόημα.
Σας ευχαριστούμε πάρα πολύ.
Ίσως και προς το τέλος της συζήτηση θα ήθελα και όποιος από κάτω είναι να μοιραστεί ίσως το κομμάτι, αν έχουμε χρόνο, αν κάποιος άλλος ειδικός ψυχικής υγείας, το πώς βίωσε τη δικιά του την σύμπραξη με το καλλιτεχνικό κομμάτι. Θα είχε ενδιαφέρον. Συγγνώμη αν ξεφεύγω.
Ευχαριστούμε πολύ. Να περάσουμε στην κυρία Λίλη Ψαρά, φίλη ετών από την εποχή του πρώτου σχολικού επεισοδίου με τον κύριο Στεφανή στο Γεννήτο και τώρα πάλι μετερίζει ως παραπέμπους από το Κέντρο Ψυχικής Υγείας Παγκρατίου. Λήπτες υγείας, ωφελούμενους στο πρόγραμμα και με πολύ έτσι, ενεργή συμμετοχή, όπως και η κυρία Γεωργοπούλου.
Καλησπέρα και από μένα. Μεγάλη χαρά που βρίσκομαι εδώ μαζί σας. Μεγάλη χαρά που έχει ξεκινήσει όλο αυτό το πρόγραμμα που πρόκειται για μια αλλαγή παραδείγματος στην ψυχιατρική και στην ιατρική γενικότερα. Ο Θανάσης ο Τζαβάρας έλεγε ότι η ζωή προχωράει εκεί που η επιθυμία συναντάει τη συγκυρία. Φαίνεται πως υπήρχε επιθυμία και από εμάς τους επαγγελματίες ψυχικής υγείας, αλλά και από τους ανθρώπους της τέχνης και από τον κόσμο γενικότερα, για τη δημιουργία ενός μεταβατικού χώρου με την έννοια που δίνει ο Winnicott, ενός χώρου τέχνης, δημιουργικότητας και θεραπείας. Ειδικά σήμερα που φαίνεται ότι συρρυκνώνεται η ψυχική ζωή. Ψυχική ζωή σημαίνει διεργασία. Μέσα από τις δράσεις της πολιτιστικής συνταγογράφησης ευνοείται η συνάντηση του ενδοψυχικού με το διαψυχικό της ομάδας, του εσωτερικού με το εξωτερικό, του ατομικού με το συλλογικό. Αυτή η συνάντηση παίρνει ένα χαρακτήρα δυναμικής σχέσης. Πρόκειται για μια σχέση διαρκούς αλληλεπίδρασης που δημιουργεί το αναγκαίο αίσθημα ασφάλειας και εμπιστοσύνης. Μέσα σε αυτό το οικείο περιβάλλον, η τέχνη παρέχει στη θεραπεία τη δυνατότητα να χρησιμοποιεί τη δική της γλώσσα και να εκφράσει μέσα από αυτή όλα όσα δεν μπορεί να εκφράσει με το λόγο. Αυτό το μεταβατικό χώρο τον ανακαλύπτουν, αλλά και τον δημιουργούν διαρκώς τα μέλη της ομάδας. Αυτό είναι πάρα πολύ σημαντικό, γιατί υπάρχει αυτή η διαδικασία της ανακάλυψης και της συνδημιουργίας. Και τον δημιουργούν ως δυνατότητα, ως ανατροπή, ως άνοιγμα στο νέο και στο απρόβλεπτο, αλλά και ως μετάβαση σε ένα καινούργιο τρόπο ζωής. Και εμείς ως επαγγελματίες ψυχικής υγείας που ερχόντουσαν μετά οι ωφελούμενοι και συζητάγαμε για την δράση, γινόμασταν και εμείς κοινωνία αυτής της δημιουργίας και όλης αυτής της ανακάλυψης. Και εμπλουτίστηκε η θεραπευτική σχέση, καθώς δόθηκε η δυνατότητα διερεύνησης της υποκειμενικής εμπειρίας και του ψυχισμού μέσα από διαφορετικά πρίσματα. Υπήρχε μία αμεσότητα στη θεραπεία με διαφορετικές σκηνές να φωτίζονται. Και μεγάλη σημασία έχει η ενεργητική συμμετοχή του θεραπευόμενου στην πράξη της δημιουργίας, τόσο της δικής του όσο και των άλλων. Η κουλτούρα, όπως και το εγώ, δεν συγκροτείται μέσα στον καθρέφτη, αλλά μέσα στο βλέμμα του άλλου. Η συμμετοχή στο κοινωνικό γίγνεσθε θεάθηκε ως όρος κατάκτησης της προσωπικής αυτονομίας. Σκοπός μας ως επαγγελματιών ψυχικής υγείας, ως ψυχιάτρων, δεν είναι μόνο η εξάλειψη των συμπτωμάτων, αλλά η κατάκτηση της αυτονομίας από τους θεραπευόμενούς μας. Να πω επίσης πως μέσα σε αυτό το οικείο περιβάλλον πάρα πολλοί θεώρησαν ότι βρίσκονταν πίσω στην παιδική του ηλικία. Αισθάνθηκαν πολλοί, μου είπαν ότι θεωρούσαμε αυτή την ασφάλεια και αυτή την οικειότητα που είχαμε όταν ήμασταν παιδιά και όταν παίζαμε. Είναι σημαντικό ότι, όπως είπε και ο Winnicott, ότι ο άνθρωπος μπορεί να επικοινωνεί μόνο παίζοντας. Και έτσι μέσα από το παιχνίδι μπορεί το άτομο να δημιουργεί, να κινητοποιεί εκφραστικές ικανότητες και να ανακαλύπτει διαρκώς τον εαυτό του. Είναι πάρα πολύ σημαντικό το ότι μεταφέρανε αυτό το μεταβατικό χώρο και σε εμάς, στο δικό μας δηλαδή θεραπευτικό πλαίσιο. Κάθε φορά που θα συζητάγαμε για τις δράσεις της πολιτιστικής συνταγογράφησης, μου λέγανε πόση χαρά αισθανόντουσαν και πόσο ενθουσιασμό και ότι αυτό δεν ήταν κάτι που είχε σταματήσει εκείνη τη στιγμή, αλλά μπορούσαν συνέχεια αυτό να το αναβιώνουν και να το φέρουν μέσα στην θεραπευτική σχέση και να την εμπλουτίζουν έτσι με νέες πτυχές. Με πολύ προσμονή περίμενα και εγώ να δω τα έργα τους. Τους ευχαριστώ πάρα πολύ που μοιραζόντουσαν τα έργα τους μαζί μου. Και μέσα από αυτό φωτιζόταν πολύ περισσότερο η θεραπευτική σχέση και αποκτούσε έτσι πολύ ενδιαφέρον. Να πω ότι πολύ σημαντική ήταν και η σταθερότητα του πλαισίου και των συναντήσεων ως προς τον τόπο και τον χρόνο που τους προσέδιδε ένα τελετουργικό χαρακτήρα. Είναι αυτό που έλεγε η Αλεπού στο Μικρό Πρίγκιπα, ότι σε όλα χρειάζεται μία τελετή. Θα ήταν πιο καλά να έρχεσαι πάντα την ίδια ώρα. Αν έρχεσαι όμως όποτε και να είναι, δεν θα ξέρω ποτέ ποια ώρα να φορέσω στην καρδιά μου τα καλά της. Οι άνθρωποι λοιπόν φοράγανε τα καλά τους κάθε φορά που πήγε και μας το λέγανε αυτό, ότι είναι η συγκεκριμένη μέρα, η Τετάρτη, που χαίρομαι πάρα πολύ, που θα πάω, ότι το περιμένω πώς και πώς και τι θα γίνει τώρα που θα τελειώσει η δράση και τι θα κάνω. Φοράγανε λοιπόν τα καλά τους. Και αυτό συνεχίστηκε και μετά και μεταφέρθηκε και στην θεραπευτική σχέση. Υπήρχε λοιπόν αυτός ο ενθουσιασμός, αυτή η προσμονή και είχε εμπλουτιστεί η θεραπευτική σχέση και επαναβιώνανε όλες αυτές τις θετικές συγκινήσεις. Ήτανε το μαγικό ότι αυτός ο μεταβατικός χώρος μεταφερότανε και στη δικιά μας θεραπεία μετά. Μέσα λοιπόν από την ανακάλυψη και την εξερεύνηση αποκτούσαν ένα νέο βλέμμα πάνω στα πράγματα και εμείς μαζί τους και πραγματοποιούσαν ένα άνοιγμα στον κόσμο και στον εαυτό τους. Και για μας, και θεωρώ ότι και εμάς μας βοήθησε πάρα πολύ αυτή η έκθεση. Επίσης, βλέπω την κυρία Ραμαντάνη, να πω ότι ευχαριστώ πάρα πολύ τους ανθρώπους από τους φορείς πολιτισμού έτσι, που συνεργαστήκαμε. Τους ευχαριστώ θερμά γιατί φροντίσανε πάρα πολύ τους ανθρώπους που στείλαμε. Φαινόταν αυτό το ενδιαφέρον τους κάθε φορά και για διάφορες δύσκολες καταστάσεις που περάσαν θεραπευόμενοι. Ήταν συγκινητικό το ενδιαφέρον. Για μένα ήταν πολύ μεγάλη ικανοποίηση το ότι υπήρχε αυτή η φροντίδα και αισθανόντουσαν οι άνθρωποι αυτό το αίσθημα ασφάλειας να εκτεθούν και να ανακαλύψουν καινούργιες πτυχές έτσι του εαυτού τους και να δουν τον εαυτό τους όχι ως μία διάγνωση, αλλά να δουν την ταυτότητά τους, να ανακαλύψουν πλευρές της ταυτότητάς τους. Όπως έλεγε και ο Μισελ Λομπρό, η επιθυμία είναι σαν το ορυκτό που πρέπει να το ανακαλύψει κανείς. Θεωρώ ότι μέσα από τις δράσεις της πολιτιστικής συνταγογράφησης η λειτουργία της τέχνης μπορεί να συμβάλλει σε μια τέτοια ανάγνωση μέσα από το θεραπευτικό πλαίσιο. Και θα τελειώσω με μια φράση του Μπλανσό, ότι δεν έχουμε παρά μόνο μια δυνατότητα να ξεφύγουμε από το θάνατο, να κάνουμε τέχνη πριν από αυτόν. Ευχαριστώ πολύ.
Ευχαριστούμε πολύ, κυρία Ψαρά. Και Έχει ενδιαφέρον να πούμε ότι τόσο από τους ψυχιάτρους συντελεστές των δράσεων, όσο και από τους παραπέμποντες, έχουμε την ίδια αντίχηση. Δηλαδή και από τις δύο πλευρές η ίδια αντίχηση έρχεται σε σχέση με την αυτονομία, με την ενσωμάτωση, με τη χαρά. Να συστήσω την κυρία Γεωργοπούλου, επιμελήτρια Α στον Ευαγγελισμό, διευθύντρια του γραφείου που η ίδια έχει δημιουργήσει ψυχοδυναμικής ψυχοθεραπείας στα εξωτερικά ιατρεία του Ευαγγελισμού, και να μοιραστώ κιόλας, γιατί ο χώρος δεν είναι αμιγώς ψυχιατρικός. Είναι και της τέχνης, ότι με την εγώ τη Γεωργοπούλου είμαστε στον ίδιο τεχνικό θεατρικό θίασο. Και πέρυσι ανεβάσαμε, για όσους το είδανε, τη μύδια του Μπόστο, που κατά σύμπτωση και αυτό ψυχαναλυτικό, εγώ έπαιζα τον Ιδίπποντα και εκείνη την Αντιγόνη. Οπότε...
Και μέλη του κλάδου τέχνη και ψυχιατρική.
Και μέλη του κλάδου τέχνη και ψυχιατρική. Σήμερα έχουμε ένα αφιέρωμα. Θα φύγουμε από εδώ μετά. Σας καλούμε με τη δίκη του Κάφκα που θα παρουσιαστεί στο Τριανόν εδώ στη γειτονιά. Κυρία Γεωργοπούλου, υπήρξε επίσης, να πούμε, από το ρόλο του ψυχιάτρου, βασική παραπέμπουσα του προγράμματος, με πολυάριθμες παραπομπές. Ευχαριστούμε γι' αυτό.
Ευχαριστώ πολύ τον κύριο Στεφανή, τον κύριο Βλάχο και την κυρία Γιαννούλη για την τιμητική πρόσκληση να μιλήσω από την οπτική των ψυχιάτρων πάνω στο θέμα. Σκέφτομαι ότι αν προσπαθήσουμε να συναρθρώσουμε τον επιστημονικό λόγο με τον λόγο των καλλιτεχνικών δημιουργών και να προσεγγίσουμε ψυχαναλυτικά καταρχάς τη φύση της δημιουργίας, θα έρθουμε σημασιολογικά αντιμέτωποι με την έννοια της μετουσίωσης ως όριμης ψυχικής άμυνας που υπησέρχεται κατεξοχήν στη διάθεση της τέχνης και της δημιουργίας του πολιτισμού. Η ίδια η πράξη του σκέπτεστε, όπως μας λέει ο Φρόιντ το 1923, απορρέει από τη μετουσίωση της ερωτικής ορμικής δύναμης. Είναι μια διαδικασία που αφορά στη λίμπιντο αντικειμένου και συνίσταται στο ότι η ενόρμηση κατευθύνεται σε άλλο σκοπό, απομακρυσμένο από τη σεξουαλική ικανοποίηση. Ειδικότερα, ως διέξοδος, επιτρέπει την ικανοποίηση των απαιτήσεων του υποκειμένου, χωρίς να επιφέρει την απόθυση, μέσω ανάκαμψης της λίμπιντο στο εγώ, γεγονός που οδηγεί στην αποσεξουαλικοποίησή της. Με τον τρόπο αυτό επιτυχάνεται η επίτευξη θαυμαστών πολιτιστικών επιδόσεων που πραγματοποιούνται από τη μετουσίωση όλο και πιο υψηλού βαθμού των ενορμητικών συνιστοσών, συμβάλλοντας έτσι στη δημιουργία ενοποιημένων οντοτήτων μέσω εναρμόνισης με τον πρώτιστο σκοπό του έρωτα, που είναι η ένωση και η σύνδεση. Υπό αυτή την έννοια, η μετουσίωση θεωρείται από τον Φρόιντ εξαρτημένη από την αρκισιστική διάσταση του εγώ, ενώ, όπως γράφει στο έργο του «Η δυσφορία μέσα στον πολιτισμό» το 1930, είναι ένα ενορμητικό πεπρωμένο που αποσπάει εκβιαστικά ο πολιτισμός, αφού κάθε πολιτισμός βασίζεται στην παραίτηση από τις πιο πρωτόγονες ορμικές μας αξιώσεις. Κάθε τέχνη, όπως σημειώνει νωρίτερα, το 1927, στο σύγγραμμά του «Το μέλλον μιας αυταπάτης», προσφέρει υποκατάστατες ικανοποίησεις για τις πανάρχιες πολιτισμικές παραιτήσεις, που ακόμα και σήμερα γίνονται βαθιά αισθητές, και έτσι είναι μοναδική στο να δρά συμφιλιωτικά με τις θυσίες που έχουν γίνει για χάρη του πολιτισμού. Από την άλλη πλευρά, τα δημιουργήματά της αυξάνουν τα αισθήματα ταύτισης που τόσο χρειάζεται κάθε πολιτισμική σφαίρα, δίνοντας... Πιο αργά. Πιο αργά. Ναι. Που χρειάζεται κάθε πολιτισμική σφαίρα, δίνοντας την ευκαιρία για αισθήματα που θα βιωθούν από κοινού και θα εκτιμώνται από όλους. Επιπλέον, στο έργο του «Ο ποιητής και η φαντασίωση» το 1907 επισημαίνει ότι αν εμβαθύνουμε στην ιδιοσυγκρασία του καλλιτέχνη, θα διαπιστώσουμε ότι ένα ισχυρό εναισθητικό βίωμα του δημιουργού αφυπνίζει την ανάμνηση ενός προγενέστερου βιώματος, συνήθως της παιδικής ηλικίας, όπως είπατε, που εκπληρώνεται μέσα στο έργο, όπου υπάρχουν αναγνωρίσιμα στοιχεία τόσο της πρόσφατης αφορμής, όσο και της παλιάς ανάμνησης. Δηλαδή, παρελθόν, παρόν και μέλλον μοιάζουν να είναι αναρτημένα στη σειρά, στο νήμα της επιθυμίας που τα διατρέχει. Οι κινητήρες δυνάμεις των φαντασιώσεων του καλλιτέχνη είναι οι ανικανοποίητες επιθυμίες και κάθε επιμέρους φαντασίωση είναι η εκπλήρωση μιας επιθυμίας. Μια επανόρθωση της δυσάρεστης πραγματικότητας, στην οποία ο δημιουργός προσπαθεί να παρέμβει και ιδεωδώς να μετασχηματίσει. Έτσι, μετριάζοντας το χαρακτήρα των εγωιστικών του ονειροπολίσεων, αλλάζοντας και μεταμφιέζοντάς τις, μας δωροδοκεί με το δέλεαρ ενός τυπικού, δηλαδή αισθητικού κέρδους από ευχαρίστηση που μας προσφέρει, την οποία ο Φρόιντ αποκαλεί προειδονή. Κατά την παρουσίαση των φαντασιώσεων του, ένα τέτοιο κέρδος διευκολύνει την αποδέσμευση ακόμα μεγαλύτερης συντονής από βαθύτερες ψυχικές πηγές, επιτρέποντας την απελευθέρωση των ψυχικών συγκρούσεων ή εντάσεων του θεατή. Το ψυχολογικό μυθιστόρημα οφείλει χωρίς αμφιβολία την ιδιαιτερότητά του στην τάση του σύγχρονου συγγραφέα να διασπά το εγώ του, μέσω αυτοπαρατήρησης σε πολλά επιμέρους εγώ, με αποτέλεσμα να προσωποποιεί τις αντικρουόμενες τάσεις της δικής του ψυχικής ζωής σε περισσότερους από έναν ήρωες, διευκολύνοντας τις ταυτίσεις του θεατή μέσω ενδοβολών, προβολών και προβλητικών ταυτίσεων. Με έναν τέτοιο τρόπο γινόμαστε για κάποια στιγμή, για λίγο, κάποιος άλλος. Ναι, 7 λεπτά. Τελειώνω σε 2 λεπτά. Με τον τρόπο αυτό, ο καλλιτέχνης διαπραγματεύεται πολλαπλά τους όρους της επιθυμίας, αλλάζοντας το αντικείμενο επένδυσης, γεγονός που ερμηνεύει τη θεραπευτική επίδραση του έργου του, όπως και τη θεραπευτική αξία της τέχνης γενικότερα. Ο Γιούγκ, από την άλλη πλευρά, εστίασε στα συλλογικά αρχέτυπα και σύμβολα στην τέχνη, ως εκφράσεις του συλλογικού ασυνείδητου που συμβάλλουν στην ολοκλήρωση του ατόμου μέσω επεξεργασίας των συλλογικών ή διαγενεαλογικών τραυμάτων. Αν πάμε πίσω τώρα στην ιστορία, για να συνδεθούμε περισσότερο με το σήμερα, η αρχαία τραγωδία ξεκίνησε τον 6ο αιώνα, όπως γνωρίζουμε, στην Αθήνα, με τις πρώτες παραστάσεις, όπως γνωρίζουμε, να λαμβάνουν χώρα στα Διονύσια. Τον 5ο αιώνα του Περικλή είναι η χρυσή εποχή της αρχαίας τραγωδίας, με μεγάλους ποιητές όπως τον Αισχύλο, τον Σοφοκλή και τον Ευρυπίδη, οι οποίοι μας συγκινούν διαχρονικά μέχρι σήμερα και οι οποίοι επέτρεψαν στη σκέψη του Φρόιντ, θέτοντας τα θεωρητικά θεμέλια της ψυχανάλυσης. Μάλιστα, υπήρχε και ένα θεωρικό, όπως λεγόταν, επίδομα, που κάλυπτε το κόστος των εισιτηρίων για τις ασθενέστερες κοινωνικο-οικονομικά τάξεις, έτσι ώστε όλοι οι πολίτες να έχουν πρόσβαση σε αυτές. Ο Αριστοτέλης στα ποιητικά του αναλύει την τραγωδία ως μίμηση πράξεως, σπουδαίας και τελείας, που οδηγεί στην κάθαρση, διελαίου και φόβου, όπως υπόθηκε, δηλαδή σε ψυχικό επίπεδο μέσω συναισθηματικής εκτόνωσης και ανακούφισης, λόγω ταύτισης με τους χαρακτήρες, η οποία οδηγεί στην εσωτερική επίλυση των συγκρούσεων και στην ηρεμία. Στο πλαίσιο αυτό, κατανοούμε ότι επιτυγχάνεται η σύζευξη πολιτισμού και ψυχικής υγείας. Και εδώ έχει εφαρμογή εμπροκειμένου η ιδέα της πολιτιστικής συνταγογράφησης, η οποία με κάποιο τρόπο αναβιώνει, κατά τη γνώμη μου, και δεν ξέρω αν υπόθηκε αυτό προηγουμένως, τα θεωρικά. Ειδικότερα, η πολιτιστική συνταγογράφηση ως καινοτόμως πρακτική φέρει βαθιές ιστορικές ρίζες και έχει ως στόχο την ανάδειξη του ρόλου των τεχνών και του πολιτισμού στην προαγωγή της ψυχικής υγείας και ευεξίας. Στο πεδίο της δημόσιας πολιτικής βασίζεται στη διατομεακή συνεργασία πολιτισμού, υγείας και κοινωνικής φροντίδας. Και εδώ υπησέρχεται στον τομέα της υγείας και η προσωπική μου εμπλοκή ως υπεύθυνη των τακτικών εξωτερικών ιατρίων του Ευαγγελισμού το 2023, στην πρώτη πιλωτική φάση του προγράμματος, όπου μετά από πρόταση του κυρίου Βλάχου και της κυρίας Γιαννούλη που με ενθάρρυνε, δέχθηκα να παραπέμψω εν συνόλο 30 ασθενείς, που παρακολουθούσα φαρμακευτικά σε συνεργασία με τους ειδικευόμενους ψυχιάτρους του τμήματος. Το feedback ήταν εξαιρετικό, οφείλω να ομολογήσω. Διαπιστώθηκε άμεσα κλινικά η θεραπευτική επίδραση και η δύναμη της τέχνης στη βελτίωση της ψυχικής υγείας και ευεξίας. Και γι' αυτό ελπίζουμε και ακούμε με χαρά ότι το πρόγραμμα το εν λόγω της πολιτισμικής συνταγογράφησης θα συνεχιστεί και θα καθιερωθεί θεσμικά, όπως συνέβαινε και άλλοτε. Εύχομαι συγχαρητήρια σε όλους τους συντελεστές. Ευχαριστώ θερμά.
Ευχαριστούμε πολύ. Έχουμε λίγα λεπτά ακόμα, γιατί ξεκινήσαμε 3 και 5, οπότε έχουμε στην ουσία 5-10 λεπτά. Μία ερώτηση που θέλω να κάνω σε εσάς και μετά να ανοίξουμε στο κοινό, και το οποίο τέθηκε και από τους ξένους μας προσκεκλημένους, είναι η δυσκολία εμφύτευσης του προγράμματος στο σύστημα υγείας, στην καθημερινότητα, στα στερεότυπα που έχουν οι ίδιοι οι ψυχίατροι έναντι της τέχνης. Γιατί ακούστηκε και χθες που ήταν μια πολύ πλούσια συνεδρία σε σχέση με τους διάφορους πολιτιστικούς φορείς σε διάφορα μέρη της Ελλάδας, ότι σε μικρότερα μέρη, τέθηκε και από τη κυρία Άλεξο Μανουλάκη, υπήρχε η έννοια του στίγματος. Στις μεγάλες Μητροπόλεις, Αθήνα, Θεσσαλονίκη, ήταν πολύ πιο εύκολη η παραπομπή μέσα στην ανωνυμία. Στην επαρχία αυτό είχε τη διτή δυσκολία και η ψυχική υγεία και η τέχνη και πώς θα φανείς με έναν τρόπο που δεν είναι απαραίτητα θετικά ορατός. Δεν ξέρω αν θέλει να τοποθετηθείτε απέναντι σε αυτό, γιατί στην ουσία οι ψυχίατροι, οι παιδοψυχίατροι, οι παλιοί νευρολόγοι ψυχίατροι είναι αυτοί που θα συνταγογραφούν από εδώ και πέρα την τέχνη. Αν μέσα από τη δική σας εμπειρία, όχι τόσο μέσω του προγράμματος, γιατί όλοι είστε πολύ θετικοί, μέσα από το ευρύτερο βίωμα της ελληνικής πραγματικότητας, πώς το θεωρείτε αυτό, όποια ή όποιος θα ήθελε να μας απαντήσει. Και μετά να έχουμε χρόνο για λίγες ερωτήσεις από το κοινό. Θέλετε να τοποθετηθείτε?
Σίγουρα θα πρέπει να ομολογήσουμε ότι υπήρχε μια επιφύλαξη καταρχάς να παραπέμψουμε ασθενείς με ψύχωση, διπολική διαταραχή, δηλαδή σοβαρές διαγνώσεις που ενέχουν πάντα τον κίνδυνο της υποτροπής στο πλαίσιο μιας τέτοιας δράσης, όπου θα υπήρχαν και άλλοι που θα παρακολουθούσαν τα δρόμενα. Ωστόσο, όντως, η επικοινωνία, νομίζω, και η αγαστή συνεργασία διασφάλισε ένα καταρχάς αίσθημα ασφάλειας, όπως προϋπόθηκε. Και νομίζω ότι αυτό ήταν πολύ σημαντικό, γιατί πραγματικά, ενώ ας πούμε, εγώ τόλμησα να στείλω 30 ασθενείς οι οποίοι ήταν σε βαριά κατάσταση, γιατί οι ασθενείς των εξωτερικών ιατρίων ενός νοσοκομείου και πρώτης γραμμής συνήθως έχουν μία μείζωνα ψυχοπαθολογία. Δεν διαπιστώθηκε κάποια υποτροπή και αυτό ήταν το πάρα πολύ ευχάριστο, παρόλο που όμως πρέπει να πω ότι είμαστε σε συνεχή επαγρύπνηση όλοι και δίναμε τακτικά ραντεβού στους ασθενείς που είχαμε παραπέμψει σε εξωτερική βάση, ώστε να είμαστε βέβαιοι ότι όλο αυτό το πρόγραμμα θα πάει έτσι τόσο καλά όπως διαπιστώνουμε ότι πηγαίνει. Διότι όταν το ξεκινήσαμε, βεβαίως δεν ξέραμε ότι θεσμικά θα έπαιρνε κάποια θέση σε επίπεδο καθιέρωσης. Και σήμερα μάθαμε με χαρά, με πληροφόρησε ο κ. Βλάχος, ότι όντως θεσμοθετείται. Και θεωρούμε ότι θα είμαστε εκεί να συμβάλλουμε, γιατί θεωρούμε, όπως ανέφερα και ανέλησαν, έγιναν κατανοητά αυτά που είπα, μεταφράστηκαν εγκαίρως, ότι η τέχνη σίγουρα επιδρά θετικά στην κατεύθυνση της υγείας, της ευεξίας και θα πούμε και στη βελτίωση της συμπτωματολογίας μέσω των μετουσιώσεων και των ταυτίσεων και των λοιπόν διεργασιών που ψυχαναλυτικά θέλησαν να ερμηνεύσω.
Ευχαριστούμε πολύ. Κάποια άλλη...
Εγώ τι ήθελα.
Όλοι ίσως έχετε να πείτε κάτι, ναι. Ναι, όλοι έχουν να πούνε κάτι, οπότε με τη σειρά όποιος θέλει, ναι. Κύριε Τσιναρίδη, ναι.
Ναι, στη Θεσσαλονίκη αντιμετωπίσαμε αρκετή δυσκολία στο να βρούμε συμμετέχοντες, που δεν το περίμενα, είναι η αλήθεια. Είχαμε πολύ καλή συνεργασία με κλειστές δομές, με το Ψυχιατρικό Νοσοκομείο της Θεσσαλονίκης, αρκετούς δηλαδή συμμετέχοντες, πάρα πολύ ένθερμους. Είχαμε από την ψυχιατροδικαστική, που συνέβαλε πάρα πολύ στη δομή του προγράμματος.
Όπως και ο πρόεδρος της ψυχιατρικής εταιρείας, ο κύριος Μποζίκας, νομίζω παρέπεμψε πολύ κόσμο που είναι καθηγητής στο Αριστοτέλειο, ναι.
Εκεί που περίμενα ότι θα ήταν πιο βοηθητικό, αλλά εν τέλει δεν ήταν στη β' φάση της πιλωτικής, στη β' πιλωτική φάση, όπου ανοίξαμε για παραπομπές από ιδιώτες και εκεί δεν υπήρχε... Ναι,
δυστοκία που λένε, ναι. Δυστοκία.
Ναι, θεωρώ, εντάξει, ένα βαθμό είχε να κάνει με τον πληθυσμό των ωφελούμενων που είχαμε, μέσα στο ψυχωτικό φάσμα, ότι ίσως δεν αντιμετωπίζεται ιδιωτικά στον ίδιο βαθμό. Αλλά σε ένα βαθμό πιστεύω ότι έχει να κάνει με το ότι ήταν κάτι πολύ νέο, για το οποίο οι ψυχίατροι, οι ιδιώτες, αλλά και γενικότερα, ήταν κάπως απροετοίμαστοι. Ότι σε ένα πλαίσιο ίσως παραπάνω...
Γι' αυτό το είπε και η κυρία Κίς νωρίτερα, το θέμα της awareness strategies and campaigns. Ναι, ότι χρειάζεται να γίνονται έτσι καμπάνιες ενημέρωσης
και ορατότητας. Εντάξει, σε έναν πρώτο βαθμό το κάνουμε λίγο DIY, όπως μπορούμε, ατομικά.
Το οποίο είναι απαραίτητο όμως, ενημέρωση και... Ναι. Λοιπόν, οι υπόλοιποι συνάδελφοι, μια τοποθέτηση σύντομη, ναι.
Ωραία, ακούγουμε. Okay. Εγώ στην δράση που εργάστηκα δούλεψα με ψύχωση, με ανθρώπους οι οποίοι έχουν διάγνωση ψύχωσης. Μιλάμε για σχιζοφρένεια και διπολική διαταραχή. Αυτό που θέλω να πω απευθύνεται προς τους ψυχιάτρους. Μη φοβάστε να παραπέμπετε τους ασθενείς σας. Δεν τα υποτροπιάζουν. Θα τους βοηθήσει να δουλέψουν τα δικά τους πρώτο αρνητικά συμπτώματα για να μπορούν να δημιουργήσουν ένα καινούριο δίκτυο, να συνδετούν με ανθρώπους, να μιλήσουν για τις δυσκολίες τους και δεύτερο, θα ανεβάσουν τη λειτουργικότητα. Γιατί είναι πάρα πολύ σημαντικό. Εγώ εκτός που είμαι αλφα επιμελήτρια στο Σισμανόγλου, είμαι youth psychiatrist. Τι σημαίνει αυτό? Εξειδίκευση για τη ψυχιατρική νέων ανθρώπων 16 με 35 ετών, όπου αν ένας άνθρωπος 16 με 35 ετών μετά από πρώτο επεισόδιο κλειστεί στο σπίτι του, στο κρεβάτι του, θα χάσει μεγάλα κομμάτια της ζωής του. Αν ένας άνθρωπος μετά από το πρώτο επεισόδιο μπει σε μια ομάδα και εκεί βοηθητεί κάνοντας ψυχοθεραπεία όλων των ειδών και art therapy, τότε θα μπει πιο ενεργά στη ζωή του, να συνεχίζει τη ζωή του. Γιατί? Γιατί σε αυτή τη ζωή εμείς δεν διαλέγουμε τι θα μας συμβεί. Απλά διαλέγουμε πώς θα το πολεμήσουμε και πώς θα το παλέψουμε. Πάρα πολύ σημαντικό. Θέλω να σας πω και κάτι εμπειρικό αυτές 3 μέρες που έχω ζήσει. Όταν ξεκινήσαμε δράση με β' ομάδα, φτιάξαμε μία ταινία 10 λεπτών. Μέσα σε όλα αυτά με βλέπανε ψυχίατρους έτσι λίγο, την Κατερίνα και την Κοραλία. Τους αγκάλιαζαν, ήταν πολύ πιο ζεστοί μαζί τους. Εμένα με είχαν λίγο σε απόσταση. Μα λέω, γιατί εγώ είμαι κακιά, δεν δαγκώνω, δεν δέρνω, δεν κάνω τίποτα. Γιατί σε μένα έτσι. Και χτες, επειδή ήταν πάρα πολύ ενθουσιασμένοι, δώσαμε ραντεβού, περισσότεροι μαζεύτηκαν και εκεί που στην αγκαλιά χαιρετιόμασταν, στην αγκαλιά χαιρέτησαν αυτόματα την Κατερίνα και την Κοραλία, προς εμένα με κοίταζαν, λέω ναι, μπορείς να με αγκαλιάσεις, και με αγκάλιασαν. Άρα σε περνιέται αυτό εμπόδιο, δεν υπάρχει μόνο προς τη ψυχασθένεια, υπάρχει ένα στίγμα και προς τους ψυχιάτρους, άρα ελάτε να το δουλέψουμε όλοι μαζί. Με art therapy.
Ευχαριστούμε πολύ. Πολύ ωραίο. Η κυρία Καράγιοργα και η κυρία Ψαρά, μια τελευταία τοποθέτηση. Ναι, βεβαίως. Για τις δυσκολίες του εγχειρήματος, στην εμφύτευση και στην
και στο στίγμα. Ναι, το θέμα αυτό που είπατε, κυρία Βλάχο, είναι πολύ πραγματικό. Δηλαδή, όντως, στην Αθήνα το στίγμα είναι πολύ λιγότερο γιατί υπάρχει αυτή η ανωνυμία. Αλλά στην επαρχία μπορούμε όλοι να καταλάβουμε πόσο δύσκολο μπορεί να είναι για έναν άνθρωπο να συμμετέχει σε αυτή τη δράση. Αλλά...
Πιο αργά.
Ναι, ευτυχώς που μου το λέτε. Το έχω πάντα από μικρή. Νομίζω ότι αυτό που αναφέρατε στην προηγούμενη ομιλία και που είπε και ο καθηγητής ο κ. Νίκος Στεφανής στη σχέση της διεύρυνσης των κριτηρίων και της ενημέρωσης, ότι πρόκειται για συμπτώματα, δυσκολίες ψυχικές που μπορεί να έχουν να κάνουν με το οτιδήποτε. Είτε από διαταραχή σκέψης δηλαδή, έως αντίδραση σε κάποια σωματική νόσο, καρκίνο, οτιδήποτε. Δηλαδή, η διεύρυνση των κριτηρίων και αυτή η ενημέρωση, δηλαδή μια καμπάνια ενημέρωσης σε αυτούς που παραπέμπουν, αλλά και στον πληθυσμό που θα παραπεμφθεί, είναι σημαντικό. Γιατί δεν σε περιορίζει το ότι εδώ μιλάμε για μια σοβαρή ψυχική ασθένεια. Αλλά νομίζω ότι το στίγμα πολλές φορές έρχεται από το φόβο και από τη μη γνώση. Όπως έγινε και με το AIDS, δηλαδή το στίγμα του AIDS άρχισε να εξαλείφεται όταν είδαν οι άνθρωποι ότι βγαίναν οι ασθενείς από τις κλινικές και γινόντουσαν καλά. Δηλαδή τότε άρχισε να εξαλείφεται το στίγμα στην πραγματικότητα. Επομένως, για την ψυχική νόσο, βλέποντας το πόσο αυτές οι δράσεις βοηθούν στη βελτίωση των ασθενών, στο αίσθημα της σύνδεσης, του ανήκειν, του σκοπού, του νοήματος, όλα αυτά που ξέρουμε από έρευνες ότι βοηθούν στη ψυχική αναθεκτικότητα και στην δημιουργία των συνάψεων και τη συναπτογένεση και τη δημιουργία νέων οδών, αυτό σιγά σιγά θεωρώ ότι θα αρχίσει να πέφτει. Όταν δηλαδή δούνε και δεν υπάρχει το άγνωστο που το φοβόμαστε, ότι αυτό όντως βοηθάει. Αυτό νομίζω.
Ωραία, σας ευχαριστώ πολύ. Κυρία Ψαρά, κάτι τελευταίο και να έχουμε λίγα λεπτά για το κοινό, αν θέλει να θέσει κάποιες ερωτήσεις.
Εμείς στο Κέντρο Ψυχικής Υγείας Παγκρατίου είμαστε 3 ψυχίατροι και να πω ότι και οι 3 παραπέμπαμε έτσι, ανθρώπους στο πρόγραμμα της πολιτιστικής συνταγογράφησης, και ο κύριος Χρήσανθος Πουλάς και η κυρία Άλκη Μαναράκη. Και ουσιαστικά οι ασθενείς μας λέγανε ότι ήταν ένα δώρο αυτό προς εκείνους και σύμφωνα με την ηθιμοτυπία του δώρου και εκείνοι μας το επέστρεφαν. Θέλω να απευθυνθώ λοιπόν στους συναδέλφους μου ψυχιάτρους να μην φοβούνται να παραπέμψουν ανθρώπους. Είναι πάρα πολύ σημαντικό και εμπλουτίζει πάρα πολύ και την θεραπευτική σχέση και ανοίγει νέους δρόμους. Είναι ουσιαστικά αλλαγή παραδείγματος στην ψυχιατρική. Βλέπεις τον άνθρωπο όπως τις διάφορες πλευρές του και τις διάφορες εκφάνσεις της προσωπικότητάς του και δεν βλέπεις μία διάγνωση.
Θέλετε να έρθετε για το κλείσιμο, κύριε Στεφαν? Από το κοινό υπάρχουν κάποιες ερωτήσεις. Ναι, η κυρία Γιαννούλη. Εντάξει. Υπάρχει κάποια ερώτηση? Ναι. Θα μας πείτε το όνομά σας? Θα σας δώσω ένα μικρόφωνο, ναι.
Εγώ λέγομαι Κοραλία Ναχοπούλου. Ήμουν ψυχολόγος στη δράση του κινηματογράφου στο Ίδρυμα Μιχαλής Κατογιάννης. Αυτό που θα ήθελα να πω έτσι, στα σχόλια είναι ότι συμμερίζομαι πάρα πολύ αυτό που εκφράσατε σχετικά με το ποιος είναι ο ρόλος του ΨΥ σε μια τέτοια δράση. Και συμμερίζομαι επίσης τη θέση σας ότι είναι να πλαισιώνει και να δημιουργεί αυτό το χώρο ασφάλειας. Έτσι ώστε να έχει τον πρώτο χώρο ο καλλιτέχνης, που ήταν η ραχοκοκαλιά πραγματικά της δράσης, και να κάνει αυτό που ήταν η ψυχή της δράσης, δηλαδή τέχνη. Και σε σχέση με αυτό θα ήθελα επίσης ένα δεύτερο σχόλιο να κάνω για το ότι αν και η τέχνη, πιο αργά να μιλάω, αν και η τέχνη και η θεραπεία δεν ταυτίζονται, νομίζω, υπάρχουν κάποια σημεία στα οποία έρχονται πάρα πολύ κοντά, πολύ αβίαστα. Και αυτά μπορεί να είναι κάποιες κοινές λειτουργίες, όπως ενός ανθρώπου, ενός επαγγελματία που σκέφτεται πάνω στο υλικό το οποίο προκύπτει. Και νομίζω ότι αυτό το συμπυκνώνει πάρα πολύ καλά ένα σχόλιο που έκανε η Κατερίνα Ιβαγγελάκου, που ήταν η σκηνοθέτρια της δράσης. Όταν ολοκληρώθηκε το δεύτερο τρίμηνο, η ταινία η οποία γυρίσαμε και την οποία έγραψε ο ένας συμμετέχοντας, αφορούσε έναν άνθρωπο ο οποίος περιμένει στη στάση ένα λεωφορείο, το οποίο ποτέ δεν έρχεται, κάποια στιγμή θολώνει, αρχίζει μια κατάβαση και ενώ τον διώχνουν από το κτίριο, βλέπει ξαφνικά το λεωφορείο μπροστά του να περνάει και τρέχει και το προλαβαίνει. Και η Κατερίνα σχολίασε βλέποντάς το ότι ο Σίγμα εδώ μιλάει για μας. Αυτό το λεωφορείο που τρέχει να προλάβει είναι αυτό που κάνουμε εδώ, είναι η πολιτιστική συνταγογράφηση. Και σχεδόν με τα ίδια λόγια, νομίζω κάποιος από μια ψυχαναλυτική θέση θα μπορούσε αυτό να το ονομάσει η ερμηνεία της μεταβίβασης. Και λέγοντάς της αυτό, μου απάντησε με πάρα πολύ αφοπλιστικό τρόπο ότι ναι, στην τέχνη αυτό το λέμε αλληγορία.
Πολύ ωραία. Η κυρία Σκαλή και ναι.
Να κάνω μια συμπλήρωση, γιατί θα μείνουμε με την παρεξήγηση. Ο ρόλος των ψι, δηλαδή ψυχιάτρων ή ψυχολόγων, άλλο αν το πάνελ τώρα ήταν οι ψυχίατροι, δεν ήταν μόνο αυτός. Λάθος. Ούτε το κυρίαρχο ήταν η τέχνη. Η τέχνη ήταν το αφόρμημα. Ο ρόλος του ψι, που έτσι όπως τον ακούσαμε, ήταν η δισταγμή των ψυχιάτρων. Αυτό ακούω εγώ. Είχαν να κάνουν αυτό που έδωσε την ουσία των πραγμάτων, που είναι η νοηματοδότηση. Το ότι κουβεντιάζανε μεταξύ τους, τι ήταν αυτό που έγινε, τι καταλαβαίνει ο ένας για τον άλλον, πώς θαύμαζε ο ένας τον άλλον, πώς έδινε τα εύσημα ο ένας τον άλλον. Αυτό, ενώ ακούγεται απλό έτσι όπως το περιγράφω και κάποιος θα μπορούσε να πει σιγά τα ΟΑ, μπορούσαν να το κάνουν και μόνοι τους, ήταν ο κύριος ρόλος του όποιου ψι ήταν στη δράση. Τα υπόλοιπα ήταν οι φόβοι των ψι.
Ευχαριστούμε. Η κυρία έχει μία ερώτηση. Αν θέλετε να είστε σύντομοι, επειδή έχουμε περάσει το χρόνο, και να κλείσουμε.
Πρώτα απ' όλα να σας ευχαριστήσω πάρα πολύ, γιατί εντάξει, μας ενθουσιάσατε και όλο το τριήμερο, το παρακολούθησα διαδικτυακά τις δύο πρώτες μέρες. Λοιπόν, λέγομαι Μυρτώ Βουνάτσου, είμαι καλλιτεχνική διευθύντρια του World Human Forum και πέρα από αυτό θα ήθελα να μιλήσω και... World Human Forum. Θα ήθελα να μιλήσω και σαν άτομο και να κάνω μία επισήμαση και μία ερώτηση. Λοιπόν, πρώτα απ' όλα βλέπω ότι είστε εργαζόμενοι σε δημόσια νοσοκομεία και αυτό είναι πάρα πολύ ενδιαφέρον. Και η προσωπική μου εμπειρία είναι ότι επειδή οι γονείς μου είχαν περάσει χρόνο σε δημόσια νοσοκομεία νοσηλευόμενοι, τώρα έχουν αποδημήσει, η εμπειρία μου ήταν πολύ θετική. Και όλες αυτές τις ατελείωτες ώρες περιδιάβαινα τους χώρους και αυτά και έβλεπα ότι, ας πούμε, στον Ερυθρό Σταυρό υπάρχουν 2 αίθουσες συναυλιών. Άδειες, αραχνιασμένες. Στο ΚΑΤ, που επίσης νοσηλεύτηκαν, υπάρχει προβολέας για θερινό σινεμά. Έμαθα, ρώτησα ότι παλιά οι άνθρωποι που ήταν εκεί, νοσηλευόμενοι, κάνανε κυπουρική, καλλιεργούσανε. Επίσης, ότι έχει πάρκο γλυπτικής που το είδα. Αυτό που θέλω να ρωτήσω και να πω ότι εμείς θέλουμε να συμβάλλουμε όσο γίνεται σε αυτό. Πώς μπορούν αυτά τα μέρη να ξαναπάρουν εμπρός, να αναζωογονηθούν, να κινητοποιηθούν και έτσι θα βοηθηθούν οι άρρωστοι, οι συνοδοί των αρρώστων, οι γιατροί, το νοσηλευτικό προσωπικό να αποφορτιστεί, αλλά επίσης και τα παιδιά από τα σχολεία και οι υγιείς, μέσα εισαγωγικά άνθρωποι, να μην έχουμε αυτό το διαχωρισμό κοινωνία, νοσοκομείο, κάτι κακό, να είναι ένας τόπος συνάντησης που όλοι θα είναι win-win-win. Αυτό ήθελα να πω, κάπως να πάρει μπρος αυτό.
Ευχαριστούμε. Αυτό είναι εντός νοσοκομιακού πλαισίου περιγράφεται, που ήδη υπάρχουν ομάδες που γίνονται διάφορα. Εκτός αν μιλάτε για γενικά νοσοκομεία, γιατί στις ψυχιατρικές κλινικές, στα ψυχιατρικά νοσοκομεία, το ίδιο το έπιψη που εδώ οργάνωσε, προετοίμασε κλπ. Έχει πάρα πολλά προγράμματα κυπουρικής, καλλιτεχνίας κλπ. Που δίνει έτσι τη δυνατότητα στους ανθρώπους με θέματα ψυχικής υγείας. Εδώ όμως μιλάμε πιο πολύ για την τέχνη μέσα στο κοινωνικό ιστό.
Αυτό είναι art in health που περιγράφεται. Εδώ είναι... Ναι.
Ωραία. Να κλείσουμε μία τελευταία ερώτηση από την κυρία Διακοβάνου.
Ντακοβάνου λέγομαι εγώ. Εγώ ήθελα να παρατηρήσω για το κομμάτι των ορίων και του πλαισίου στο κομμάτι της σχέσης του ψυχίατρου με τον ασθενή. Έχουμε συνηθίσει γενικώς ο ψυχίατρος και ο ψυχολόγος να θέτουν ένα πλαίσιο και συνήθως και φροηδικά, έτσι, να υπάρχει μια απόσταση, δηλαδή να μην υπάρχει έκθεση. Ότι ο θεραπευτής πρέπει να είναι κάποιος ο οποίος δεν εκτίθεται. Αυτό που μας περιγράψατε τώρα και αυτό που συμβαίνει γενικά στη θεραπεία μεσοτέχνης είναι ότι ο θεραπευτής εκτίθεται. Δηλαδή, με το να συμμετέχει ο ίδιος καλλιτεχνικά, να τραγουδάει ή να παίζει θέατρο ή να παίζει μουσική, εκτίθεται ο ίδιος. Η δική μου προσωπική εμπειρία είναι ότι αυτό βαθαίνει τη σχέση. Δεν υπάρχει κανένας κίνδυνος. Αυτό ήθελα να καταθέσω και να ρωτήσω ποια ήταν και η δική σας εμπειρία και πώς θα θέλετε να το σχολιάσετε σε σχέση με μια εμπειρία που δεν έχετε εκτεθεί, έτσι, σε μια λεκτική ψυχοθεραπεία σε σχέση με αυτό.
Μπορώ εγώ να απαντήσω. Αυτό ακριβώς εννοούσα λέγοντας να συνειδητοποιήσουν, βασικά να έχουν επίγνωση της ανθρώπινης ευαλωτότητας και της ομορφιάς ταυτόχρονα. Γιατί στη βάση της ψυχοπατολογία είναι μια ευαλωτότητα, την οποία την έχουν αυτοί οι άνθρωποι, δεν τους ρώτησε κανείς αν θέλουν να την έχουν. Την έχουν. Όταν την συνειδητοποίησαν, αυτό μπόρεσε να τους πάει πάρα πολύ πίσω στη ζωή. Όμως να τους κλέψει πάρα πολύ ομορφιά από τη ζωή. Άρα αυτό που λέτε ακριβώς, και σας ευχαριστώ που το είπατε.
Ευχαριστούμε πολύ. Θα πρέπει να κλείσουμε. Έχουμε ξεπεράσει το χρόνο. Η κυρία Στεφανή. Θέλετε να μιλήσετε, κυρία Στεφανή? Θα θέλατε να μιλήσετε? Ναι, βεβαίως. Η κυρία Στεφανή, γνωστή Ελληνίδα σκηνοθέτης του κινηματογράφου.
Δεν είμαι γνωστή. Εγώ ήθελα να καταθέσω και ως έχουσα ψυχική διαταραχή, τέλος πάντων δεν ξέρω πώς λέγεται, έχοντας κατάθλιψη από μικρή, ότι θα είναι, πιστεύω, καλύτερο να, αντί να λέμε αυτοί, να λέμε εμείς. Γιατί όλοι έχουμε κάποιο είδους ψυχική ταραχή, θα έλεγα, και ότι το ζήτημα του να εκτίθεσαι θα έπρεπε να υπάρχει σε κάθε ψυχοθεραπευτική σχέση. Είτε αυτή είναι η ψυχαναλυτική βούβα, είτε είναι ένας άλλος τρόπος γνωσιακής ψυχοθεραπείας ή οποιασδήποτε ψυχοθεραπείας. Θέλω να πω, η έκθεση με οποιοδήποτε τρόπο θεωρώ ότι είναι κομμάτι της ψυχοθεραπευτικής σχέσης. Οπότε δεν είναι μόνο ο τρόπος της τέχνης, που φυσικά είναι πάρα πολύ σημαντικός και χαίρομαι πάρα πολύ που γίνεται αυτό, αλλά το εκείνοι και εμείς, δηλαδή νομίζω ότι τα όρια είναι λίγο ρευστά και ότι πιστεύω ότι και είναι λίγο ατυχής ο τίτλος «Ωφελούμενοι» και ίσως ένας τίτλος που άκουσα από συναδέλφους καλλιτέχνες που ήταν οι συμμετέχοντες. Ίσως θα ήταν ένας τίτλος που θα μπορούσατε να σκεφτείτε.
Ευχαριστούμε πολύ. Λοιπόν, οπότε κλείνουμε τη συνεδρία. Σας ευχαριστούμε πάρα πολύ για την παρουσία. Ελπίζουμε να αναδείξαμε κάποια θέματα που αποτελούν βέβαια ένα σώμα προσυζήτηση και σε καμία περίπτωση κατάληξη ή συμπέρασμα.
Όχι, μια χαρά, μια χαρά. Sorry. Έλα, Ιωάννα. Ελένη. Έλα, σου πες και στο Βασίλη. Έλα, παιδιά. Καθηγητούλη μου, έχουμε συμπεράσματα, καθηγητούλη.